किससे टेलीग्राम
उससे भी जो लास्ट होता
गुड मॉर्निंग बच्चों, होपफुली ऑल ऑफ यू आर डूइंग फाइन. So everybody of you have already started your revisions properly. ठीक है. It's more important, as I've told you last time also when I concluded the class, that now the ball is in your court. How much you revise by yourself, that's more important actually. That is going to have more importance. How much you remember, how much you are able to recall. Okay, so that matters. Apart from revisions, it is utmost important to solve MCQs also on a daily basis. Minimum 100 MCQs on a daily basis. I would request all of you now to solve here onwards. ठीक है. And priority to be given to all your FMG and NEET PG previous year questions. FMG from August 2020 onwards, and NEET PG at least last 3 to 5 years. Minimum 3, maximum 5 years of last NEET PG. That has to be targeted for. If you have time, even after solving this, or you have already solved these ones, then you can go for making custom modules and solving questions basically. Okay. But otherwise, priority always to the previous year questions. And by previous year questions, I surely do not mean beta just like remembering the answer for that particular question. Rectification or memorization is not going to help, क्योंकि मैंने जैसे बोला है बेटा that the examiner may give you the question from the same topic. That question may sound similar, but beta even if he changes one word in the question now, then also the answer tend to change, right? इसीलिए always read the explanation of that particular question beta and be thorough with that previous year topic. ठीक है. So once you're thorough with the previous year topic, then it becomes much easier basically to like integrate or to integrate, comprehend, and even to apply that knowledge in any type of question that comes from that particular topic. Clear hai? Chalo. So now let's start with surgery revision. So first thing to be clarified that today and tomorrow, whatever we will do beta, it is not at all a substitute for your main notes. ठीक है. Please remember that. I always reiterate this fact. People immediately start taking shortcuts. That's not going to help beta, because I've told you that the examination is becoming tougher day by day. First thing. Second important, surgery at least is becoming more complex. They are asking you questions from the depth of surgery, not only investigation of choice and treatment of choice, but they are rather asking you what will be the next step in management of the patient, what is going to be the complication of the surgery, right? These kind of questions are common from surgery as well, beta. Okay, so it would be required that you have to go through your main notes till the end, keep on revising and re-revising those same notes, because then you will develop a photographic memory of those, and then you will be able to easily solve the questions also. Clear about now? Today and tomorrow, that the topics we are going to discuss is obviously the most important topics for your surgery part. Okay. So today, like please remember, today and tomorrow integrated approach will be there for revision. Like for example, today I have not included few topics. Those topics will be included in tomorrow's test and discussion. Clear about? So then it will be a comprehensive one. Do not only attend today's one, or do not only attend tomorrow's. Then otherwise you'll not be able to like revise the whole subject properly. Clear about? Chalo. So now let's start beta. If I talk about first of all, let's talk about sutures. The first suture that you are able to see, bache, we know this yellowish color suture that we will be able to see in the examination, that will be called as a catgut suture. If I talk about a catgut suture beta, we know it is going to be a natural suture, and as it is a natural suture beta, we have to remember where it is derived from. तो हमें याद रखना है, it is going to be derived from beta not the catgut but rather the sheep's gut. Yes, it is derived from the sheep guts submucosa beta. It is derived from the sheep's gut submucosa basically. That has to be remembered. Next important point, it is a absorbable suture. और हमें पता है for absorbable sutures you have to remember that it will get absorbed within how much time. तो याद रखना catgut is a suture beta which is absorbed within a span of 60 days or 2 months बच्चे. And last important, हमें पता है that usually for other sutures beta there is no preservative required, but catgut is one of the sutures beta where a preservative will be required for storage of the suture, and that preservative chemical that is used to store the suture, that chemical is known as isopropyl alcohol बच्चे, right? That chemical is going to be called as isopropyl alcohol. Now You'll tell me in the chat box, beta, that catgut is a natural suture. So please tell me the method of absorption of the suture. With which method it gets absorbed? Please let me know in the chat box, jaldi se. Either it gets absorbed by enzymatic digestion or it gets absorbed by hydrolysis, beta. Please let me know. The next suture that you are able to see, beta, the purple color suture. That purple color suture that we are able to see is nothing else but a vicryl suture, bache. Right? This one over here is basically a vicryl suture. और हमें पता that vicryl is a very commonly used suture, beta, in surgery. Vicryl, which is there, it is a synthetic suture, beta. One thing to be remembered. And the another name for vicryl that we have to remember is the polygalactin suture. Vicryl is also known as a polygalactin suture, beta. Has to be remembered. Next important point to be remembered about this will be that vicryl suture, which is there, it is also an absorbable suture, and as it is an absorbable suture, you have to remember the absorption time. It usually gets absorbed within a span of 60 to 90 days, beta, that is around 2 to 3 months. Okay, it usually gets absorbed within a span of 60 to 90 days, beta. Okay, so that has to be remembered. And where is vicryl used? Previous year question of your exam, I've told you that vicryl will generally be used, beta, for the purpose of bladder or bowel repair. तो जब भी इंटरनल ऑर्गन्स दैट इज विसरा अगर रिपेयर करना हो बेटा, सो फॉर ऑल दैट ब्लैडर एंड बावेल रिपेयर और विसरल रिपेयर बेटा, यू शुड यूज वाइक्रेल इटसेल्फ. Very good. Yes. So catgut suture, as it is a natural suture, beta, and we know all natural sutures are absorbed by enzymatic digestion, whereas all the synthetic sutures, just a vicryl for example, all these synthetic sutures, beta, will be absorbed by the process of hydrolysis. Clear, Eva? Shabash. That is important to be remembered. Next important point to be remembered is about this black suture over here, bache. And if I talk about the black suture, so we know that this black suture is nothing else but a silk suture, beta. We know that silk suture is a natural suture. It is derived from silk worm itself. Okay. Second, it is a non-absorbable suture, beta. Okay, so you don't have to remember the absorption time. Please remember where is silk suture used. So we know, beta, silk suture and nylon suture. The next one in the picture which is there, beta, this is basically a ethylon, or you can call it as a nylon. So silk suture or nylon suture which is there, beta, they are going to have same indications. What do I mean by same indications? Both of them, beta, are going to be used for skin suturing. Both of them are going to be used for the purpose of skin suturing, bache. Secondly, both of them can be used for the purpose of fixing the drains. For example, any catheter, any tube, any drain that you have inserted in the patient's body, beta, and you have to fix the drain with the help of suture. So answer is either a silk suture or a nylon suture. हमें पता है that nylon का जो tensile strength होता है बेटा, it is much better. तो इसीलिए if they ask you where is nylon suture also used, so please remember nylon suture, we know beta, it is also used for the purpose of tendon repair. Okay, because for tendon we need a very strong suture with a good tensile strength. As well as beta, we know that nylon suture which is there, it is also used for the ophthalmological surgeries, beta. For ophtha surgeries which are there na, we use a 10-0, 11-0, very fine or a very thin kind of a nylon, beta. Clear hai? We know that silk suture is a natural non-absorbable suture, whereas nylon or ethylon is a synthetic non-absorbable suture, which is clear about. Whereas the last one that you are able to see, the sky blue color which is there, beta, that sky blue suture that we are able to see, beta, is nothing else but this one. This sky blue suture that we are able to see, beta, is nothing else but beta, the proline suture. So if I talk about this proline suture over here, याद रखना proline suture, first of all, it can be used to fix the proline mesh of hernioplasty, बेटा. जब hernioplasty के दौरान अपन proline mesh लगाते हैं, that is fixed with the help of proline suture. Second, proline suture is also used for the purpose of vascular repair. Whenever you have to repair a vessel or whenever you have to do a vascular anastomosis, beta, during that procedure you have to use a proline suture itself. Or whenever we have to do a abdominal wall closure, तो हमें पता है बेटा, in the abdominal wall we have the rectus abdominis muscle और उसकी covering known as rectus sheath. तो whenever we have to do a rectus sheath repair or whenever we have to do a rectus sheath closure, beta, obviously we have to use which kind of suture? We have to use a proline suture itself. Clear है बात? So these are the 5 types of suture material, beta, which are commonly asked in your examination. So do remember them for your exam. Last one point about suture material, and that is going to be, please tell me that which is the best suture used for the subcuticular suturing, bache. Which is the best suture material used for subcuticular suturing? If they ask you which is the suture material used for subcuticular suturing, I hope I have told you about knots. If not, understand, beta, please remember knots can be of basically 3 types, bache. The first one that you are able to see, understand, for example, if I say, beta, if in any kind of knot you are able to see two throws beta followed by a single throw, ठीक है, in any kind of knot you are able to see बच्चे there are two throws followed by a single throw beta definitely, then these kind of knot is what is known as a, anybody यहाँ पे कितना दिख रहा है, डेफिनेटली हियर यू विल बी एबल टू सी टू थ्रोज फॉलोड बाय सिंगल थ्रो बेटा, दैट काइंड ऑफ नॉट इज नोन एज अ सर्जन्स नॉट बेटा, ठीक है। तो सर्जन्स नॉट की अगर मैं बात करूँ, प्लीज रिमेंबर सर्जन्स नॉट विच इज देयर डेफिनेटली इट इज द बेस्ट नॉट बिकॉज इट इज द मोस्ट सिक्योर नॉट बेटा, ये स्लिप नहीं होती आसानी से, राइट। सर्जन्स नॉट विच इज देयर बेटा इट इज यूजुअली द मोस्ट सिक्योर काइंड ऑफ नॉट बेटा, इट इज द बेस्ट नॉट टू बी यूज डेफिनेटली, ठीक है, एंड इट हैज टू थ्रोज फॉलोड बाय वन थ्रो, ठीक है, it has two throws followed by one throw. Next important knot that you are able to see beta, it is this one. For example, if I say beta this is the loop over here, ठीक है, this is the loop over here beta, now follow the thread that I'm telling you. See this thread which is there beta, it will go like this. Now can you see what is the difference? Basically on one side it is going above the loop beta and on another side it is going below the loop. Now please remember, if the thread on one side goes above the loop and on another side if it goes below the loop beta, that means crossing is there. And in any knot if there is a crossing beta, in any knot whenever there is a crossing बच्चे, this kind of a knot is basically called as a granny's knot beta. This kind of a knot is what is called as a granny's knot. Granny's knot क्यों बोलते हैं इसको? Because the grannies which are there beta, they are known to knit sweaters, right? तो sweaters में जो knot लगाए जाते हैं बेटा, those are these kind of knots. In sweaters you might have seen now, definitely if then one knot comes outside beta, you can actually pull out the whole line. Why? Because these knots that the grannies apply beta, these are very insecure kind of knots beta. They are not tight, they are basically insecure, they can slip off very easily beta. Next important is a knot beta, the last one that you have to remember बच्चे, and that knot is going to be this one. Understand? So here क्या दिख रहा है? Can you see here both the ends of the thread which are there beta, both the ends of the thread are going above the loop. So when both the ends of the thread will either go above the loop or go below the loop, भले वो ऊपर हो या नीचे हो, but both the ends are going in the same manner beta, that both the ends are either going above the loop or both the ends are going below the loop beta. So there is no crossing as such, and when there is no crossing seen beta, this kind of a knot is known as a square knot or a reef knot बच्चे. This kind of a knot is going to be called as the square knot or a reef knot. Please remember, square or reef knot is a secure kind of a knot, but not the most secure, because हमें पता है बेटा कि most secure kind of a knot has to be the surgeon's knot. Clear? So two throws followed by one throw, surgeon's knot most secure. ठीक है, crossing scene granny's knot very unsecure, very insecure. ठीक है, and if no crossing scene, that is square or a reef knot, which is a secure kind of knot. Very good. Yes, somebody has told me now. Very good over here. Best subcuticular suturing के लिए जो suture material use होता है बेटा, we have discussed that and it is known as monocryl 30. The best material used for subcuticular suturing which will be there beta, it is going to be monocryl 30. ठीक है बेटा, granny's knot is not preferred in our suturing. We do not prefer granny's knot nowadays बेटा, ठीक है, पहले यूज करी जाती थी. granny's knot we do not use nowadays because slippage ज़्यादा होता है. So it's better that either we use a square knot or a reef knot beta, or we use the surgeon's knot, or the third one that we use is basically a cobbler's or a Aberdeen's knot beta. ठीक है, तो practice में basically we use these three types of knots. Next important you are able to see बच्चे, it is this one over here. This classification you have to remember for your examination. First of all, if I say beta that there are sutures which are natural as well as absorbable. तो जो natural absorbable sutures होते हैं, the examples of them will be catgut and chromic catgut beta. So catgut and chromic catgut will be natural as well as absorbable sutures. Next important beta, if I talk about that which sutures are usually natural but non-absorbable beta. तो natural non-absorbable sutures अगर आप पूछेंगे तो answer has to be silk. So silk is basically a natural non-absorbable suture बच्चे. Next important, if they ask you beta, it is going to be about the synthetic sutures. So synthetic absorbable sutures, if they ask you synthetic absorbable sutures, तो याद रखना synthetic absorbable sutures will be vicryl, monocryl and PDS beta. PDS is polydioxanone. So vicryl, monocryl and PDS which are there beta, these are going to be the synthetic absorbable sutures. Whereas if they ask you बच्चे that which are the synthetic non-absorbable sutures, so synthetic non-absorbable sutures will be proline and nylon. Synthetic non-absorbable sutures have to be proline and nylon beta. Clear है बात? चलो. So these are the important points to be remembered. Everything about suture materials beta. Can anybody tell me that which is the first side जहाँ से sutures निकालते हो बेटा? विच इज द फर्स्ट साइट फॉर सूचर रिमूवल? सूचर रिमूवल के लिए सबसे पहली साइट कौन सी होती है? एनीबडी? फ्रॉम विच साइड ऑफ द बॉडी सूचर रिमूवल इज डन फर्स्ट? Suture removal is done earliest in the body. In which part? फेस. वेरी गुड बेटा, यस शाबाश. तो प्लीज रिमेंबर बेटा, फेस के जो सूचर्स है वो सबसे पहले निकाले जाते हैं. फेशियल सूचर्स विच आर देयर, दे आर दोज आर यूजुअली रिमूव्ड बेटा बाय 3 to 5 days, राइट? फेशियल सूचर्स आर गोइंग टू बी रिमूव्ड बाय अराउंड 3 to 5 days बेटा. whereas लास्ट पार्ट विच इज देयर, जहां से सूचर्स निकालते हो बेटा, is usually the abdomen, right? Last part from where you remove the sutures is usually the abdomen beta. It is around 12 to 14 days, right? Abdominal wall sutures are removed the last around 12 to 14 days. That has to be remembered. Clear है? Sure. So these are the important things to be remembered बच्चे. Very good. शाबाश. ठीक है. Next one important is this picture over here beta. Here the picture comes to our emergency bache with necrosis, as you are able to see inside the leg beta. Along with that there are gas filled blisters over here, and when you rupture these blisters beta, there is extremely foul smell that is going to come. Even without rupturing the blisters there is foul smell beta. And if you see that the necrosis over here is very deep beta, it is even involving the muscles and the bone also beta. This kind of a picture is classically suggestive of a gas gangrene bache. This kind of a picture is usually suggestive of a gas gangrene. तो गैस गैंग्रीन का कॉज पूछा था उन्होंने प्रीवियस ईयर. वेरी गुड. द मोस्ट कॉमन कॉज ऑफ गैस गैंग्रीन बेटा हैज टू बी ऑर्गेनिज्म नोन एज क्लोस्ट्रीडियम perfringens. Please remember, gas gangrene ka most common cause has to be an organism called as Clostridium perfringens. As I told you, the patient is going to have extremely foul smell, myonecrosis as well beta, and the patient will land up into sepsis बच्चे. If they ask you what is done for the purpose of diagnosis, तो हमें पता है बच्चे, diagnosis के लिए we have to go for a biopsy with culture. That means you have to take a biopsy from the site and you have to send it for the purpose of culture beta. नाउ अगर वो ट्रीटमेंट पूछेंगे तो प्लीज रिमेंबर बेटा, ट्रीटमेंट की अगर मैं बात करूं तो फर्स्ट लाइन ट्रीटमेंट हैज टू बी अ बेसिक रिससिटेशन बेटा. व्हाई बेसिक रिससिटेशन? बिकॉज व्हेन द पेशेंट मे कम टू अस बेटा, द पेशेंट मे बी इन सेप्सिस and therefore the patient may have a septic shock also. ठीक है, तो इसीलिए if they ask you what is the first line management behind the patient, answer has to be a basic resuscitation. But if they ask you what is the definitive management of a patient, तो याद रखना है कि definitive management में you have to go for a debridement बेटा if it is seen in a local part. ओके, या फिर अगर बहुत ज़्यादा हिस्सा नेक्रोटिक है then we have to go for an amputation बेटा. So either a debridement or an amputation beta has to be done depending on the involvement over here. Clear है बात? So that is important. Next important, let's talk about another necrotizing infection over here. And if I talk about that necrotizing infection बच्चे, that necrotizing infection is this one over here. क्या दिख रहा है? यहाँ पे there is a necrotizing infection of the scrotal sac. But this necrotizing infection is superficial. And such a superficial necrotizing infection, which is only limited up to the level of fascia, is classically called as necrotizing fasciitis. We know necrotizing fasciitis of the scrotal sac. This is सरकारी question of your exam बेटा. क्या बोलते हैं इसको? What is this necrotizing fasciitis of your scrotal sac called as? Very common question of your examination बच्चे. Very good. It is a classical picture of a case known as Fournier's gangrene beta. It is a classical picture of a case known as Fournier's gangrene. ठीक है, तो प्लीज रिमेंबर इट इज अ क्लासिकल पिक्चर ऑफ Fournier's gangrene. और हमें पता है बेटा that Fournier's gangrene which is there, it is an infection which is polymicrobial in nature. That is multiple organisms or multiple bacteria together are known to cause this infection beta, aerobic as well as anaerobic. Please remember, in patients of Fournier's gangrene बच्चे याद रखना, the management which is there, okay, the management which is there beta, it is only debridement that you have to do. ठीक है, in patients of Fournier's gangrene, okay, we only have to go for a debridement beta. Do we need an orchidectomy? No orchidectomy is usually required beta because testes are not going to be involved in this condition. So usually debridement has to be done along with antibiotics, right? Debridement along with antibiotics has to be the management beta. Orchidectomy is usually not required in this condition. Can anybody tell me necrotizing fasciitis of the abdominal wall, what is that gangrene called as? अगर abdominal wall पे तुम्हें necrotizing fasciitis दिया हुआ है तो what is that condition called as? Necrotizing fasciitis of the abdominal wall, what is that condition known as? Anybody? जब there is necrotizing fasciitis of the abdominal wall. Recent NEET PG question I've told you. क्या बोलते हैं उस कंडीशन को? Very good. It is classically known as the Melanese gangrene beta. Very good. It is classically known as the Melanese gangrene beta. ठीक है? So that has to be remembered. Done with this. Now, the next important thing that we have to remember, beta, is going to be these two scars. Now, whenever a patient is going to develop any kind of wound, beta, there are various types of wounds that we have discussed in surgery, right? If there is a superficial injury to the epidermis or scratches on the skin, that is called as abrasions, right? If there is rupture of the venous, beta, and there is a superficial subcutaneous bleeding, okay, that is known as either a contusion or a bruise, right? If there is a injury due to a heavy cutting weapon like a axe, okay, kulhadi se, so then that will be called as a laceration or a lacerated wound, जिसमें there will be irregular margins, tissue bridges will be present, and hair follicles and the nerves will be crushed beta. Whereas on the other hand, if there is an injury with a light cutting weapon, okay, some light cutting weapon matlab something like a scalpel or a blade, surgical blade beta, then this is classically called as an incised wound beta or an incision, and here there will be sharp regular margins bache, no tissue bridges are going to be present, the hairs and the nerve follicles will be cut, okay, sharp cuts will be there, okay. So that is important to be remembered. Apart from that, we have also discussed about puncture bites, which are usually due to the nail injuries beta mostly, okay. So that is important to be remembered. Apart from that, in road traffic accidents, when there is complete crushing of the tissues beta, that is classically called as a crush injury, that also we have discussed. Or in run over injuries beta, जब गाड़ी चढ़ जाती है, for example, okay, on your body, so what is going to happen? There is separation of the skin from the underlying layers beta, and a flap of skin is created. That flap of skin that will be created beta will be called as a degloving injury or an avulsion wound beta, degloving or an avulsion injury. And याद रखना उसमें the separation occurs between the layers of subcutaneous tissue and the deep fascia. Clear है बात? So that is important. Now here you are able to see if the patient had a wound beta. After that, when the wound is going to heal, basically there will be initially a granulation tissue that forms, and later on there will be a scar which forms beta. But sometimes the scar can be an adverse or a bad scar, like either a hypertrophic scar or keloid scar can be formed beta in the patient. Now important is two important questions integrated with pathology, and the question will be which is the first granulation, which is the first collagen to appear in the granulation tissue or during wound healing process beta. Anybody? The first collagen to appear in the granulation tissue or during the wound healing process. Anybody? The first collagen to appear in the granulation tissue beta or during the wound healing process has to be collagen type 3. Very good. The first collagen to appear beta has to be collagen type 3. Later on this collagen type 3 will be replaced by collagen type 1. And अगर वो पूछते which is the most abundant collagen and in scar tissue beta, most abundant collagen in scar tissue has to be collagen type 1 beta. ठीक है, so that is important. तो यहाँ पे जो दो scars बने बेटा, why these adverse or bad scars have been formed? It is due to over deposition of mature collagen and dense fibroblast. जब ज़्यादा deposition होता है collagen या fibroblast का, then that leads to formation of these adverse scars beta. पहला जो hypertrophic scar, it is due to over deposition of collagen and fibroblast, but that is only seen within the wound limits बच्चे. Okay, that is usually seen only within the wound limits. But on the other hand, if I talk about a keloid scar beta, keloid scar में here the deposition which is there, it is growing beyond the wound limits बच्चे. ठीक है, so in keloid scar the excess deposition which occurs, it is usually beyond the wound limits. Outside the wound limits it happens. Now important is if they ask you in which age group it is going to be common. We know bache that keloid scar is going to be more, hypertrophic scar is going to be more common in children, whereas keloid scar is going to be more common in young adults beta around 10 to 30 years of age. And we know that keloid scar is also more commonly seen in females beta. ठीक है, so 10 to 30 years of age and more commonly females. कौन सा scar है beta that is more commonly associated with a family history? So we know that keloid scar may have a familial predisposition or a familial history beta. Okay, whereas it is also more common in the Afro-Caribbean race or black race beta. Okay, so that is important. Now, important about the most common site, whether it is a keloid scar bache or it is going to be the hypertrophic scar. Yaad rakhna, the most common site for both the scars is going to be the sternum itself. Sternum is the most common site for a keloid as well as a hypertrophic scar. Reason beta, these are the sites of bony prominence. Yahan pe there is no muscle tissue, therefore there is less blood supply. So there is an impaired wound healing which occurs at these sites, leading to formation of a bad scar. ठीक है, if they ask you treatment, तो याद रखना that usually your hypertrophic scar shows a spontaneous resolution. अपने आप ठीक होता है बेटा. It shows a spontaneous resolution, so it usually doesn't require any treatment. If you want to give any treatment for the purpose of itching, as that causes a lot of itching beta, easily you can do a massage with moisturizing creams beta, that could be done, या फिर silicone gel sheets could be applied. But please remember beta, in a case of a keloid scar, तो याद रख लो, in patients of keloid scar beta, you don't have to in keloid scar here, spontaneous resolution is not going to be seen. अगर spontaneous resolution नहीं दिखता तो treatment करना पड़ेगा. What they if they ask you बेटा what is the treatment of choice, so answer has to be, treatment of choice जो होगा बेटा, it has to be keloid के अंदर एक injection देना है, and that intrakeloidal injection should be of a long acting steroid. And what is that? There should be an intrakeloidal injection of triamcinolone which should be given. Okay, intrakeloidal injection of triamcinolone should be given बेटा. याद रखना, इन पूरा सर्जरी वी हैव डिस्कस इंट्रालीजनल इंजेक्शन ऑफ ट्राइम्सिनोलोन ऑफ 3 साइट्स बेटा, मैंने पढ़ा है. फर्स्ट वन, हियर यू हैव टू रिमेंबर बेटा that in patients of keloid scar for treatment we can give a intralesional injection of triamcinolone. Second, in oral cavity I have told you beta, for a condition known as oral submucous fibrosis, for oral submucous fibrosis there is an intralesional injection of triamcinolone. And third, in breast I have told you beta, when there is costochondritis, inflammation of the costochondral junctions known as Tietz disease beta, causing a non-cyclical mastalgia or a breast pain, so in that condition also intralesional injection of triamcinolone was given. 3 conditions याद रख लो जहां triamcinolone देते हैं. बट याद रखना बेटा, इवन आफ्टर गिविंग ट्राइम्सिनोलोन आफ्टर एवरी 3 weeks बेटा, स्टिल देयर कैन बी अ चांस ऑफ रिकरेंस इन केलॉइड. तो अगर वो पूछते हैं व्हाट इज द बेस्ट ट्रीटमेंट फॉर केलॉइड बच्चे, तो बेस्ट ट्रीटमेंट फॉर केलॉइड वी हैव डिस्कस्ड ऑलरेडी, इट इज नथिंग एल्स बट, सबसे बेहतर होगा कि डू अ सर्जिकल एक्सीजन ऑफ दैट केलॉइड ना, पूरा निकाल ही दो उसको, सर्जिकल एक्सीजन ऑफ केलॉइड बेटा, फॉलोड बाय an interstitial radiotherapy. What is an interstitial? That means we have to keep a radioactive substance beta after removing the keloid scar at the base, so that उधर locally अगर तुम radioactive substance रख दोगे, the chances of recurrence will be very very less over there. ठीक है, that has to be remembered. चलो, so these was about the important differences about a hypertrophic and a keloid scar beta. Yes, with radioactive cobalt you have to do it. चलो, next important, if I talk about beta, and it is going to be shock basically. If I talk about shock बच्चे, तो हमें पता है what is shock. In short, shock is nothing else but beta hypoxia at cellular level, right? So hypoxia at cellular level beta will be the best definition of shock. मतलब if the cells, tissues or the organs are not able to receive enough amount of oxygen supply beta, that condition is basically called a shock. ठीक है, तो hypoxia at cellular level will be shock बच्चे. If I talk about, there are various types of shock we know. अगर patient में there is blood loss and due to which there is a shock beta, it is known as a hypovolemic shock, also known as a hemorrhagic shock beta. Second, if the patient is having either a congestive heart failure where the heart is not able to pump, or the patient is having arrhythmias beta in the heart, due to that if the patient develops a shock, it is known as a cardiogenic shock. If the patient is actually having beta, if the patient has taken some allergen, matlab for example the patient has eaten seafood beta to which the patient was allergic to, after that if the patient develops respiratory distress and shock like features beta, then that is what is classically called as an anaphylactic shock beta. Next, if the patient is having extreme pain, or if there was an injury to the thoracolumbar spine, and due to that if the patient develops a shock beta, the patient is going to develop a neurogenic shock. Next, if the patient usually develops a shock beta sorry, due to particular infection बच्चे, then that is going to be called as a septic shock. हमें पता है that in the initial phases of septic shock beta, there is a sympathetic overactivity जिसकी वजह से there is a very fast or hyperdynamic circulation called as the warm septic shock. But in the later phases of septic shock beta, now definitely there is increased vascular permeability in the body due to inflammation, मतलब the blood vessels become leaky beta, जिसकी वजह से in the later phases beta the patient is going to develop hypotension, that is what is called as a cold septic shock beta. Clear है? Now important is if they ask you out of all of these, what is the most common variety of shock? We know the most common type of shock has to be the hypovolemic shock beta, also known as a hemorrhagic shock. This was a previous year question. याद रखना, hypovolemic or a hemorrhagic shock which is there, it is the most common variety of shock. Now अगर वो बोलते हैं बेटा that the patient is only having a head injury, isolated head injury, and that too there is no external bleeding beta, only there is a intracranial hemorrhage, bleeding inside the cranial cavity. So can that give rise to a hypovolemic shock? No beta. क्यों? क्योंकि अगर cranial cavity के अंदर bleeding होती है, if there is bleeding inside the cranial cavity beta, there is very less space over there, so obviously the blood loss would not be more than 300 or 400 cc, right? So the patient will not land up into hypovolemic shock if the patient is only having a intracranial hemorrhage. याद रखना, isolated head injury beta can never give rise to a hypovolemic shock. But अगर कोई high head injury का patient hypovolemic shock में आता है, if there is some head injury patient who comes to us in hypovolemic shock, तो क्या सस्पेक्ट करना है? We have to suspect that the patient is having bleeding from somewhere else, कहीं और से bleed कर रहा है patient. Therefore we have to search for all the other sites of bleeding beta. If external bleeding नहीं दिख पा रही है तुम्हें, search for the internal sites of bleeding beta, like the patient may be having some bleeding in the neck, thorax, abdomen or the pelvis beta. कहीं और भी bleed कर रहा है patient, इसीलिए the patient has gone into hypovolemic shock, because we know only intracranial hemorrhages cannot cause a hypovolemic shock. This is based on the previous year question that has been asked in your FMG exam, and that was which among the following will be the least likely cause of hypovolemic shock in the patient, and the options which were given beta. One was a splenic rupture, second was a retroperitoneal bleed, third was a massive hemothorax, and fourth was a subdural hemorrhage. Answer. Very good. Yes, shabash. The answer has to be SDH beta, subdural hemorrhage. क्योंकि बाकी में there can be a lot of amount of bleed beta, and therefore the patient can develop a hypovolemic shock, but only SDH cannot cause a hypovolemic shock. शाबाश. Clear है? चलो. Now 3 important one-liners जो मैंने तुम्हें लिखवाया है for shock beta that has to be remembered. First of all, whenever they say beta, what is an earliest indicator of a shock? What is the earliest sign of a shock beta? तो अर्लीस्ट इंडिकेटर या अर्लीस्ट साइन ऑफ शॉक अगर पूछेंगे तो आंसर इज नॉट हाइपोटेंशन, आंसर इज टैकीकार्डिया बेटा. क्यों? मैंने बोला था even before the blood pressure decreases beta, the heart rate starts rising. Why the heart rate usually rises in patients of hypovolemic shock or any other shock? रीजन बेटा, जब ब्लड प्रेशर ड्रॉप होना शुरू होता है, व्हेन द ब्लड प्रेशर स्टार्ट्स ड्रॉपिंग, फॉर कॉम्पेंसेशन पर्पसेस, टू मेंटेन द ब्लड प्रेशर इन द नॉर्मल रेंज, इमीडिएटली द हार्ट स्टार्ट्स बीटिंग फास्टर. Okay, so therefore beta, tachycardia or a reflex tachycardia will be the earliest feature or earliest sign in a case of shock. Next important, if they ask you that when a patient of shock comes to you beta, how much amount of fluid has to be given in the patient of shock? How do you decide that? Please tell me the parameters, anybody. ठीक है, कौन सा बेस्ट इंडिकेटर होता है to determine the amount of fluid to be given in a patient of shock? How much amount of fluid is required in a case of shock? कितना फ्लूइड चढ़ाना है उस पेशेंट को, ये कैसे पता चलेगा? वेरी गुड, शाबाश. तो प्लीज रिमेंबर बेटा, द आंसर हैज टू बी PCWP फॉलोड बाय CVP बेटा. क्लिनिकल प्रैक्टिस में भी कॉमनली यूज CVP बिकॉज PCWP डेफिनेटली इज मोर डिफिकल्ट टू कैलकुलेट, तो CVP इज मोर इजियर, बट बेस्ट अगर पूछेंगे तो PCWP हैज टू बी योर आंसर बेटा. ठीक है. यूरिन आउटपुट बेटा, तुम रिससिटेशन स्टार्ट करोगे उसके बाद तो यूरिन आएगा ना, तो यूरिन आउटपुट कैन नॉट बी द फर्स्ट वन. यूरिन आउटपुट कैसे? पेशेंट में शॉक है, पेशेंट तुम्हारे पास आया है, देयर इज नो यूरिन आउटपुट ओनली. ठीक है. अब कैसे पता लगाओगे कितना फ्लूइड चढ़ाना है? वो तो फ्लूइड स्टार्ट करने के बाद there will be decision about that, right? तो अभी मैं पूछ रहा हूँ कि the patient has just come to you, so please remember pulmonary capillary wedge pressure बेटा, pulmonary capillary wedge pressure followed by central venous pressure बेटा. These are the two best parameters to determine the amount of fluid required in a patient of shock बेटा. Please tell me in the chat box now whether it is a pulmonary capillary wedge pressure or a central venous pressure बेटा. This will be calculated with the help of which one? This will be calculated with the help of which catheter? Anybody? कौन सा कैथेटर यूज करते हैं बेटा टू कैलकुलेट बोथ दीज प्रेशर्स? नाउ लेट मी नो इन द चैट बॉक्स दैट. नेक्स्ट इज बेस्ट क्लिनिकल इंडिकेटर बेटा ऑफ फ्लूइड रेसिसिटेशन. मतलब अभी फ्लूइड रेसिसिटेशन स्टार्ट कर दिया है. नाउ वेदर द अमाउंट ऑफ फ्लूइड दैट वी आर गिविंग टू द पेशेंट, इज इट इनफ और नॉट? अब ये अगर पता लगाना है उसके लिए यूरिन आउटपुट बोल सकते हो तुम, राइट? सो द बेस्ट क्लिनिकल इंडिकेटर ऑफ फ्लूइड resuscitation or to assess that we are giving adequate fluid administration or not, okay, to assess these things definitely, then the best indicator which is there beta, it has to be what? Then the best indicator has to be बच्चे urine output. Now I've told you beta that urine output which is there, it should be more than 0.5 ml per kg per hour beta. Okay, urine output should be more than 0.5 ml per kg per hour. Then we say it is a adequate urine output beta. Please remember that. Clear है? चलो. Very good. Yes. The pulmonary capillary wedge pressure or central venous pressure, both these pressures can be measured with the help of a Swan-Ganz catheter beta. ठीक है? उस catheter का नाम होता है Swan-Ganz catheter. Please remember that. Clear to all of you now? Next important now, two important statements बेटा जो shock का table तुम्हारे लिए आसान बना देगा, and that is first of all बेटा that systolic blood pressure is decreased in all types of shock except, so please remember systolic blood pressure decreases in all types of shock except which one is the variety बेटा जहाँ पे the systolic blood pressure of the patient may be normal or slightly high. What is that variety of shock? Very good. It is classically a case of warm septic shock beta. हमें पता है that warm septic shock is the only phase where there is a sympathetic overactivity जिसकी वजह से the patient's blood pressure is either normal or slightly elevated beta. ठीक है, बाकी सब shocks में the blood pressure will always be low. Next important, we know that all types of shock में बेटा there is hypotension and a reflex tachycardia. बराबर, to increase the BP there is always a tachycardia which happens. So all shocks leads to hypotension and tachycardia. But ऐसा कौन सा variety of shock है बेटा? In which variety of shock there is hypotension and bradycardia together? When there is a hypotension and bradycardia, low heart rate, it is which type of shock beta? Very good. This has been a previous year question of your examination that tend to give a classical case beta. भले वो 4 लाइन का केस बना दे, but if ultimately beta they are mentioning that the blood pressure is low and even the heart rate is low, then the diagnosis is directly made beta it has to be a case of neurogenic shock itself. ये recent question आया तुम्हारे FMG exam में, so do remember beta it is a case of a neurogenic shock then. ठीक है, and yes vagal shock में भी होता है, but vagal vasovagal syncope and shock which is there, it is usually less common, so you can remember neurogenic shock. ठीक है, चलो. Next important, if I talk about beta, it is going to be triage now. What is triage? Now, whenever a patient of trauma comes to me, beta, okay, at that time triage will be required. But kab? Not in one patient, not in two patients, right? When? For example, beta, you are posted as a medical officer in some periphery, ठीक है? और वहाँ पे definitely there is scarcity of manpower and scarcity of resources also. And now there is either a train accident over there, or basically there is a bus accident, or there is some natural calamity like disasters like earthquake or floods. So obviously here a lot of people at the same point of time beta need medical attention. But now as there is limitation beta, therefore you are not able to give equal attention or equal priority to each of your patient. तब क्या करते हो? तब you segregate your patients beta, you categorize your patient, you divide your patients into various color coded categories beta, and then you decide the priority of treatment. बराबर है? So this segregation of patients will help you decide the priority of treatment beta, and this procedure is known as triage beta. ये प्रीवियस ईयर क्वेश्चन है, डेफिनेशन पूछी गई थी ट्रायज की, तो प्लीज रिमेंबर इट इज नथिंग एल्स बट वी नो, उन्होंने पूछा था दैट सेग्रीगेशन ऑफ पेशेंट्स विच इज डन ओके इन ईदर अ मास कैजुअलिटी बेटा और इन अ केस ऑफ डिजास्टर. ठीक है, किसके लिए? इन अ केस ऑफ मास कैजुअलिटी बच्चे और इन अ केस ऑफ अ डिजास्टर बेटा, टू डिसाइड द प्रायोरिटी ऑफ ट्रीटमेंट बेटा. ओके, टू डिसाइड प्रायोरिटी ऑफ ट्रीटमेंट हैज टू बी कॉल्ड एज व्हाट. तो उन्होंने ऑप्शन में टैगिंग भी दिया था. ठीक है, लॉट ऑफ पीपल मेड अ मिस्टेक एंड मार्क टैगिंग. नो बेटा, इट इज नॉट टैगिंग, इट हैज टू बी ट्रायज. ठीक है, इट इज नॉट टैगिंग, इट हैज टू बी ट्रायज बेटा. क्लियर है बात? So do remember that. Now important is if they ask you, ये जो categorization या segregation of patients हम करते हैं बेटा, it is basically done on two important parameters बच्चे. One is likelihood of survival, किसके बचने के chances ज़्यादा है. Second is severity of injury, कौन ज़्यादा severely injured है. In previous year question as I told you बेटा in the examination, both these parameters are required for triage beta, but in your previous year exams उन्होंने एक single best choose करने के लिए बोला था. And if they ask you beta to choose the single best answer among these two, then what has to be your answer? Anybody? It is based on which main parameter? Single best answer, anybody? Very good. Please remember, beta, if they ask you it is based on which main parameter, the answer has to be likelihood of survival. Shabash. Okay, the chances of survival, likelihood of survival, that has to be the most important parameter, beta, followed by the severity of injury. Okay, severity of injury is a parameter but not the most important. The most important is likelihood of survival. You give like severity of injury would have been the best parameter, we know. Then black category are the patients who are most severely injured, they are almost dead, right? But they are still not given the highest priority, beta, because the survival chances of these patients are very very less. Clear hai? So that is important. Now if I talk about beta, first of all it is the red category patients, and we know beta that red category patients are given the highest priority for treatment. Who are these red category patients, beta? We know that red category patients are the one who need an immediate resuscitation. क्या होता है resuscitation? We have discussed that whenever a patient need to like whenever we need to save the life of a patient, beta, whatever we do or whatever measures we take is known as resuscitation, right? So here, beta, immediate resuscitation is required by the for the patient, beta, like airway, breathing, circulation of the patient should be properly managed, beta, right? Or the patients who need, beta, either a limb saving surgery or a life saving surgery, beta, within a span of 6 hours. Any patients who need a limb or a life saving surgery within a span of 6 hours, otherwise they will die. These kind of patients are also included in the red category. Constipation. So they usually, I've told you the six causes of immediate, the six causes of death in patients of trauma, beta, within the first hour. All of those causes will be included over here. Any patient who is having, beta, airway obstruction, any patient who is basically having a hypovolemic shock or acute circulatory arrest, any patient who is having cardiac tamponade, any patient of tension pneumothorax or a hemothorax, right? All those patients would be included over here. Next important bache is going to be the yellow or the blue category, beta. Now if I talk about the yellow or the blue category, so yellow is the more common color that we use, but blue can be used if yellow is not available. These patients are usually given high priority, beta, and these yellow or blue category patients who are there, they will be the ones who need a limb or a life saving surgery, beta, but they can wait for some time. They need a limb or a life saving surgery within a span of 6 to 24 hours, beta. So they can wait for the first 6 hours. Till that time you can manage the red category patients. Next important one will be the green category patients, बच्चे, and हमें पता है that green category is the most disturbing category patients, बेटा. These green category patients are given low priority, right? Green category patients are given low priority, बच्चे. Those are the patients who are having major injuries or minor injuries. Only minor injuries, beta. These are the patients who are having just minor injuries, बच्चे, or these patients are walking here and there. That means these patients are ambulatory, beta, or you can call them as walking wounded patients. Okay, so those patients will be included in the green category. And the last one that we have, beta, is going to be the black category patients. If I talk about the black category patients, we know they are given the least priority, beta. Black category patients should be given the least priority, and these are the patients who are either already dead, beta, okay, or who are about to die. Okay, that means moribund patients. ठीक है, तो either dead patients or moribund patients, और जिनके लिए कुछ भी करो बेटा उनको बचा नहीं सकते हो. दैट मीन्स वॉट एवर यू डू यू कैन नॉट सेव दीज पेशेंट्स, बेटा. दीज आर कॉल्ड एज अनसैल्वेजेबल पेशेंट्स. ठीक है, तो डेड, मॉरिबंड और अनसैल्वेजेबल पेशेंट्स आर इंक्लूडेड इन द ब्लैक कैटेगरी, बच्चे. These are the important categories of triage that you need to remember for your examination. Clear है बात? चलो, so that is important. ठीक है, येलो कैटेगरी और ब्लू कैटेगरी में ऑल योर फ्रैक्चर केसेस विल बी इंक्लूडेड एक्सेप्ट पेल्विक फ्रैक्चर, बेटा, बिकॉज पेल्विक फ्रैक्चर कैन लीड टू हाइपोवोलेमिक शॉक, so therefore it is in the red category. Green category में बेटा all your lacerations which are there, okay, all the abrasions and everything, those will be included, beta. Okay, so that is important. Next is whenever any patient of trauma comes to us, beta, we know that any patient of trauma who comes to us, बच्चे, okay, the management has to be done with the help of a set of guidelines, and that set of guidelines is known as the ATLS protocol, beta. ATLS protocol क्या होता है? ATLS means Advanced Trauma Life Support, right? Full form याद रख लेना. ATLS is nothing else but Advanced Trauma Life Support, beta. So according to the ATLS protocol, whenever a patient of trauma comes to you, you have to do two surveys, beta, in that patient, right? We have to first of all do a primary survey. In primary survey, beta, the aim is only to save the life of our patient. ठीक है, बस patient को जिंदा रखना है. And therefore what we do is called as basic resuscitation over here. Whereas once your patient is stabilized, beta, after a primary survey, then we go for a secondary survey in the patient, बच्चे. ठीक है, then we go for a secondary survey in the patient as well. ठीक है, इसमें नाउ यू विल ट्राई टू लुक आउट फॉर ऑल द इंजरीज इन द पेशेंट्स बॉडी, जिसके लिए यू शुड डू अ प्रॉपर हेड टू टो एग्जामिनेशन ऑफ द पेशेंट बेटा, ठीक है, इन द सेकेंडरी सर्वे, दैट हैज टू बी रिमेंबर्ड. अब I have told you about the question beta, okay, and that has also been asked in the examinations earlier. That was asked in the recent INA set as well. ठीक है, easy question था, and that question was basically that which among the following investigations will not be done in the primary survey of ATLS protocol, and the options that they gave beta was definitely an X-ray chest. Second, they gave beta the E fast, that is an extended fast. Third, definitely they gave beta was a CT chest basically, and the fourth one they gave beta was an X-ray abdomen. Answer bolo. Anybody? Options were X-ray chest, next is CT chest, third is extended fast, and fourth is the X-ray abdo. Very good, beta. Shabash. Please remember that CT which is there. We know, beta, whether it is a NCCT or CECT doesn't matter, beta. CTs are never done basically in the primary survey. Okay, CTs could be done after the patient has been stabilized, beta, but not the primary survey. याद रखने के बाद CT is not done in the primary survey. That has to be remembered. Shabash. Very good. ठीक है, तो याद रखना CT is not done in the primary survey. That was the question. Next important, if I talk about beta, sequence for resuscitation. If I talk about बच्चे, sequence for resuscitation in cases of ATLS protocol will be ABC or CAB. Anybody? Will be ABC or CAB? Sequence of resuscitation in patients of ATLS protocol will be ABC or CAB? Very good. So sequence for resuscitation in the ATLS protocol beta has to be A, B, C, D, E. ठीक है, तो A, B, C, D, E, that has to be the sequence of resuscitation in a ATLS protocol beta. जो CAB होता है, the CAB sequence which is there beta, ठीक है, it is not used for a ATLS protocol. CAB sequence which is there, it is used for the BLS or the ACLS protocol beta. It is generally used for the BLS or the ACLS protocol. BLS मतलब basic life support, ACLS मतलब advanced cardiac life support. Those are the things that we do beta when a patient is suffering from a cardiac arrest. जब the patient standing in front of you suddenly collapses beta, and now the patient is unresponsive and unconscious and pulse and breathing are absent, तब जाके medicine या anesthesia में पढ़ा होगा बेटा about the BLS or ACLS protocol. In that, circulation is given utmost priority and therefore you immediately start a CPR in that patient. उसमें the utmost priority is given to circulation, then the sequence will be CAB. But any patient of trauma coming to you beta, the sequence will always remain A, B, C, D, E. ठीक है, तो airway will always be given the utmost priority in trauma बेटा, याद रखना. तो A for airway, B for breathing, C for circulation. Anybody, what does the D stand for? Previous year question of FMG. What does the D stands for? E, I'll tell you, that is exposure beta. E is usually exposure with environmental control beta, right? E is usually a exposure with environmental control, that has to be remembered. What does the D stands for? Very good. Disability management. Shabash. Please remember beta, D usually stands for disability, and that has been a previous year question of your exam. ठीक है, D stands for disability. शाबाश. ठीक है, जहां पे you give priority to the central nervous system बेटा, you check the patient's neurological status by the GCS or the Glasgow Coma Scale and the pupil reactivity of the patient बेटा. शाबाश. That is important. Now beta, please remember, first of all, whenever we manage the patient's airway beta, utmost priority should also be given to what? Cervical spine protection as well beta. ठीक है, तो cervical spine protection is given utmost priority. That has to be remembered बच्चे. तो जब भी airway management करोगे, please remember, along with airway management, we always have to take care of cervical spine protection or cervical spine immobilization. Do not let the cervical spine move when you are suspecting the patient is having a cervical spine injury. ठीक है, तो उसके लिए you should transfer the patient on hard surface and you should apply a hard cervical collar around the neck of the patient. What is that hard cervical collar called as? Previous year question of your exam. What is the hard cervical collar called as? That we use for cervical spine immobilization. Very good. It is classically known as the Philadelphia collar beta. Please remember that. ठीक है, उसके अलावा now airway management के लिए, whenever a patient is having signs of airway obstruction or airway blockage, we should go for airway management. सबसे पहले clear the airway if there is any foreign body. Second, secretions के लिए you have to do a proper suctioning beta. Third, then you have to perform maneuvers. The two maneuvers that we do for airway management beta are these ones. पहला जो maneuver है, you can see what we are doing over here. We are lifting the chin of the patient and we are tilting the head of the patient beta. Why? So that the airway of the patient comes in a straight line. ठीक है? And this is classically called as which maneuver? This is classically known as the head tilt and a chin lift maneuver, बच्चे. This has been a previous year NEET PG question. Do remember that? This is classically called as the head tilt and a chin lift maneuver. Whereas अगर ये maneuver काम नहीं करता है बेटा, then what we have to do? We have to hold the jaw or the mandible of the patient and give a sudden thrust beta. And this second maneuver that you are able to see beta, जहाँ पे sudden thrust is given to the jaw, is classically called as the jaw thrust maneuver. ठीक है? But even after doing all of this beta, if the patient's airway doesn't open up, so in that condition you have to establish a new airway for the patient beta. And what is the airway of choice? Definitely, if the patient is not able to establish a, like if you are not able to open up the patient's airway, then to establish the new airway beta, the definitive airway is nothing else but insertion of the endotracheal tube beta. You have to insert an endotracheal tube inside the patient's airway through which we can ventilate our patient beta, right? And this procedure is known as endotracheal intubation beta. Okay, we call it as endotracheal intubation. Please remember, if the patient is having chances of aspiration, तो क्या करोगे? Which kind of tube should be used? Cuffed or uncuffed? If the patient is having chances of aspiration beta, then whether it is an endotracheal tube or a tracheostomy tube, which type of tube should be used? Cuffed or uncuffed tube? A cuff tube beta. Please remember that this cuff over here, which is there now in the endotracheal tube or in the tracheostomy tube beta, it will be there for preventing the aspiration, not for the fixation of tube beta. Okay, it is only for preventing aspiration. So therefore, whenever a patient has a risk of aspiration, you should always use a cuffed tube. That is important to be remembered. Which position is used for endotracheal intubation? So we know in endotracheal intubation beta, the patient's neck should be flexed and the atlanto-occipital joint should be extended beta. So one joint flexed, one joint extended, known as classically which position? It is classically called beta as the sorry, it is classically called beta as the barking dog position or the morning sniffing position, right? Barking dog or the morning sniffing position. शाबाश. अगर endotracheal intubation difficult है या फिर endotracheal intubation fail हो जाता है बेटा, in those conditions definitely, okay, whenever endotracheal intubation is difficult or it fails, then in those conditions we have to go for the next choice beta. And next choice mein what we have to do? We have to go for a tracheostomy. But tracheostomy is a procedure beta which is going to take some time. So till that time, till we perform tracheostomy, how to keep our patient alive beta? Uske liye we have to take a large or a wide bore needle and insert in the patient's cricothyroid membrane beta, so that some air at least is able to enter inside the patient's airway via this wide bore needle beta. And उस procedure को क्या बोलेंगे बच्चे अपन? That procedure will be called as needle cricothyroidotomy. तो emergency में बेटा, if endotracheal intubation fails, go for a needle cricothyroidotomy, but it will only work for the next 2 to 4 hours beta. So definitive क्या होगा? Definitive has to be tracheostomy. Anybody, what is the best site for making an incision during tracheostomy? What is the best site for a tracheostomy opening? Between which tracheal rings? Anybody? Best site for tracheostomy beta? Needle cricothyroidotomy, yes, very good. It is contraindicated in patients who are usually less than 12 years of age due to the risk of laryngospasm or laryngeal stenosis. Very good. The best site which is there beta for tracheostomy has to be between the second and the third tracheal rings, bache, right? It has to be between second and the third tracheal rings. So याद रखना, do not mark it as C2, C3. It is between the second and the third tracheal ring. यहाँ पे होता है बेटा. That has to be remembered. Clear है बात? Very good. That is important. Now this was about the airway of the patient beta. Apart from this, second is breathing management. जहाँ पे if the patient is having a mild respiratory distress, you should only give oxygen support either with the help of oxygen mask or a high flow nasal cannula. But if the patient is having a severe respiratory distress beta, then you should insert an endotracheal tube and go for a IPPV beta. What is IPPV? Intermittent positive pressure ventilation beta. जब mechanical ventilator is going to take care of the patient's breathing. Next important बच्चे, if I talk about basically is circulation management. Circulation में you have to give IV fluids to the patient बच्चे, and for that reason you should get a peripheral IV access. You have to insert a IV cannula in the peripheral veins. But if peripheral IV access is not possible, क्यों? क्योंकि if the patient is in shock or if the patient's blood pressure is very low beta, then obviously the vessels may not be visible. So if peripheral IV access is not possible, then what should be your choice? If peripheral IV access is not possible, then what should be your choice? Directly intraosseous पे नहीं जाते बेटा अपन. Central line, please remember, central line insertion has to be done. Okay, we have discussed कि central line जब insert करते हैं बेटा, it basically has three main important indications, right? Central line has indications of, first, if the peripheral IV access is not possible in patients of shock. Second, अगर किसी पेशेंट में बेटा वी हैव टू गिव कीमोथेरेपी, तो इट कैन एक्ट एज अ कीमो पोर्ट बेटा. एंड थर्ड, डेफिनेटली फॉर पैरेंटरल न्यूट्रिशन इन अ पेशेंट बच्चे, वी कैन यूज अ सेंट्रल लाइन. सेंट्रल लाइन में प्लीज टेल मी विच इज द बेस्ट साइट ऑफ सेंट्रल लाइन इंसर्शन. विच इज द वेन बेटा दैट इज द बेस्ट साइट फॉर सेंट्रल लाइन इंसर्शन? एनीबडी? Best vein for central line insertion, anybody? Vein कैन्युला 14 या 16 गेज यूज होता है बेटा ड्यूरिंग रिससिटेशन. मिनिमम 18 गेज कैन्युला यूज होता है. रिकमेंडेड इज 14 और 16 गेज, दैट इज ऑरेंज और ग्रे रेस्पेक्टिवली. मिनिमम इज 18 गेज. बट मैं उसके बारे में नहीं पूछ रहा बेटा, आई एम आस्किंग अबाउट द वेन. वेरी गुड, इट इज द सबक्लेवियन वेन बेटा. The best vein that is used is going to be the subclavian vein beta, 2 fingers below the clavicle. Subclavian vein will be the best site for central line insertion. But अगर वो पूछते हैं most common vein that is used, तो easy one is the IJV or the internal jugular vein. तो most common site for central line insertion is the internal jugular vein. And least common site, if they ask you, it is femoral vein beta. अगर वो पूछते हैं क्यों, तो least common site beta for central line insertion is the femoral vein, because there will be a very high risk of infections and thrombosis if we do a central line insertion from the femoral vein. Very high risk of infections and thrombosis beta. Clear है बात? चलो. So that is important. Done with this. And याद रखना, once you get either a peripheral IV access or you insert a central line or intraosseous access in patients of trauma, then you should give fluids beta. You should give 1 liter of crystalloid in a span of 10 minutes beta. So fast fluids you have to give ड्यूरिंग द ATLS प्रोटोकॉल बेटा. ठीक है, और उसके बाद जितना भी फ्लूइड चढ़ाना है, हाउ मच फ्लूइड यू हैव टू गिव नेक्स्ट विल बी डिसाइडेड बाय PCWP और CBP बेटा. क्लियर है बात? चलो, तो दैट इज इंपॉर्टेंट टू बी रिमेंबर्ड. Next important is about this beta, intracranial hemorrhages. What is that? Any bleeding inside the cranial cavity beta. We know that this usually happens whenever a patient comes to you after a head trauma or head injury. And we know that for head trauma or head injury patients or for intracranial hemorrhages, the investigation of choice has to be a NCCT head beta. What is NCCT? A non-contrast CT scan of head. If something appears more white on the NCCT, see, normally brain appears gray in color beta, that is called as isodense. But if something appears more white on the NCCT beta, that is called as hyperdensity, and that is suggestive of an acute hemorrhage or an acute bleeding. But if they say beta, if something appears more black on the NCCT, okay, if something appears more black on the NCCT beta, that is called as hypodense or hypodensity beta. Please tell me, hypodensity is suggestive of what? Hypodensity is suggestive of what? If something appears more black on the CT scan, that is known as hypodensity. That is suggestive of what? Either it is suggestive of infarction beta. Very good. Either it is suggestive of an infarction. तो अगर मेडिसिन का केस आता है तो इन्फाक्ट होगा बराबर. But here they are not saying any kind of infarction का history. That means they are not saying about atherosclerosis वगैरह. They are saying there is a history of trauma 3 weeks ago. Very good. Then it is suggestive of a chronic bleeding or a chronic hemorrhage. याद रखना, even the chronic bleed or chronic hemorrhage can appear black or hypodense beta. Recent question of your examination, so do remember that. ठीक है, शाबाश. Here you are able to see beta, this is the classical picture जहाँ पे the hyperdensity which is there बच्चे, it is convex on both the sides. So here you are able to see beta biconvex or a lenticular, lens like दिख रहा है ना. So here you are able to see beta, there is a biconvex or a lenticular hyperdensity. And when there is a biconvex or a lenticular hyperdensity, that is suggestive of EDH, that is extradural hemorrhage beta. We know in patients of extradural hemorrhage बच्चे, याद रखना, which is the most common vessel to bleed over here? in patients of extradural hemorrhage beta, which is the most common vessel to bleed? Short में लिख देना, no issues. Which is the most common vessel to bleed beta in patients of extradural hemorrhage? Very good. Yes, it is very good. It is called as the MMA beta. What is MMA? Middle meningeal artery. The most common vessel to bleed in extradural hemorrhage has to be the MMA, that is the middle meningeal artery beta. In patients of extradural hemorrhage beta, there is a period of consciousness between two periods of unconsciousness, and that is classically called as period of consciousness between two periods of unconsciousness, finally landing up into death of the patient. It is classically called as lucid interval, bache. Very good. So please remember, lucid interval can be seen in other conditions, but it is somewhat specific of extradural hemorrhage beta in the patient. याद रखना, extradural hemorrhage में बेटा, once you diagnose this condition and if we decide the treatment beta, please tell me first condition, when the size of hematoma is less than 30 cc, okay, when the volume of hematoma is less than 30 cc or that is less than 5 millimeter midline shift beta. Okay, the size is less, the volume is more less than 30 cc or less than 5 millimeter midline shift. Then what is the treatment option? Then what is going to be the treatment option, anybody? Very good. Then the treatment option has to be conservative beta or observation. Very good. Then the treatment has to be conservative management or observation beta. That has to be remembered. Surgery nahi karte if the volume is less than 30 cc or midline shift is less than 5 mm. ठीक है? We know that treatment or the surgery which is done, it is only done beta when it is more than 30 cc volume or more than 5 millimeters का midline shift बच्चे. शाबाश. ठीक है? When it is definitely showing of more than 5 millimeter midline shift or more than 30 cc volume, and the surgery would be beta. First, if it is very small one beta, small hematoma hai, so we can just evacuate the hematoma by a borehole surgery बच्चे. और अगर large hematoma है, then we have to open up the cranial cavity of the patient, that is known as craniotomy. मुझे बताओ previous year question of your exam बेटा कि borehole surgery which is there, what is the surgical landmark for that borehole surgery? What is the surgical landmark for that borehole surgery? कहाँ पे drill करोगे hole inside the cranial cavity? Very good. The landmark, beta, surgical landmark for a borehole surgery has to be the pterion. Shabash. It has to be the pterion, beta. Repeated question of FMG examination. Okay. Next important beta, it is this one picture over here. Here you are able to see what? Here we are able to see beta that the hyperdensity which is there on the CT scan. On one side it appears convex, another side it appears concave beta. So it is classically called as a concavo-convex hyperdensity, or as it appears like a half moon bitche, it is also known as a crescentric hyperdensity. So when there is a concavo-convex or a crescentric hyperdensity on the NCCT head, that is classically suggestive of a SDH beta, that is known as a subdural hemorrhage. And subdural hemorrhage, we know beta, it usually occurs after a trivial trauma. And very important ना सरकारी हिस्ट्री बेटा, क्या सरकारी हिस्ट्री देंगे वो क्वेश्चन में? वेरी सरकारी हिस्ट्री, वेरी कॉमन सरकारी हिस्ट्री विल बी हिस्ट्री ऑफ व्हाट? हिस्ट्री ऑफ फॉल कहाँ पे बेटा? हिस्ट्री ऑफ फॉल इन bathroom. Very good. So they will give beta a elderly patient who is having a history of fall in bathroom. Very classical of subdural hemorrhage बच्चे. So we know that SDH which is there or subdural hemorrhage which is there beta, it is either commonly seen in elderly patients beta, okay, with a history of fall in bathroom, or it is very commonly seen in boxers too beta due to repetitive trauma. ठीक है? If they ask you बच्चे क्या what is the most common vessel to bleed over here, the most common vessel to bleed बच्चे in patients of subdural hemorrhage is going to be the cortical bridging emissary veins beta. ठीक है? तो we know that definitely in patients of subdural hemorrhage beta, the most common vessels to bleed are going to be the cortical bridging emissary veins. So if they ask you बच्चे that which is the only venous intracranial hemorrhage, answer is SDH beta. बाकी सब में arteries bleed करती है. ठीक है? If they ask you definitely यहाँ पे what is going to be the treatment, the same logic applies beta. If the patient is having a small hematoma and the patient is asymptomatic, no treatment is done, that is conservative management or observation you can mark. But if the hematoma is large beta or if the patient is symptomatic, then we have to go for the treatment beta. So the same treatment will be done. Either a borehole surgery would be done beta or a craniotomy would be done in this patient. And if the patient is having features of raised ICP, तो हमें पता है बेटा for raised ICP or a raised intracranial pressure we have to give IV mannitol. But when IV mannitol will be contraindicated, कब आईवी मैनिटॉल नहीं देंगे पेशेंट में? In patients of intracranial hemorrhage due to raised ICP, we can give IV mannitol or for osmotherapy. But what is that condition where we will not give IV mannitol? Very good. Yes, if there is a active cerebral hemorrhage beta or active bleeding, yes, it is absolutely contraindicated during a active cerebral hemorrhage or active bleed. Shabash. Next important beta, यहाँ पे the hematoma which is seen over here beta, you can see it is seen inside the hyperdensity is seen inside the ventricles and the sylvian fissure beta. So here you are able to see the classical star shaped hyperdensity. So if you are able to see a star shaped hyperdensity beta, it has to be a classical case of SDH, SAH beta. It has to be a classical case of SAH, that is subarachnoid hemorrhage beta, where there is bleeding inside the subarachnoid space or in the ventricles of the brain beta. ठीक है, subarachnoid hemorrhage which is there, it can either occur due to trauma or spontaneous rupture of berry aneurysms beta. Okay, it can either occur due to trauma बच्चे, or it can occur due to a spontaneous rupture of berry aneurysms. Now important is if they ask you due to trauma which is the most common vessel to bleed, तो हमें पता है बेटा due to trauma if they ask you if there is a SAH, due to trauma if they ask you beta if there is a SAH, then you have to remember then the most common vessel to bleed beta in patients of SAH has to be the branches of middle cerebral artery beta. Then it has to be the branches of MCA or the middle cerebral artery. But if they ask you spontaneous rupture of berry aneurysms की वजह से, then your answer has to be beta. Then your answer has to be anybody, the anterior communicating artery beta. Okay, then your answer has to be the ACA, anterior communicating artery. Now whenever a patient of subarachnoid hemorrhage comes to us beta, very classical, the patient will come to you, doctor साहब ऐसा सर दर्द जिंदगी में नहीं हुआ. That means the patient is going to complain of a thunderclap headache beta or the worst headache of his life. The patient is going to complain of thunderclap headache or worst headache of his life beta. ठीक है. Along with this, definitely the patient will also complain of neck stiffness, and that neck stiffness is classically known as nuchal rigidity beta. This is due to meningeal irritation. अब मुझे बताओ, if I just add fever in this, if I add fever along with the severe headache and the nuchal rigidity beta, then it becomes a diagnosis of what? Then it classically becomes a diagnosis of what? If I add headache, rigidity and fever along with it, then it becomes a classical diagnosis of meningitis beta. Yes, तो याद रखना subarachnoid hemorrhage is a very close differential for meningitis. Okay, so please remember when they only say thunderclap headache along with nuchal rigidity beta, then the diagnosis has to be subarachnoid hemorrhage irrespective whether trauma is given in the history or not. ठीक है, तो याद रखना if fever is added then you can mark it as meningitis. Clear है? Hopefully that's clear to all of you now. If they ask you beta when this patient of subarachnoid hemorrhage comes to you and you diagnose it as this case, तो treatment if they ask you, तो हमें पता है बेटा that if it is a traumatic subarachnoid hemorrhage then we directly go for a conservative management बेटा. Traumatic SAH में only conservative management is done, and that is done with which drug? IV nimodipine or IV nicardipine? Anybody? It is usually done with which drug? IV nimodipine or IV nicardipine? Shabash. Then it has to be done बच्चे with IV nimodipine. That has to be remembered. It has to be done with IV nimodipine beta. Whereas if I talk about a non-traumatic case, तो non-traumatic case मतलब due to spontaneous rupture of berry aneurysm beta. तो in non-traumatic case which is due to spontaneous rupture of berry aneurysms बच्चे, वहाँ पे तो first of all the first step that we have to do beta is an angiography or an angiogram. Reason, depending on the angiography we will decide beta whether we have to go for a conservative management or a surgical management beta. ठीक है. If we decide to do a conservative management, we have to give the same drug known as IV nimodipine. But if we decide to do a surgical management beta, then we basically have to place what? We have to place beta endovascular aneurysmal coils or clips beta, right? We have to place inside the vessel endovascular coils or clips beta for the purpose of aneurysm. ठीक है, तो endovascular coils or clips should be used so that the aneurysms do not rupture in future. ठीक है, so that is important. Next important beta, it is this condition over here. क्या दिख रहा है इस condition में? You are basically able to see beta there is a hyperdensity which is seen inside the brain tissue or the brain parenchyma. when there is a hyperdensity inside the brain tissue or brain parenchyma beta. This is a classical case of intraparenchymal hemorrhage, or we can call it as a intracerebral hemorrhage beta. So it is a case of intraparenchymal or intracerebral hemorrhage. We know that this condition which is there, it is again more commonly seen in elderly patients beta. But which elderly patients? Those elderly patients who are having a uncontrolled hypertension, due to which the brain vessels are going to rupture beta, and that may cause a intraparenchymal bleed. याद रखना, सरकारी क्वेश्चन ऑफ योर एफएमजी एग्जामिनेशन, दैट व्हाट इज द मोस्ट कॉमन साइट फॉर इंट्रा पैरेंकाइमल हेमरेज? एनीबडी? द मोस्ट कॉमन साइट फॉर इंट्रा पैरेंकाइमल ब्लीडिंग हैज टू बी, yes, it has to be the putamen beta, please remember. Okay, so it has to be the putamen. I hope all of you are quite aware that intraparenchymal or intracerebral hemorrhage is same as hemorrhagic stroke beta that you might have studied in medicine, right? Most common site is the putamen, and the blood vessel which supplies the putamen or the basal ganglia is going to be ruptured over here. So the most common vessel that ruptures over here is classically called as the Charcot's artery beta, or we can call it as the lenticulostriate artery. It is known as the Charcot's artery or the lenticulostriate artery. That has to be remembered. Okay. If they ask you beta what is going to be the treatment over here, the treatment in patients of hemorrhagic stroke or intracerebral hemorrhage is only conservative, and the drug that we give over here beta, it has to be IV nicardipine. Intracerebral hemorrhage के लिए IV nicardipine has to be given. क्लियर है बात? अगर IV nicardipine ऑप्शन में ना हो, then you can even mark it as IV labetalol beta. That can also be used. No issues with that. ठीक है? IV nicardipine हो, IV labetalol हो, IV sodium nitroprusside, these are the drugs beta, but preferred is nicardipine. ठीक है? Next important बच्चे, if I talk about is this picture over here. यहाँ पे they say beta, a patient of head injury has come to you, and that patient of head injury is basically having a GCS which is very very low beta. The GCS of the patient is very very low, that is around 3 to 8. Why? Because we know the GCS of 3 to 8 is suggestive of a severe head injury. But when we do a NCCT head of the patient beta, when we do a NCCT head of the patient बच्चे, that NCCT head of the patient comes out to be normal. So GCS is so low beta and NCCT head of the patient comes out to be normal. No hyperdensity as such is seen in the NCCT head. Then it is a very classical diagnosis of DAI. Very good, shabash. It is a very very classical diagnosis beta that becomes a diagnosis of DAI. What is DAI? It is the most severe form of brain injury beta called as the diffuse axonal injury बच्चे. It is the most severe form of brain injury, classically called as a diffuse axonal injury. अगर मैं diffuse axonal injury की बात करता हूँ, here there is actually a damage to the all axons beta, damage to all the axons which are lying at the gray matter white matter junction throughout the brain beta, right? That condition is known as diffuse axonal injury. Here the patient will come to you with a very low GCS, or the patient's GCS will not be improving, or the patient will be in the comatose state beta, and at the same time the NCCT head of the patient comes out to be normal. ठीक है? This is very classical. तो अगर NCCT head पे diagnosis नहीं होता, तो what is the investigation of choice for diffuse axonal injury? Previous year question of your exam from radiology as well. Investigation of choice for diffuse axonal injury, बोलो. Very good, shabash. It has to be a T2 weighted MRI beta, or a SWI MRI, shabash. It has to be a T2 weighted MRI or a Swift weighted intensity MRI. That has to be considered as the investigation of choice for this patient beta. On this T2 weighted MRI, we know water or blood appears white. So here you are able to see these bleeding spots bache, at the gray matter white matter junction. And these bleeding spots which are seen at the gray matter white matter junction beta are basically called as a punctate hemorrhages. You are able to see punctate hemorrhages at the gray matter white matter junction, which will confirm the diagnosis of diffuse axonal injury in our patient beta. Okay? Treatment is only conservative because most of the patients are going to die out of diffuse axonal injury beta. That is important. Next important is a case of GCS beta. अम्मा याद आ जानी चाहिए as soon as I say GCS in the patient. GCS is nothing else but a Glasgow coma scale in a patient बच्चे. ठीक है? तो whenever we have to calculate a Glasgow coma scale. Why is Glasgow coma scale calculated? Glasgow coma scale is calculated beta, or it is assessed to see that whether my patient is having the mild, moderate or a severe head injury, right? To assess the severity of head injury beta or brain injury, basically we have to calculate the patient's GCS or the Glasgow coma scale. हमें पता है in GCS बच्चे there are 3 parameters that we have to take care of. One is the E, second is V, and third is M beta. EVM has to be the three parameters. Okay, and those maximum scores are 4, 5, 6. Okay, so EVM 4, 5, 6 is the mnemonic to be remembered. E for the eye opening response, bache, whether the patient is opening the eye spontaneously or we have to ask the patient to open the eyes. Next, V for verbal response, whether the patient is speaking properly, okay, or the patient appears confused. And M for motor response, whether the patient is able to obey your commands or not, beta. Okay, so that has to be remembered. If they ask you, beta, first of all, eye opening response. If the patient opens the eye spontaneously, then the patient should be given a score of E4. If the patient is not opening the eyes spontaneously, but when you ask the patient to open the eyes, beta, amma aankhein kholo, then the patient opens the eyes, beta. That means patient opens the eyes to voice command or to sound, beta. Then patient should be given a score of E3. Next, if the patient is not opening the voice, if the patient is not opening the eyes on voice command, beta, so you have to apply pressure or you have to give painful stimulus. If the patient opens the eyes to pressure or to painful stimulus, then given a score of E2, beta. And if the patient is not opening the eyes at all, beta, that means given a score of E1. Clear about that? Is important. Next important, bache, if I talk about, if the patient appears to be oriented to time, place and person, beta. If your patient appears to be oriented to time, place and person, matlab the patient is not having any problem in speech, beta, then you should give us case of, then you should give a score of V5. Next, if the patient appears confused or disoriented, beta, then you should give a score of V4. Next, if the patient is speaking inappropriate words, beta, galia deta hai patient. If the patient speaks inappropriate words, beta, okay, then patient is given a score of V3. Next, if the patient is going to make only incomprehensible sounds, ah, ooh, all of that. If the patient only makes incomprehensible sounds, then given a score of V2, beta. And if the patient makes no sound at all, then given a score of V1. Okay? Next important, beta, if I talk about the motor response in the patient, अब याद रखना बेटा, if I talk about the motor response, if they say beta that if your patient is able to obey the command, बच्चे, if the patient is able to obey the command, then the patient is given a score of M6, बेटा. ठीक है? If you say अम्मा हाथ उठाओ, अम्मा हाथ उठा रही है, so that means the patient is able to obey the command, given a score of M6. Next, if the patient is not able to obey the command, but at least the patient localizes the pain. अगर तुम पूछते हो अम्मा दर्द कहाँ है, तो अम्मा बताती है दर्द कहाँ है. Okay, so the patient is able to localize the pain, then given a score of M5. Next, if the patient withdraws on pain or there is a normal flexion, मतलब if you pinch अम्मा, बेटा अम्मा slaps you और अम्मा does a normal flexion, बेटा, ठीक है? तो अगर painful stimulus पे अम्मा withdraws or there is a normal flexion which is seen, then it is given a score of M4, beta. Next, अब patient में if there is an abnormal flexion, ऐसे, if the patient is having an abnormal flexion, beta, we know it is called as decorticate position, and that is given a score of M3, beta. ठीक है? Abnormal flexion is known as decorticate position, given a score of M3. Next, if the patient is in extension, beta, सीधे लेटी हुई अम्मा, if the patient is in extension called as decerebrate position, beta, that is given a score of M2. Okay, decerebrate position or extension is given a score of M2, beta. And if there is no tone at all in the muscles, it is given a score of M1. अगर कोई टोन ही नहीं बची है मसल्स में, then it is given a score of M1. अब please remember, beta, important things that if they say बच्चे that, just a minute, if they say the patient score is 13, 14 and 15, beta, if they say the patient score is 13, 14 and 15, it is suggestive of a mild head injury, beta. If the patient score is 9, 10, 11 and 12, okay, if the patient score is 9, 10, 11 and 12, then it is suggestive of a moderate head injury, bache. And if the patient score is 3, 4, 5, 6, 7, 8, beta, okay, if the patient score is 3, 4, 5, 6, 7, 8, then it is suggestive of a severe head injury. This I always tell you, beta, to avoid any confusion with that more than, less than, equal to and all of that. Okay, so always remember this. Clear about? If they say beta maximum GCS, so we know beta 4 plus 5 plus 6, that is maximum GCS is going to be 15, minimum GCS is going to be 3, beta, because each and every parameter has a minimum score of 1. Okay? If they say beta the patient is intubated, then what you are going to write? Are you going to remove the tube and check the verbal response? Obviously not. So if the patient is intubated, beta, तो क्या लिखते हैं अपन? Very good. We write it as VNT, beta. NT matlab non-testables, right? NT means non-testables, बच्चे. That has to be remembered. Clear about? Sure. So that is important. No issues with this. Done. Next important beta, if I talk about yaad rakhna, whenever a patient of head trauma comes to you, first of all, in the first 2 hours beta, you have to check the GCS of the patient every half hourly. हर आधे घंटे में check करो. In the next 4 hours beta, you have to check the patient GCS every 1 hourly. Okay. अगले 4 घंटे में हर एक घंटे में चेक करना है बेटा. एंड आफ्टर द इनिशियल 6 hours, पहले 6 घंटे के बाद यू हैव टू चेक द पेशेंट जीसीएस और मॉनिटर द पेशेंट जीसीएस एवरी 2 hourly बेटा. ठीक है, पहले 6 घंटे होने के बाद हर 2 घंटे में चेक करना है. ठीक है, please remember that. And whenever the patient's GCS is low beta, you always have to send the patient for an NCCT head. Now important is beta, here there are various types of fractures that you will be able to see. अब यहाँ देख सकते हो बेटा, here you are not able to see any fracture in the skull bone basically, but rather there is a dent in the skull bone. Why there is a dent in the skull bone? Because the skull bone which is there beta, it is very soft and elastic. ये जो skull bone दिख रहा है ना, it is basically a soft and elastic skull, and we know soft and elastic skull are usually seen in infants beta. So this kind of a indentation is basically seen in a soft elastic skull of infants. This is classically called as an indented fracture, or we can even call it as a Pond's fracture beta. We can call it as an indented fracture, or we can call it as a Pond's fracture beta. Next important, here you are able to see beta. Okay, yes, indented fracture, Pond's fracture, ping pong fracture, कुछ भी बोलो. Next important, here you are able to see beta, there is depression in the skull bone due to fracture. And whenever there is a depression in the skull bone due to a fracture beta, it is a depressed fracture. And I hope all of you are quite aware beta that depressed fractures are always treated by a surgical repair. Depressed fractures will always be treated by a surgical repair beta, that has to be remembered. And yaad rakhna, this depressed fracture in the skull bone is classically called as the fracture a la signature. Right, this depressed fracture is classically called as a signature fracture or the fracture a la signature which is clear. So that is important. Next important beta, sarkari question of your examination from Aftha ENT or surgery. Here this is a case of facial trauma. Now what is the history that they will give? They will give beta that the patient had a blunt trauma to the face, usually a tennis ball injury. They will say the patient had a blunt trauma to the face or a tennis ball injury, and now the patient has come to you with this kind of a feature. What is the diagnosis? Here it is an NCCT of the face beta, which is showing a very classical appearance. क्या दिख रहा है यहाँ पे? The soft tissues of the orbit are coming down inside the maxillary sinus beta, giving a classical appearance of a teardrop. Yes, so classically the NCCT of the face is showing us the classical teardrop sign. And when NCCT face shows us the classical teardrop sign beta, it is basically due to a blowout orbital fracture. Holman Miller ये नहीं होती बेटा. Holman Miller is basically is seen in patients of angiofibroma when the maxillary sinus wall is pushed forward. दोनों बहुत different है. ठीक है, तो please remember this is a case of a blowout orbital fracture. ठीक है, this is a case of a blowout orbital fracture that has to be remembered. Clear है बात? तो please remember beta, blowout orbital fracture which is there, definitely it is the diagnosis over here, very classical. And याद रखना, please remember that blowout orbital fracture में if they ask you which is the most common wall fracture beta, the most common wall to fracture over here, it has to be the floor or the inferior wall of the orbit beta. It has to be the floor or the inferior wall of the orbit, which is the most common one to get fractured. Treatment, if it is an undisplaced fracture beta and there is no entrapment of nerves or muscles, you can just go for a conservative management. But if there is entrapment of nerves, muscle, or it is a displaced fracture or injury to the orbit, then obvious injury to the eyeball, then we have to go for a surgical management. Clear about? So that is important. Here sarkari picture beta, what you are able to see in this picture over here. In this picture over here beta, we are classically able to see that there is bleeding around both the eyes of the patient beta. Okay, so definitely it is a classical picture of bilateral periorbital ecchymosis bache, right? And this bilateral periorbital ecchymosis is classically called as which sign? Yes, it is classically known as the raccoon's eye beta or the panda's eye, right? So this bilateral periorbital ecchymosis जो होता है बच्चे, it is basically a migratory contusion or a migratory bruise beta. That is important, and it is classically known as the raccoon's or panda's eye. Please tell me in the chat box that this raccoon's or panda's eye, it is usually seen in which fracture? This raccoon's or panda's eye, I have told you it is a superficial subcutaneous bleeding beta. Very good. It is a classical feature of ACF fracture beta, that is anterior cranial fossa fracture. So when anterior cranial fossa fracture happens, the patient will develop this classical raccoon's or panda's eye beta. That is important. Second, in ACF fracture beta, we know the most common site to get fractured is the cribriform plate. So ACF beta, in a lot of patients of ACF fracture, there is leakage of CSF from the patient's nose. That is classically known as the CSF rhinorrhea beta. That is classically known as the CSF rhinorrhea. So I can integrate it with ENT beta. Please tell me what is the best test for diagnosis of CSF rhinorrhea. Bolo bacho. What is the best test for the diagnosis of CSF rhinorrhea? Anybody? अमाइलॉइडोसिस में क्यों होगा बेटा? Best test, no, halocine could be seen in bloody CSF rhinorrhea, that is traumatic CSF rhinorrhea, but that's not the best test. उससे थोड़ी पता चलेगा कि it is CSF only and all of that. That cannot be confirmatory diagnosis. No, blotting paper कर लो, handkerchief कर लो, कुछ भी कर लो. Very good, Jim. It is beta 2 transferrin. Please remember, it has to be beta 2 transferrin. Beta 2 transferrin will be the best test to diagnose a case of CSF rhinorrhea. क्योंकि बीटा टू अगर है, बीटा टू ट्रांसफेरिन अगर है तो दैट हैज टू बी अ सीएसएफ, नथिंग एल्स. ठीक है, तो बीटा टू ट्रांसफेरिन इज द बेस्ट टेस्ट, वेयर एज एचआरसीटी स्कल बेस विल बी यूज टू डायग्नोज द साइट ऑफ लीक बेटा. तो डायग्नोसिस के लिए बीटा टू ट्रांसफेरिन एस्टिमेशन इज द बेस्ट और गोल्ड स्टैंडर्ड टेस्ट, बट टू सी द साइट ऑफ लीक इट इज एचआरसीटी स्कल बेस ओनली. ठीक है, चलो नेक्स्ट इंपॉर्टेंट बेटा इफ आई टॉक अबाउट इज दिस. क्या दिख रहा है यहाँ पे? देयर इज अ ब्रूजिंग ओवर मैस्टोइड दैट इज गोइंग टू बी सीन बेटा. So bruising or discoloration over the mastoid is classically called as which sign? The bruising over mastoid over here, it is classically known as which sign? Anybody? Bruising over mastoid is classically known as the battle sign beta, that has to be remembered. It is classically known as the battle sign, and battle sign we all are quite aware beta that battle sign is a classical feature of MCF fracture or the middle cranial fossa fracture. Right, battle sign is a classical feature of MCF or a middle cranial fossa fracture to be remembered. Please remember that in MCF fracture the petrous part of the temporal bone gets fractured beta. इसकी वजह से the patient starts having leakage of CSF from the ear, and when the patient is going to have leakage of CSF from the ear बच्चे, that is classically called as CSF autoria. That is classically known as CSF autoria beta. Now please tell me two important things beta, that which is going to be the most common cranial nerve injured in patients of anterior cranial fossa fractured. Which is going to be the most common cranial nerve injured in patients of anterior cranial fossa fracture? Give me the number, that's enough. First, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10, जो भी हो. Please tell me which is the most common. Very good. It is the first cranial nerve beta, that is the olfactory nerve. शाबाश. It is the first cranial nerve beta, that is the olfactory nerve. ACF में facial क्यों fracture होगी, facial क्यों injure होगी, sixth भी injure होगी बेटा in posterior, not in anterior. ठीक है, तो प्लीज रिमेंबर बेटा, इफ दे आस्क यू, वेरी गुड, इट इज द एंटीरियर क्रेनियल फोसा फ्रैक्चर. क्यों? क्रिब्रिफॉर्म प्लेट से बेटा द ऑल्फैक्टरी न्यूरॉन्स आर गोइंग टू पास. ठीक है, सो देयरफॉर इन एसीएफ फ्रैक्चर बेटा देयर इज अ ऑल्फैक्टरी नर्व इंजरी एंड देयरफॉर द पेशेंट हैज कंप्लीट लॉस ऑफ सेंस ऑफ स्मेल, classically called as anosmia. Whereas beta, if they ask you that when the patient is going to have a MCF fracture, middle cranial fossa fracture beta, then it is basically the seventh cranial nerve or the facial nerve which gets injured over here. Then it is going to be the facial palsy beta. In MCF fracture, it is going to be the facial palsy. Which clear है बात? चलो. So these are the important points about the cranial fossa fractures that you need to remember for your examination beta. ठीक है? Before tomorrow we will be discussing about the thoracic trauma and the abdominal trauma beta, don't worry. ठीक है, so tomorrow I'll discuss about blunt the thoracic as well as the abdominal trauma, so that will be covered tomorrow. This was about head trauma, so that is done. ठीक है, next important last point to be remembered beta is going to be okay, basically about neck trauma and about retroperitoneal trauma. We know only two things to be remembered about neck trauma हो या फिर retroperitoneal trauma हो बेटा. And in both the kinds of trauma, I just want one thing from all of you to answer, and that is, which is the zone that always needs a surgical exploration? In both the traumas beta, which is the zone that always needs a surgical exploration? Because over there in that zone beta, there is maximum risk of bleeding, okay, and therefore it always needs a surgical exploration. We know there are three zones. ठीक है, neck में बेटा there are three zones from the suprasternal notch till the cricoid cartilage, zone 1, from cricoid cartilage to angle of mandible, zone 2, and from angle of mandible till base of skull, zone 3. Retroperitoneum में there are three zones बेटा. Central is the zone 1, lateral is the zone 2, and pelvic is the zone 3 बेटा. Very good. In both the conditions beta याद रखना, in both the conditions it has to be the zone 1. In both the conditions it has to be the zone 1, because in neck also beta, when there is zone 1 injury, obviously there is maximum risk of injury to the vessels beta, like the carotid and the jugular vessels. Whereas in cases of retroperitoneal trauma also beta, there is maximum risk of injury to the vessels in zone 1 itself, because zone 1 or the central zone of retroperitoneum contains your aorta and the inferior vena cava beta. इसीलिए maximum risk of bleeding is usually seen in zone 1 itself. सिंगल बेस्ट आंसर देना हो बेटा तो आंसर ऑलवेज हैज टू बी जोन 1 ओनली. मैंने जोन 1 एंड जोन 3 उस कंडीशन में लिखा है बच्चे जब डेफिनेटली द ऑप्शंस वर नॉट जोन 1. ठीक है, अगस्त 2020 एग्जाम में देयर वाज नो सिंगल ऑप्शन. व्हाट वर द ऑप्शंस इन अगस्त 2020 वाज जोन 1 एंड जोन 3, जोन 2 एंड जोन 3, जोन 2 एंड सॉरी zone 1 and zone 3, zone 1 and zone 2, and zone 2 and zone 3, and all of the above बेटा. उस कंडीशन में अगर दो ऑप्शन चूज करने ही पड़ेंगे तो दो ऑप्शन जब चूज करने हैं तो योर आंसर इज राइट, देन इट इज जोन 1 एंड जोन 3 बेटा. बट सिंगल बेस्ट अगर है तो ऑब्वियसली आंसर हैज टू बी जोन 1 इटसेल्फ. ठीक है, zone 2 definitely beta is the most exposed area, it is the most common site of injury, but it is not the maximum like there is not the maximum risk of bleeding beta. Zone 2 is the most common site of injury but not the maximum risk of mortality or maximum risk of bleeding. ठीक है, तो याद रखना ये बात. Hopefully that's clear. Next important if I talk about beta is the burns basically. Now if I talk about burns in a patient बच्चे तो याद रखना burns की अगर मैं बात करूँ, anybody which are the most common type of burns, can you tell me? Most common type of burns overall, we know that the most common type of burns beta are going to be the steam burns basically, right? And steam burns may be the first degree steam burns called as scalds beta. Why does scalds happen? Scalds usually happen when you have any kind of hot liquid falling on the skin beta. Clear है बात? तो गर्म पानी अगर गिर जाता है skin पे, that causes scalds or the steam burns beta. But these patients do not come to us in the hospital. तो अगर वो पूछेंगे most common hospital burns are which ones, hospital में आने वाले कौन से burns common है, तो the most common hospital burns are going to be the flame burns बच्चे. Okay, जो आग में झुलस जाते हैं. The most common type of flame burns if they ask you, most common type of hospital burns if they ask you, answer is flame burns beta. Now we have discussed in burns beta that in patient of burns there are the three main mechanisms of injury or the three main mechanisms of death beta. तो सबसे पहले डेफिनेटली फॉर एग्जांपल इफ माय पेशेंट डेफिनेटली हैड इनहेलेशनल बर्न्स बेटा. अब इनहेलेशनल बर्न्स का हिंट कैसे आएगा बच्चे? इनहेलेशनल बर्न्स का हिंट आता है बेसिकली फॉर एग्जांपल if my patient who is there beta, if my patient basically is having any kind of burns in the face or the neck region. Second, if my patient is having burning or signing of nasal hairs. Second hint, signing of nasal hairs beta. थर्ड इंपॉर्टेंट, इफ माई पेशेंट वॉज ट्रैप्ड इन अ क्लोज बर्निंग रूम, अगर बंद कमरे में आग लग गई थी. ठीक है, इफ द पेशेंट वॉज ट्रैप्ड इन अ क्लोज बर्निंग रूम बेटा. फोर्थ इंपॉर्टेंट डेफिनेटली बच्चे, व्हेन माई पेशेंट इज गोइंग टू हैव hoarseness of voice beta, that is suggestive of laryngeal or vocal cord edema. Fifth important beta, if the patient is going to have black or carbon particles in the sputum beta. क्यों? If there is black or carbon particles in the sputum, that means my patient has inhaled that soot particles beta from the burn flames. ठीक है, so these are features of inhalational burns beta. So if my patient is having inhalational burns, there can be inflammation and edema of his airway causing narrowing and respiratory distress leading to hypoxia. Second reason for hypoxia beta, if my patient has inhaled those soot particles, there will be chemical alveolitis and alveolar edema in my patient causing again respiratory distress beta or leading to hypoxia. And third, if there is a leathery blackish appearance of skin. What is that leathery blackish appearance of skin in burns called as eschar? And we know eschar acts as a compression band. So if the eschar is formed around the chest wall of my patient beta, compressing its chest wall, that can even cause respiratory distress leading to hypoxia. These are the three main reasons beta which can cause hypoxia or asphyxia in my patient, suffocation basically, right? And we know that asphyxia or hypoxia are the cause of immediate death in patient of burns. So if they ask you which is the most common cause of immediate death in a patient of burns, the answer has to be either asphyxia or hypoxia beta. Okay, but asphyxia or hypoxia is not an option. Then we know beta the second most common cause of immediate death in a case of burns within 2 to 4 hours beta has to be neurogenic shock. Okay, the second most common cause of immediate death in a case of burns has to be neurogenic shock due to extreme pain. नेक्स्ट इंपॉर्टेंट बेटा द प्रॉब्लम विच वॉज देयर डेफिनेटली, ठीक है. So please remember beta, next important if I talk about is going to be about early death. Early death matlab definitely beta, if my patient, okay, if my patient, if they ask you bache, is going to have what, if my patient is actually going to have death within 24 to 48 hours beta. अब याद रखना, in the first 24 to 48 hours what is going to happen? First of all beta, there is burning of the blood vessels. Second, there is high temperature in the body causing evaporation. And third, there is inflammation making the blood vessels leaky or increasing the vascular permeability, जिसकी वजह से lot of fluid will leak outside the blood vessels beta, and that will actually cause hypovolemia in my patient, and due to that my patient will land up into hypovolemic shock, and that will cause death of my patient in the first 24 to 48 hours. I've told you that the most crucial period of a hypovolemic shock beta is the first 24 hours. इसीलिए in patient of burns maximum amount of fluid resuscitation is done in the first 24 hours. So please remember, early death in a case of burns beta is usually due to hypovolemic shock. Next important bache is, if they ask you after 3 to 5 days if my patient is dying beta, usually after 3 to 5 days definitely if there is death in my patient, then usually the cause is nothing else but sepsis beta. Okay, reason is due to burns. The patient first of all will have burning of the skin beta, so the organisms can directly enter inside the body. Second important, the patient's immunity will get compromised, therefore the chances of sepsis are going to increase. If they do not mention anything, any timeline, then also the most common cause of death in patient of burns overall has to be sepsis beta. ठीक है, कुछ मेंशन नहीं है तो sepsis मार्क करना. Important is, what is the most common cause of sepsis in a case of burns? Anybody? What is the most common cause of sepsis in a case of burns beta? बोलो. Most common cause of sepsis in a case of burns, बोलो. Very good. Then now your answer has to be Pseudomonas beta. So Pseudomonas aeruginosa, which is there bache, is the most common cause of sepsis in a case of burns. That has to be remembered. Clear about shabash. That is important beta. Clear? Next important, now answer this question over here. We have beta a 30-year-old male who was caught in fire and has been brought to the emergency room. Doctor, for assessment of total body surface area of burns, use the Wallace's rule of 9. We know bache that Wallace's rule which is there, it is the most common rule that is used to calculate the total body surface area of burns. Okay, his both the lower limbs have been burnt beta. Okay, and even the abdomen has been charred anteriorly. What is the total body surface area of burns involved? Do not consider lower limbs anteriorly beta. Do not consider lower limbs anteriorly. उन्होंने अलग अलग लिखा है. They have said both the lower limbs and they have said abdomen was charred anteriorly. ठीक है, they have said and और वगैरह कुछ नहीं है. तो please remember both the lower limbs and the abdomen was charred anteriorly beta. So now calculate it properly. Both the lower limbs and the abdomen was charred anteriorly. ठीक है, now you have to consider. ठीक है, both the lower limbs which is there beta. Okay, one lower limb is going to be how much? Both lower limbs, anterior as well as posterior beta. They did not mention lower limbs anteriorly. They just mentioned lower limbs. So do not consider lower limbs only anterior. Do not consider lower limbs only anterior. ठीक है, पूरा lower limb consider करो. So if they only say both the lower limbs beta, if they had to write, they would have written both the lower limbs anteriorly as well as abdomen has been charred anteriorly beta. ठीक है. So one lower limb is going to be 18% बच्चे. So 18 plus 18 36%, and 36 plus 9 because abdomen anteriorly will be 9% beta. 36 plus 9 would be how much? 45% would be the answer beta. And this was the recent question in the FMG examination earlier. This was the recent question of your FMG examination. A lot of people made a mistake beta by just calculating only the lower limbs anteriorly beta. ठीक है, तो कभी कभी you have to be smart enough in the examinations. I know the examiners are going to trap you in this at times. ठीक है, तो इसीलिए if they would have mentioned separately कि both lower limbs anteriorly, तो I would only calculate 9 plus 9 beta. बट अगर कुछ नहीं मेंशन है तो both lower limbs पूरा कैलकुलेट करो, and abdomen anteriorly mention है तो abdomen को anteriorly mention करो बस. ठीक है, so that is important. So please remember, if they ask you which is the most common rule to calculate the total body surface area of burns, so answer has to be the Wallace's rule of 9 beta. According to the Wallace's rule of 9, head and neck of the patient is going to be 9%. Please remember that. ट्रंक अगर वो बोलते हैं, वी नो बेटा ट्रंक मीन्स थोरैक्स प्लस abdomen टुगेदर, तो एंटीरियर थोरैक्स और चेस्ट विल बी 9%, posterior thorax or the upper back will be 9% beta. Anterior abdomen is going to be 9%, posterior abdomen or the sorry, posterior abdomen or the lower back is going to be 9% बच्चे. One upper limb which is there beta, it is going to be 9% each, whereas one lower limb which is there beta, it is going to be 18% each. मतलब anterior lower limb 9%, posterior lower limb 9%. Whereas if they ask you beta genitalia and perineum, तो याद रखना in the whole body everything is 9% except the genitalia and perineum. This is a repeated question of FMG exam, that Wallace's rule of 9 के according each and every body part of the patient is considered as 9% except answer is genitalia and perineum, which is considered as 1% of total body surface area. Next important beta, if they ask you which is the best rule for calculating the total body surface area in children beta, the best rule that is used for calculating the total body surface area burnt in children has to be the Lund and the Browder charts beta. याद रखना, the best rule that is used for children, answer has to be the Lund and the Browder charts. Lund and the Browder charts which is there बच्चे, it is going to be the best rule that has to be used. Okay, the best rule which is there beta, it has to be the Lund and the Browder charts. If they ask you if a patient is having patchy burns, तो क्या use करोगे बेटा? If they say the patient is having patchy burns, then definitely Wallace's rule of 9 or Lund and Browder charts will become difficult beta. तो patchy burns अगर किसी patient में है, तो what is the Browder charts that have what is the rule that has to be used? Very good beta, it is going to be the palm rule. So if the patient is having patchy burns beta, then we have to use the palm rule bache, do remember that. And in palm rule, what is the criteria? That one palm of the patient will be equal to 1% of his total body surface area, right? One palm of the patient will be equal to his 1% of total body surface area beta. That has to be remembered. Clear hai baat? So do remember that. Important is that if they ask you beta, that if the patient is having electrical burns bache, if the patient is having electrical burns, so please remember beta, in patients of electrical burns bache, there can be two types of injury. One is a DC injury and second is a AC injury. तो हमें पता है DC मतलब direct current injury, that usually happens beta when you are contact in with some electrical appliances, and then you will have a localized burn beta, localized deep burn होगा, that is called as joule burns. But AC which is there beta, it is usually in the commercial line basically. तो वहाँ पे जो इंजरी होती है definitely it is the alternating current or the AC injury that happens. ठीक है. Now important is, please tell me in patients of electrical burns 2 points beta. First is, what is the most common cause of death in patients of electrical burns? What is the most common cause of death in patients of electrical burns? Anybody? Most common cause of death in patients of electrical burns beta. Most common cause of death. When the electrical current will pass via the patient's body, won't it interfere with the patient's heart rhythm? And if it interferes with the patient's heart rhythm beta, obviously it is going to disturb the patient's heart rhythm, causing arrhythmias. Yes, तो याद रखना है बच्चे, that the patient is going to have arrhythmias basically. The most common cause of death in cases of electrical burns has to be arrhythmias. First thing. Second important, patients of electrical burns, we need more fluid resuscitation or less fluid resuscitation beta. In cases of electrical burns, we need more fluid resuscitation or less fluid resuscitation. We need a more fluid resuscitation, bachche, that has to be remembered. We need a more fluid resuscitation to be remembered. Okay, because electrical burns will cause a deeper injury always. First thing that is important. Ab electrical burns mein beta, the ATLS formula which is there, which is used to calculate the amount of fluid to be given in a patient of electrical burns, will have a multiplier of how much? Please tell me ATLS formula for electrical burns में, okay, to calculate the fluid amount to be given in a patient of electrical burns में multiplier is 2, 3 or 4. ATLS formula for electrical burns में the multiplier to be used is very good. It is 4 beta into body weight into total body surface area of burns. हमें पता है for ATLS formula in an adult it is only 2 into body weight into total body surface area of burns. For children less than equal to 14 years beta, it is 3 into body weight into total body surface area of burns. But for an electrical burn case beta, it has to be 4 into body weight into total body surface area of burns. मतलब ज़्यादा fluid देना है patient को. And last important beta, as I've told you, AC current is always dangerous than the DC current beta. Okay, AC current is going to be dangerous than the DC current. Important is definitely if they ask you बच्चे, that in a patient of electrical burns, when there is a lightning injury beta, So if there is a superficial lightning injury बच्चे on the exposed areas of the body, what is that classical pattern called as? What is that classical pattern called as? कौन से flowers बोलते हैं उनको? Lightning injury में कौन से flowers दिखते हैं body पे? If there is a lightning injury beta or lightning burns in a patient, so which flowers are seen on the body? Yes, it is either called as the filigree burns beta, or we can call them as the Lichtenberg flowers. Yes, so you can call them as the filigree burns, you can call them as the Lichtenberg flowers, you can call them as the keranographic pattern, you can call them as the ferning pattern, you can call it as the arborizing markings, कुछ भी बोलो. ठीक है, so multiple names. Lichtenberg flowers or filigree burns is the common terms used for that lightning injury beta. ठीक है. Next important point I will just cover up, and it is chemical burns बच्चे. If I talk about chemical burns in a patient, please tell me in a case of chemical burns beta, याद रखना केमिकल बर्न्स के केस जो होता है डेफिनेटली इन दोज कंडीशंस प्लीज रिमेंबर व्हाट इज द क्राइटेरिया. क्या करना होता है केमिकल बर्न्स के केस में? If the patient is having acid or alkali burns beta, we know that alkali burns are going to be always more dangerous than the acid burns beta. Reason is alkali burns are going to cause, okay, alkali burns are going to cause liquefactive necrosis and therefore a deeper injury, whereas acid burns will cause coagulative necrosis and therefore a localized injury. So alkali burns will have a more chance of perforation, therefore they are more dangerous beta. But what will be done? Never neutralize. Yes, please remember beta that whenever the patient is going to have chemical burns beta, तो अगर एसिड के बर्न से अल्कली मत डालो पेशेंट पे, ठीक है, अदरवाइज द पेशेंट्स कंडीशन इज गोइंग टू वर्सन. तो नेवर ट्राई न्यूट्रलाइजिंग द बर्न्स बेटा. व्हाट वी ओनली डू इज व्हाट इज डन फॉर द ट्रीटमेंट, we only go for either washing the wound beta or irrigation of the wound बच्चे, right? Yes, either we just wash the wound beta or we irrigate the wound beta properly with the help of saline or water beta, right? With the help of either water or saline, definitely you have to wash or irrigate the wound. क्या होता है उससे? Due to this, definitely beta, the contact period between the chemical and the skin is going to decrease. Okay, you just have to decrease the contact period between the chemical and the skin to decrease the uh, depth of injury beta, the severity of injury. Clear है बात? चलो. Next important beta, if I talk about basically is the degrees of burns बच्चे. We know that there are 4 degrees of burns. Okay, for and second degree is divided further into second degree superficial and second degree deep burns. First degree burns में there is damage only to the epidermis. Second degree superficial में there is damage to the epidermis and the superficial dermis. Second degree deep में there is damage to the epidermis and the complete dermis. Third degree burns में there is damage to the epidermis, complete dermis and the subcutaneous tissue. Fourth degree burns में there is damage to epidermis, complete dermis, subcutaneous tissue as well as the muscle and the underlying structures beta. Please tell me that blisters will be a characteristic feature of which degree burns? Anybody? Blisters will be a characteristic feature of which degree burns? Has been a previous year question of your exam. Blisters are fluid filled lesions seen in patients of burns on the skin beta. Very good. That blisters, very good, is a classical feature of second degree burns beta. And to be specific, it is more classically seen in second degree superficial burns beta. That has to be remembered. Next important, if I ask you beta, that blackish leathery appearance of skin known as eschar beta, it is a classical feature of which degree burns? Okay, please tell me. Eschar, which is there definitely beta. Okay, eschar, the blackish leathery appearance of skin, it is a classical feature of which degree burns? वेरी गुड बेटा, इट इज द थर्ड डिग्री बर्न्स, नॉट फोर्थ बेटा. फोर्थ में देख सकता है बट मेनली इट इज द थर्ड डिग्री बर्न्स. ठीक है, तो प्लीज रिमेंबर एस्कार विल बी अ क्लासिकल फीचर ऑफ थर्ड डिग्री बर्न्स. और पता है हमें दैट एस्कार विच इज द leathery appearance of skin beta, it is actually going to act as a compression band beta, and as it acts as a compression band beta, two problems will arise. First one, I've already told you कि when that eschar will be formed around the chest wall of the patient, it will compress the chest of the patient causing respiratory distress बच्चे. Second important problem beta, that if the eschar is formed around the limbs of the patient, it will actually compress the nerves and the blood vessel of the patient beta in the limbs, and that will actually cause a severe pain in the patient beta, classically known as compartment syndrome. Yes, eschar around the limbs can lead to compartment syndrome also. Okay, so दो क्वेश्चन है. फर्स्ट क्वेश्चन इज हाउ मच इज द प्रेशर इन कंपार्टमेंट सिंड्रोम? हाउ मच प्रेशर इन द ऑस्टियोफेशियल कंपार्टमेंट will cause compartment syndrome? Previous year question. बोलो. Very good. More than 30 millimeters of mercury. CC नहीं बेटा. More than 30 millimeters of mercury is the pressure बेटा. I have told you more than 30 millimeters of mercury. ये pressure दो जगह याद रखना है. First, it can cause compartment syndrome. Second, it can lead to pressure source also. Pressure source में भी pressure is same. More than 30 millimeters of mercury. शाबाश. First thing. Second, compartment syndrome में बेटा we make deep cuts or we make deep incisions over the fascia बेटा. That procedure is known as fasciotomy. तो अगर एस्कार है बेटा तो एस्कार में ट्रीटमेंट क्या होगा? इफ एस्कार इज कॉजिंग कंप्रेशन ऑफ चेस्ट वॉल और कंपार्टमेंट सिंड्रोम बेटा तो एस्कार पे वी विल मेक डीप कट्स और डीप इंसिजंस बेटा एंड दैट प्रोसीजर विच इज डन फॉर एन एस्कार इज क्लासिकली नोन एज द escarotomy, right? So please remember beta the treatment that we do for an eschar is basically called as an escarotomy bachche. Yes. And last point about the degrees of burns will be that which are the painless and anesthetic burns beta. कौन से burns painless होते हैं या anesthetic होते हैं? Anybody? First degree, second degree, third degree, fourth degree. Which burns are considered as painless and anesthetic burns? Only fourth? Only fourth or what? Only fourth or what? Very good. Third and fourth beta. Please remember to be specific. Answer has to be third as well as fourth. याद रखना है बात. So please remember because in both these burns beta the skin of the patient the nerves of the patient will be burnt out and अगर nerves ही नहीं रहेंगे बेटा तो obviously no sensations will be there, neither pain sensation or any other sensation beta. So definitely please remember that the third and the fourth degree burns which are there definitely beta both of them are considered as painless anesthetic burns beta. Okay, first and second degree are painful burns. Now if I talk about बच्चे the first degree burns basically याद रखना that first degree burns जो होंगे definitely in this condition the definitive management is just an exposure beta. In first degree burns beta the definitive management is just an exposure. Second degree burns if they ask you beta okay, second degree burns may definitely please remember the definitive management is dressing because the wound is somewhat deeper. Second degree burns में बेटा dressings have to be done. Please tell me which is the most common ointment used for dressing in burns. Which is the most common ointment used for dressing in burns? Let me know that in the chat box. Till that time I'll tell you about third and fourth degree burns बेटा. याद रखना third and fourth degree burns. In both these conditions बेटा as there is a lot of necrosis we have to clear the necrotic material. And clearing the necrotic material is known as debridement. And along with debridement beta we have to do a skin grafting also. So debridement along with skin grafting बच्चे has to be the definitive management of third and fourth degree burns. Do remember that. Clear है बात? So that is important. No issues with this. Very good. The ointment that is used beta very commonly in patient of burns has to be 1% silver sulfadiazine beta. It has to be ointment that is called as 1% silver sulfadiazine ointment. Okay. जल्दी एक बार ointments के बारे में. Which is the ointment that causes black staining of the dressings बेटा? वो ड्रेसिंग्स को काला कर देती है, बेडशीट्स को काला कर देती है. विच इज दैट ऑइंटमेंट दैट कॉजेस ब्लैक स्टेनिंग एवरीवेयर? विच इज दैट ऑइंटमेंट दैट कॉजेस अ ब्लैक स्टेनिंग एवरीवेयर? It is a silver nitrate ointment beta. Very good. Silver nitrate has to be the one. Best we have discussed beta, it is known as cerium nitrate. Okay, best ointment that is used beta, it is the cerium nitrate. And which is the only ointment beta that penetrates an eschar. ठीक है, the ointment that can penetrate an eschar beta, we have discussed that the ointment which can penetrate an eschar beta is going to be called as a mafenide acetate. Okay, the ointment that can penetrate an eschar is known as mafenide acetate beta. That has to be remembered. But the problems that are associated with mafenide acetate ointment, जो problems होते हैं mafenide acetate ointment की वजह से, the first problem beta that the patient is going to have is extreme pain will be there beta on application, and second the patient is going to develop metabolic acidosis बच्चे. So pain and metabolic acidosis are the two problems that are associated with mafenide acetate ointment. That is important. Shabash. Next important is this question out here beta which states that you have a child beta. Okay, we have a child over here who is weighing 20 kg and the child has been brought to you with burns and there is fluid resuscitation has to be started. Total body surface area involved in this child was around 30% only. Calculate the fluid requirement according to the Parker-Land's formula. Now we know beta that the Parker-Land's formula that we use to calculate the amount of fluid to be given in a patient of burns beta during resuscitation has to be 4 into body weight into total body surface area of burns. I've told you beta, unless and until they do not mention the modified Brooks version of Parkland's, do not use the new formula. Okay, this has to be the 4 into body weight into total body surface area of burns बेटा. अब बच्चे का body weight कितना है बेसिक, बच्चे का बॉडी वेट कितना है बेटा 20 kg, whereas how much is the total body surface area involved बेटा, it is 30%. So now you can calculate बच्चे the amount of fluid that will be required in this child बच्चे has to be around, yes, 2400 ml बेटा, it will be around 2400 ml. And हमें पता है बेटा that here definitely बच्चे the amount 2400 ml which is there, it is the amount of fluid to be given in the first 24 hours, right? We have discussed that this should be the amount of fluid beta to be given to the child in the first 24 hours beta. This is the amount to be given in the span of first 24 hours. Out of this beta, if they ask you, half amount should be given in. So out of this beta, half amount, that is 1200 ml, should be given in the first 8 hours beta. 0 to 8 hours mein you have to give this first half amount, that is very rapidly. And in the next half which is there beta, बचा हुआ जो आधा fluid होगा, the next half you have to give it from 8 to 24 hours beta, that is next 16 hours mein. The remaining 16 hours mein you have to give the half of the fluid. That is important. Clear hai baat? Now please tell me what is going to be the fluid of choice beta in the patient of burns. Anybody, what is going to be the fluid of choice in a patient of burns beta? What is going to be the fluid of choice in patient of burns? Very good. हमें पता है बेटा that the fluid of choice that we give in patient of burns has to be RL beta, that is known as Ringer's lactate, also known as the Hartmann solution which is. So we know that Ringer's lactate solution which is there beta, it is generally used, okay. Please remember that Ringer's lactate solution which is there beta in a case of burns, it is generally used beta in burns as well as in cholera. ठीक है, याद रखना. What is that condition in GIT beta where the Ringer's lactate will be avoided? 5% dextrose is added in children and that too for maintenance beta, not in the resuscitation time. Bolo, Ringer's lactate is avoided in which condition of GIT? I have told you. Ringer's lactate or Hartmann solution is the most physiological solution beta, has a very close concentration that of the plasma. CHPS, I hope all of you remember beta, CHPS के बच्चे में congenital hypertrophic pyloric stenosis में definitely the baby was already having beta metabolic alkalosis, and Ringer's lactate दोगे तो the metabolic alkalosis component of the patient will worsen. Why? Because lactate when it is broken down it releases bicarbonates beta, making the pH alkaline. इसीलिए beta in burns it is useful because in burns there is metabolic acidosis, so it gets corrected. But in CHPS के बच्चे में बेटा there is already metabolic alkalosis, you do not want to worsen it further. Clear है बात? चलो, next important बेटा are the case of cold burns. Basically we know बेटा that cold burns could be of two types beta. One is called as frostbite, the other one is known as the trench foot बच्चे. If I talk about cold burns beta, the first one you are able to see, this first one has happened at the freezing temperatures beta, and that too in which kind of cold beta? In a dry cold like ice for example or snow, right? तो जहाँ पे स्नो होती है बहुत ज़्यादा बेटा at those sites basically due to freezing temperatures or due to a dry cold, this kind of cold burns will happen, and this is classically known as frostbite beta, due to which there is ischemic necrosis of the toes and the fingers of the patient. Clear है बात? Next important, here you are able to see the other picture which is there. It will occur at a sub freezing temperature बेटा. Sub freezing का मतलब 0 degree 2 degrees. Okay, so this kind of sub freezing temperatures पे this problem is going to arise बच्चे, and this will occur due to moist cold. What is a moist cold? मतलब cold water is there. The patient has been standing in cold water for a very long duration of time. This is actually going to cause ulceration and necrosis in the skin beta. This is classically called as trench foot. Now whether it is a case of a frostbite beta or a trench foot, the management we know beta, the main management has to be gradual or a rapid rewarming. Anybody, what is the treatment beta? Gradual rewarming or a rapid rewarming? Very good. It has to be a rapid rewarming beta to be done, and please remember that rapid rewarming definitely beta, rapid rewarming it is definitely. So please remember beta, Bailey now recommends rapid rewarming to be done beta. ठीक है, and rapid rewarming अगर करोगे definitely, ठीक है, तो please remember in rapid rewarming what we have to do. we have to immerse the patient's fingers and toes beta in warm water bath. And what should be the temperature of that warm water bath? Anybody? What should be the temperature of the warm water bath? Anybody? The temperature of the warm water bath which is there beta, it should be around 40 to 42 degrees centigrades beta. The temperature of the warm water bath should be around 40 to 42 degrees centigrades. That has to be remembered, बच्चे. Clear है बात? That is important. Next important, if they ask you beta, is going to be, apart from rapid rewarming, during rapid rewarming patient has excessive pain beta, so for that purpose you have to give analgesics beta. Almost opioids लगेंगे, tramadol लग देना पड़ेगा, इतना पेन होगा बेटा during rewarming process. And third important, you have to go for a immediate surgery or a delayed surgery. So we have discussed beta that we go for a delayed surgery or a delayed amputation in this patient. Reason beta, see necrosis या gangrene हुआ है तो surgery या amputation करना ही है. But why delayed one? Because if we go for early surgery beta, the proper line of demarcation between viable and non-viable tissues would not have been developed. So we wait for the line of demarcation to develop clearly beta between the viable and non-viable tissues, and then we go for an amputation or a surgery. Clear hai baat? Chalo. So that is important. Please tell me, in patients of hypothermia beta, we have discussed in stage 2 hypothermia, when the temperature is around 28 to 32 degrees centigrades beta, what is the classical feature on the ECG that is seen? मैंने बोला था ये याद रखना, आया एग्जाम में. What is the classical feature on ECG in a patient of class 2 hypothermia? Very good. ECG पे the classical wave pattern that is seen beta, it is known as the Osborn wave or the J wave. Yes, the J wave or the Osborn wave which is there beta, it is going to be seen on the ECG. Very good, shabash, that is important. That was all about your burns beta. Next important is the breast. Now let's talk about breast beta. We have a lady who has presented to us with a breast lump bachche. What will be the best approach for examination of the lady, or what will be the best approach for assessment of the lady beta? I hope all of you are quite aware until now that whenever any patient who comes to you with a breast lump or a breast mass beta, the best approach of examination or the best approach for assessment will always be triple assessment beta. याद रखना ये बात, ठीक है? It is always going to be the triple assessment that has to be remembered. And when I say triple assessment बच्चे, triple assessment में क्या तीन चीजें करते हैं अपन? Triple assessment में we do three important things beta. First important is going to be, we have to take a proper history of the patient beta. History taking, along with that we have to do a clinical examination. So history taking and clinical examination is going to be the first part of triple assessment beta. ठीक है? Because see, breast lump के साथ आई है patient, तो it could be a cyst, it could be a benign tumor, or it could be a malignancy, that is breast cancer also. So family history plays a very important role along with clinical examination. And as somebody has mentioned, the best method for clinical examination, yaad rakhna, it will be the dial clock method beta. Next important is going to be the second part beta. Once you have done the clinical examination, you will send the patient for a radiological investigations beta. Now if I talk about radiological investigation, if the patient is young beta, less than 40 years of age, okay, if the patient is usually young, less than 40 years of age, then the radiological investigation of choice has to be an ultrasound beta. Right, then the radiological investigation of choice has to be an ultrasound. But if the patient is older beta, more than 40 years of age, patient is older more than 40 years of age, then definitely the radiological investigation of choice has to be a mammography bachche. Okay, then the radiological investigation of choice is a mammogram or a mammography. Clear hai baat? Chalo, so that is important beta. Next important, if they ask you, definitely is about the third part beta. And third part is nothing else but HPE, that is histopathological examination. ये कब करेंगे बेटा? That when our radiologist will give us a report, हमें पता है that whether you do a ultrasound, mammography or a MRI in a patient of breast lump beta, the radiologist has to give you a report in a same standardized format. What is that same standardized format of reporting radiological investigations in patients of breast lump called as? क्या बोलते हैं उसको? In any patient of breast lump beta, the radiologist gives you the report in a same standardized format, जहाँ पे he gives score to the patient from 0 to 6. क्या होता है वो? Radiological investigation reporting. Very good, shabash. It is known as BIRADS beta. तो याद रखना, BIRADS is nothing else but breast imaging reporting and data system beta. So we know breast imaging reporting and data system is known as BIRADS, where the radiologist gives a score of 0 to 6. Okay, BIRADS 0 मतलब the patient needs an additional investigation for properly confirming the diagnosis. By-Rats 1 मतलब there is negative investigation, मतलब there is no lesion inside the breast. By-Rats 2 मतलब, it is important बेटा याद रखना, कुछ कुछ important वाले याद रख लो. By-Rats 2 मतलब he says that डॉक्टर साहब this lesion is 100% benign. And जब he says By-Rats 2 है मतलब 100% benign है, तो we only go for routine screening of the patient बेटा after every 1 year. We do not go for the histopath then. ठीक है, that is important. But when he says By-Rats 3 है, By-Rats 3 का मतलब there is 2% risk of malignancy बेटा, not more but up to 2% risk of malignancy. So it is probably benign. Okay, so in the case beta when it says By-Rats 3 that is probably benign, we call the patient for a short interval follow up beta. And short interval follow up जो करेंगे, it is done after every 6 months beta, that has to be remembered. ठीक है, but when he says By-Rats 4 और By-Rats 5, हमें पता है By-Rats 4 मतलब suspicious of a malignancy and By-Rats 5 मतलब highly suspicious of a malignancy beta. In these two conditions beta, we always have to send our patient for a histopathological examination or a true cut biopsy when he says By-Rats 4 or By-Rats 5 beta. And By-Rats 6 is a biopsy proven malignancy. Clear about? So that is important. So histopathological examination, which is there beta, which is the third part of triple assessment, it is done when the By-Rats is either 4 or 5. And इसमें क्या करेंगे बच्चे अपन, इसमें we either go for a FNSE of the patient beta, that is a fine needle aspiration cytology, or we go for a true cut biopsy. If they ask you what is the single best investigation to diagnose a case of breast cancer, obviously beta, the single best investigation of choice to diagnose a case of breast cancer has to be a true cut biopsy बच्चे. Please tell me what is the size of needle to be used for true cut biopsy. I have told you updated है तो याद रखना ये बात. What is the size of needle nowadays to be used for true cut biopsy? Single best answer. How many gauge needle is used for true cut biopsy nowadays? Very good beta. Nowadays the size of needle that is used for true cut biopsy has to be 14 gauge beta. Nowadays the size of needle to be used for true cut biopsy has to be 14 gauge needle. Very good, शाबाश. अगर 14 नहीं ऑप्शन में then you can mark 16 बेटा. ठीक है, that is important. अब we know that breast cancer is very very common beta worldwide. That's the reason screening for breast cancer has to be done in healthy individuals, so that in case if any patient is having breast cancer in the early stages, an early diagnosis of that patient could be made, so that we can start the treatment early and the prognosis of that patient or outcome of that patient will be much better. ठीक है, तो इफ दे आस्क यू व्हाट इज द स्क्रीनिंग टेस्ट ऑफ चॉइस इन ब्रेस्ट कैंसर, तो जल्दी से बताओ स्क्रीनिंग टेस्ट ऑफ चॉइस इन अ फीमेल लेस देन 40 years of age. We know beta less than 40 years of age in the reproductive age group, the breast tissue is extremely dense and therefore mammography will not be useful. In a female who is less than 40 years of age, screening test of choice for breast cancer is ultrasound. In a female who is more than 40 years of age, now we can use a mammography beta. Now you can definitely go for a mammography, that has to be remembered. Whereas if they say beta, if there is a pregnant female, again pregnant female में we cannot go for a mammography because mammography is nothing else but a X-ray beta, and radiations are avoided during pregnancy. So pregnant female में again the screening test of choice is an ultrasound beta. Next, if there is any female who comes to you with a breast, any female who has to be स्क्रीन बेटा बट दैट फीमेल इज हैविंग ब्रेस्ट इम्प्लांट, तो सिलिकॉन जेल ब्रेस्ट इम्प्लांट्स अगर है पेशेंट के ब्रेस्ट में, then the best investigation for screening has to be MRI beta, then has to be MRI. And if they say there is any high risk female का मतलब any female who is having a family history of breast cancer beta, or any female who is having a BRCA or BRCA gene mutation beta, those are called as high risk females. ठीक है, so in high risk females also beta we should diagnose we should definitely do a proper screening with the best investigation, and that is a MRI. It has to be remembered. अब इधर स्क्रीनिंग बता दो, दो तीन कैंसर की पूछ लेता हूँ सो दैट वी आर रिवाइजिंग ना, तो इंटीग्रेशन होना ही चाहिए. तो प्लीज टेल मी व्हाट इज द बेस्ट स्क्रीनिंग मेथड फॉर प्रोस्टेट कैंसर बेटा, प्रीवियस ईयर क्वेश्चन फ्रॉम पीएसएम. बेस्ट स्क्रीनिंग मेथड फॉर प्रोस्टेट कैंसर बोलो. एनीबॉडी? पीएसए प्लस, पीएसए प्लस अलोन, पीएसए से भी बेहतर और कुछ है ना? पायरेट्स तो बेटा पायरेट्स इज जस्ट रेडियोलॉजिकल इन्वेस्टिगेशन, इट इज नॉट. पीएसए प्लस मैंने बोला था बेस्ट आंसर विल बी PSA तो है, ठीक है, PSA is the tumor marker for prostate cancer, that is serum prostate specific antigen. Along with PSA, no. PSA plus, anybody? DRE, digital rectal examination. So PSA plus digital rectal examination has to be the best answer, beta. Clear है? तो serum PSA plus DRE has to be the best answer, beta. अगर ये एक ऑप्शन में नहीं है, when both of them are not in the single option, then you can mark serum PSA as the second best choice. Best choice overall has to be serum PSA plus DRE. Clear है बात? That is important. Next, what is the best screening test, beta, for colorectal cancer? Best screening test for colorectal cancer. Anybody? Best screening test for colorectal cancer, क्योंकि prostate cancer is also common, colorectal cancer is also common. Best screening test for colorectal cancer. Colorectal cancer के लिए DRE क्यों करोगे? Best screening test for colorectal cancer is colonoscopy. Please remember that. Best screening test for colorectal cancer is colonoscopy, beta. If colonoscopy is not an option, then fecal occult blood testing, I've told you, right? The best screening test for colorectal cancer is colonoscopy, followed by fecal occult blood testing. That has to be remembered. ठीक है, बेस्ट स्क्रीनिंग टेस्ट अगर वो सर्वाइकल कैंसर के लिए पूछे तुम्हारी गायनी से, तो प्लीज रिमेंबर, आई होप दिस वुड बी गिवन. कोड टेस्ट बोला होगा, तो कोड टेस्ट बेटा, कोड टेस्ट इज व्हाट? पैप स्मीयर अलोंग विद HPV DNA बेटा, ठीक है, तो उसको कोड टेस्ट बोला जाता है. दैट इज द ओवरऑल बेस्ट, बट मोस्ट कॉमन अगर पूछेंगे तो पैप स्मीयर इज डन बेटा. एंड मोस्ट कॉस्ट इफेक्टिव अगर वो पूछते हैं तो प्लीज रिमेंबर, मोस्ट कॉस्ट इफेक्टिव देन इट इज वाया. ठीक है, सो दीज आर द थ्री इंपॉर्टेंट थिंग्स दैट यू नीड टू रिमेंबर बेटा. स्क्रीनिंग टेस्ट याद रखना, PSM से कॉमन क्वेश्चन आता है वो. इंपॉर्टेंट इज बच्चे, इफ आई टॉक अबाउट ट्रू कट बायोप्सी अगर करोगे इन पेशेंट्स ऑफ ब्रेस्ट कैंसर बेटा, प्लीज टेल मी दैट ग्रेडिंग विच इज देयर. Okay, the histological grading of breast cancer biopsy will be done by, please tell me, grading which is there beta, it is done by histological grading of breast cancer biopsy is done by, histological grading of breast cancer biopsy is done by. याद रखना, it is known as the Bloom Richardson score beta. तो Bloom Richardson score which is there बच्चे, Bloom Richardson score basically is generally used beta for the histological grading of breast cancer biopsy. If they ask you Gleason score is used for, previous year question of your FMG examination beta, Gleason score is used for, Gleason score is used for grading of which cancer? Gleason score will tell you about the grading and prognosis of which cancer? प्रोस्टेट कैंसर. शाबाश. ग्लीसन स्कोर जो होता है बेटा, इट इज यूज्ड फॉर द प्रोस्टेट कैंसर. नेक्स्ट इंपॉर्टेंट, हिस्टोलॉजिकल ग्रेडिंग ऑफ थायराइड कैंसर इज डन बाय विच क्लासिफिकेशन? हिस्टोलॉजिकल ग्रेडिंग ऑफ थायराइड कैंसर इज डन बाय विच क्लासिफिकेशन? FNSE ग्रेडिंग ऑफ थायराइड कैंसर इज डन बाय विच क्लासिफिकेशन? Bethesda classification बेटा, याद रखना. FNSE grading और histological grading of thyroid cancer is done by Bethesda classification. याद रखना बच्चे, ये जो इंपॉर्टेंट वन लाइनर्स होते हैं ना, टायराइड्स इज नॉट फॉर ग्रेडिंग बेटा. हिस्टोलॉजिकल पूछा मैंने, रेडियोलॉजिकल नहीं. रेडियोलॉजिकल होता तो टायराइड्स वुड हैव बीन द आंसर. आई हैव आस्क्ड यू हिस्टोलॉजिकल ग्रेडिंग, मतलब FNSE या बायोप्सी से, तो आंसर इज Bethesda. ये जो इंपॉर्टेंट वन लाइनर्स होते हैं बेटा, राइट देम इन वन स्टिकी नोट ना. जब भी यू गेट सम ग्रेडिंग, यू गेट सम स्कोर, ऐसे कुछ ग्रेडिंग एक स्टिकी नोट पे लगा दो एंड सामने चिपका दो, so that you keep on revising it. Don't, no need to like remember, open the books every time for remembering those gradings. Clear है बात? Now if I talk about breast cancer बच्चे, तो we know that breast cancer which is there, you have to remember that it is the most common cancer worldwide बेटा. Okay, it is the most common cancer worldwide. Whether they ask you most common cancer in females worldwide, breast cancer. Most common cancers in Indian females, which was a 6th July question, breast cancer, not CS cervix, not CS cervix. Most common cancer in Indian females is also breast cancer beta. Most common cancer, most common genital cancer in Indian females, तो mark कर सकते हो CS cervix, but not overall. Overall in Indian females also the cancer has to be breast cancer beta. Clear है बात? If they ask you definitely that what is the, okay, if they ask you beta that in the patients basically what is the most common cancer in males worldwide, the most common cancer in males worldwide is the lung cancer beta. If they ask you what is the most common cancer in Indian males, बच्चे most common cancer in Indian males basically बेटा सीए सर्विक्स है ही नहीं बेटा, सीए सर्विक्स है ही नहीं वर्ल्ड वाइड मोस्ट कॉमन. हु सेड वर्ल्ड वाइड मोस्ट कॉमन इज सीए सर्विक्स? विच रेफरेंस यू हैव? I've told you so many times, CA cervix will be a wrong answer if you mark. जेनाइटल कैंसर में मोर कॉमन है सीए सर्विक्स, बस ओवरऑल नहीं हो सकता वो. ठीक है, तो मोस्ट कॉमन लंग कैंसर, मोस्ट कॉमन इन मेल्स ओवरऑल बेटा इट इज गोइंग टू बी द लंग कैंसर. इन इंडियन मेल्स इट इज द ओरल कैंसर बेटा, और द ओरल कैविटी कैंसर. ओके, प्लीज रिमेंबर इट इज द ओरल कैविटी कैंसर. नो, हु सेड, व्हाट इज द रेफरेंस? Every ninth female in the world is having breast cancer beta, and CA cervix happened due to poor hygiene. Western countries do not have any kind of poor hygiene. कौन सा रेफरेंस है बोलने का कि सीए सर्विक्स इज द मोस्ट कॉमन कैंसर वर्ल्ड वाइड? ठीक है, प्लीज रिमेंबर बेटा दैट विल बी अ कंप्लीटली रॉन्ग आंसर. कोई टेक्स्ट बुक्स नहीं बोलती है. डू नॉट टेल मी रेफरेंस ऑफ एनी काइंड ऑफ नोट्स और एनी पीडीएफ्स वगैरह. हाँ, सेकंड मोस्ट कॉमन तुम बोलो, मोस्ट कॉमन नहीं बोल सकते उसको, प्लीज रिमेंबर दैट. मार्क करोगे गलत हो जाएगा और कुछ नहीं होगा. मोस्ट कॉमन कैंसर वर्ल्ड वाइड इन फीमेल्स इज ब्रेस्ट कैंसर. इन इंडियन फीमेल्स अगेन ब्रेस्ट कैंसर. मोस्ट कॉमन जेनाइटल कैंसर इन फीमेल्स, वो वर्ल्ड वाइड हो या इंडिया हो, तो तुम मार्क कर सकते हो सीए सर्विक्स बेटा. नेक्स्ट इंपॉर्टेंट, इफ आई आस्क यू बेटा मोस्ट कॉमन कैंसर इन एल्डरली मेल्स, वी नो इट इज द प्रोस्टेट कैंसर बेटा. रिस्क फैक्टर, तो प्लीज रिमेंबर द मोस्ट इंपॉर्टेंट रिस्क फैक्टर इन ब्रेस्ट कैंसर हैज टू बी हाइपर ईस्ट्रोजेनेमिया बेटा. We know it is a hormone dependent cancer, therefore we can use hormonal therapy for the treatment beta. So please remember hyperestrogenemia which is there. Okay, hyperestrogenemia or increased estrogen levels in patient's blood has to be the most important risk factor beta for breast cancer. अब hyperestrogenemia we know beta it happens whenever the patient will have more number of menstrual cycles, and when there will be more number of menstrual cycles बच्चे, whenever the patient will have an early menarche or a late menopause. So whenever there is an early menarche and late menopause beta, then the reproductive lifespan of the patient is more, there is more number of menstrual cycles beta. Second, hyperestrogenemia can also happen in patients who are obese beta, because obesity mein there is more amount of adipose tissue, more amount of aromatase enzyme which converts androgens into estrogen bachche. Okay, or the patients who are taking HRT bachche. HRT is nothing else but hormone replacement therapy beta, because high doses of estrogen and progesterone are given in the older or postmenopausal females in this condition, and that the reason it increases the risk of breast cancer beta. Or the female who has never been pregnant or who has never delivered beta, reason that is called as nulli gravida or nulliparity beta. So nulli gravida or nulliparity will be a risk factor. Reason is this female was never pregnant, so she never got break from menstrual cycles, so she was having more number of menstrual cycles, so more exposure to estrogen beta. Whereas pregnancy, lactation, multigravity, multiparity, all of these are considered as protective factors for breast cancer beta. Smoking अगर वो पूछे तो smoking in young females is a risk factor beta, but smoking in old females is a protective factor. Smoking in postmenopausal females is a protective factor for breast cancer. If they ask you which is the most common gene mutation in breast cancer, answer jaldi se. Most common gene mutation in breast cancer. Anybody? Most common gene mutation in breast cancer beta. डिड आई से फैमिलियल? वापस वही गलती कर रहे हो तुम लोग. डिड आई से फैमिलियल? डिड आई से फैमिलियल? वेरी गुड साकेत. याद रखना 90% ब्रेस्ट कैंसर्स आर स्पोरैडिक इन नेचर बेटा, और जो स्पोरैडिक केसेस होते हैं उसमें P53 इज द मोस्ट कॉमन जीन म्यूटेशन. ओके, अगर तुम बोलोगे बेटा कि फमीलियल ब्रेस्ट कैंसर में कौन सा कॉमन है, तो फमीलियल ब्रेस्ट कैंसर में BRCA1 और BRCA2 जीन म्यूटेशन आर मोर कॉमन बेटा. ठीक है, बट ओनली 10% केसेस आर फमीलियल. तो इसीलिए if they ask you the most common gene mutation, answer has to be P53, because 90% cases of breast cancer are sporadic. Yes, most common gene mutation in familial cases if you ask me, then it is BRCA1 followed by BRCA2. BRCA1 on chromosome number 17, BRCA2 on chromosome number 13 beta. BRCA1 causes more aggressive kind of a cancer, BRCA2 causes less aggressive kind of a cancer. If they ask you which is the most common site of breast cancer बच्चे, तो we know that if this is the breast beta, we can divide the breast into 4 quadrants. The most common site of breast cancer is the upper outer quadrant, and this is the most common site beta, the upper outer quadrant, and the least common site is ulta, the lower inner quadrant बच्चे. ठीक है, तो please remember the upper outer quadrant is going to be the most common site of breast cancer beta, sarkari question of your exam, whereas the lower inner quadrant will be considered as the least common site. उल्टा कर दो बस उसको, upper outer का lower inner हो जाएगा. Most common type of breast cancer if they ask you. So do remember beta that the most common type of breast cancer has to be IDC. And what do I mean by IDC beta? It is invasive ductal carcinoma. The most common type of breast cancer if they ask you beta, the most common type of breast cancer if they ask you, answer has to be an invasive ductal carcinoma. Okay, so that is important. Whereas if you ask me beta that which is that breast cancer जहाँ पे you are able to see a Indian file pattern, anybody? Biopsy showing a Indian file pattern is which type of breast cancer, anybody? When the histopathological examination or biopsy of a breast cancer shows a Indian file pattern, what is that type of breast cancer called as? What is that type of breast cancer called as? That is known as the invasive lobular carcinoma beta. Then it is known as the invasive lobular carcinoma, and we know that in invasive lobular carcinoma the gene mutation is E-cadherin gene mutation, which is also seen in gastric cancer beta. Okay, then it is no, not lobular carcinoma in situ, it is invasive lobular carcinoma beta, which is also seen in like where we will have E-cadherin gene mutation, which is also a gene mutation of stomach cancer. ठीक है, यहाँ पे what is this appearance classically? Here you are able to see edema of the breast skin beta, and we know edema of breast skin basically makes the skin looks like orange peel, and this is classically called as purity orange beta. ठीक है, so this is the classical appearance of purity orange. Sorry. Please remember previous year question. Purity orange which is there, we know it is cutaneous edema beta. It occurs due to what reason was the question. ठीक है, so we know that when the cancer is going to involve or when the cancer is going to block the subdermal lymphatics beta, when there is blockage of subdermal lymphatics, that is the reason for causing purity orange beta in a patient. Please tell me इस condition में what stage you are going to write? In this stage what stage you are going to write beta? In this picture, अगर ये picture आता है तो they ask you what is the stage of breast cancer. Answer is anybody? Sorry. Very good beta. If they do not mention anything, your answer has to be T4B beta. Reason is we know that in T4B, that is skin involvement beta, okay, definitely there will be purity orange. First of all, it is going to involve less than 1/3 surface area of skin beta, and second, there will be no signs of inflammation, without any kind of inflammation beta. But अगर वो same time पे बोलते हैं बच्चे that the patient is going to have purity orange beta, but that purity orange is going to involve more than 1/3 surface area of skin, but with signs of inflammation like redness वगैरह will be seen in the picture, then your answer has to be T4D beta, that is inflammatory breast cancer. Clear है बात? तो याद रखना, this is the important thing, previous year question तुम्हारे एग्जाम का. ठीक है, जल्दी से एक बार breast cancer staging I tell you. T1 is less than equal to 2 centimeter size. T2 is more than 2 centimeter but less than equal to 5 centimeter. T3 is more than 5 centimeter. मतलब you can easily remember T1 less than 2, T2 2 to 5, T3 more than 5. T4A is involvement of chest wall, T4B is involvement of skin, T4C is involvement of both chest wall as well as skin, T4D is inflammatory breast cancer. Now nodal staging, if I talk about the sentinel lymph nodes for breast cancer are axillary lymph nodes. N1 is axillary lymph node involvement, but the axillary lymph nodes are mobile in N1. N2A again axillary lymph node involvement, but यहाँ पे axillary lymph nodes are fixed or matted. Matted मतलब एक दूसरे से चिपके हुए हैं. ठीक है, तो N2A means axillary lymph node involvement, but they are fixed or matted. N2B only and only involvement of internal mammary lymph nodes. Yes, N2B में there is no axillary lymph node involvement बेटा. तो N2B only internal mammary lymph node involvement. Next is N3B, याद रखना है इसके बाद directly. N3B is going to be both, that is axillary as well as internal mammary lymph node involvement. Okay, N3B is axillary as well as internal mammary lymph node involvement बेटा. Clear है बात? Next important बच्चे, you are able to see this picture over here. So now this picture which is there बेटा, यहाँ पे क्या दिख रहा है? You are able to see destruction of the complete lumbar vertebra. Why? Because the breast cancer has spread to the lumbar vertebra. Yes, this is an example of distant metastasis beta. And we know distant metastasis in breast cancer which is there, it occurs via the hematogenous or the blood route, and the most common site of spread are the bones. Which bone mainly? The lumbar vertebra beta, followed by the neck of femur, followed by the thoracic vertebra. And it spreads via which veins beta? I've told you this also. It mainly spreads via the Batterson's plexus of veins. The same thing will be seen in prostate cancer also, beta. Same thing will be seen in prostate cancer as well. Prostate cancer may be the most common site of distant metastasis as the lumbar vertebra via the hematogenous route and via which veins? Again the Battison's plexus of veins. But difference क्या होता है? That breast cancer shows both the types of bony metastasis, beta. It can cause an osteolytic metastasis also, that is bone breaking, or an osteoblastic metastasis also, beta, that is bone forming. But in breast cancer, the more common type of distant metastasis is osteolytic, whereas in prostate cancer, the more common type of distant metastasis will be osteoblastic. याद रखना, that is the difference between both the conditions, beta. Clear है बात? Hopefully that's very clear to all of you now. Done with this? चलो आगे बढ़ते हैं. Next important, if I talk about beta, okay, is management of breast cancer, बच्चे. If I talk about management of the breast cancer in the patient, now here you have a early invasive breast cancer. We know that TNM staging of breast cancer is further classified into stage 1, stage 2, stage 3 and stage 4. तो stage 1 and 2 beta is called as a early invasive breast cancer, जहाँ पे the management is what beta, यहाँ पे the tumor is small. Therefore, what we can do, we can just remove the lump beta, that is called as a lumpectomy, or we can just remove the quadrant beta, which is known as quadrantectomy beta. Okay, but अगर बस lump और quadrant निकालोगे तो obviously there is a very high chance of recurrence. So after this surgery, it is always mandatory or compulsory to go for a radiotherapy to prevent any recurrence beta. And this surgery where you are trying to save or conserve the breast is called as a breast conservation surgery. So in early invasive breast cancer, we can go for breast conservation surgery, but always followed by a radiotherapy beta. Okay, but there are certain conditions जहाँ पे breast conservation surgery will be contraindicated or cannot be done, like pregnancy, because in pregnancy beta, in early pregnancy at least, you cannot give radiotherapy at all beta, right? तो radiotherapy pregnancy के टाइम पे देना ही नहीं है. तो BCS cannot be done during pregnancy, or if there is a multicentric breast cancer, that is the cancer is not in one quadrant but in multiple quadrants of the breast. In these conditions, beta, BCS cannot be done. So in those conditions, we go for a removal of the breast along with nipple areola complex and the pectoral fascia. And this surgery beta is classically called as a simple mastectomy, bicche. So early invasive breast cancer has these two options beta, either a BCS or a simple mastectomy. Next important is locally advanced breast cancer beta. Locally advanced breast cancer is going to be stage 3 beta. Now in stage 3 obviously the cancer is going to be larger in size. तो सबसे पहला step क्या होना चाहिए? To decrease the size of the cancer or to decrease the stage of the cancer beta. And for downstaging the cancer, we start the treatment with a neoadjuvant chemotherapy beta, right? So we before the surgery give a neoadjuvant chemotherapy so that definitely the size of the cancer decreases. Once due to neoadjuvant chemotherapy beta the size of cancer has decreased, then followed by that we will go for removal of the breast tissue along with the nipple areola complex, along with the pectoral fascia, along with level 1, 2 and 3 axillary lymph nodes with or without pectoralis minor muscle. And this surgery is called as MRM, modified radical mastectomy. We know beta, in Halstead's radical mastectomy we remove the pectoralis major, but in modified radical mastectomy or MRM beta we never remove the pectoralis major. Pectoralis minor may or may not be removed, plus minus इसलिए मैंने बोला. So that is MRM. Followed by that beta, to prevent the recurrence, we have to give a radiotherapy in the patient. Clear है बात? That is the management of locally advanced breast cancer. Next, if it is advanced breast cancer stage 4, I have told you the only management we can do is a palliative care beta in the patient. That's it. Next, if it is a ER/PR positive breast cancer, that means estrogen or progesterone receptors are present on the surface of breast cancer cells beta. So obviously we can block these receptors so that the breast cancer is not stimulated by the hormones and the size of the breast cancer ultimately reduces, so that we can go for a hormonal therapy. So याद रखना, ER/PR positive breast cancer में hormonal therapy can be given. Now important is if they say the female is in the premenopausal age group, that means the female is young. So in the premenopausal age group beta, in young female, the hormonal therapy of choice is usually SERM beta. What is SERM? Selective estrogen receptor modulator. And the drug that we commonly prefer over here is known as tamoxifen beta. What is the most common side effect of tamoxifen? Please let me know in the chat box once. What is the most common side effect of tamoxifen? But if they say beta the female is old, that means she is definitely बच्चे more than 40-50 years of age. So post menopausal female की अगर मैं बात करूँ, in post menopausal female beta the hormonal therapy of choice which is there, it is going to be aromatase inhibitors beta. In a post-menopausal female, the hormonal therapy of choice are going to be aromatase inhibitors, बच्चे. The drugs like letrozole, anastrozole, exmastine. Okay, so these are the drugs, beta, like letrozole, वगैरह, which have to be given. And we know that if we give letrozole or anastrozole like drugs, beta, there will be deficiency of estrogen in this patient's body. Already the female is postmenopausal, so the patient will have a very high risk of osteoporosis. But what is the most common side effect of tamoxifen? Very good, it is hot flushes, बेटा. मैंने बोला है कि अगर endometrial cancer would have been the most common side effect, तो it would have been withdrawn from the market. वो क्यों देते क्यों patient को? तो hot flushes is the most common side effect, बेटा. Endometrial cancer is rarely seen as a side effect. ठीक है? So that has to be remembered. Next important, beta, if they ask you HER2 new positive breast cancer, beta, if I talk about a HER2 new positive breast cancer, basically, तो याद रखना, the drug of choice that we give basically is known as trastuzumab, beta. We have to give at least for 1 year, beta, we have to give this drug known as trastuzumab, also known as Herceptin. So trastuzumab along with chemotherapy we have to give. Drug of choice they have asked for a HER2 new positive breast cancer, beta, answer has to be trastuzumab. Please remember that. Okay. Once you remove the breast, beta, we have to go for a BRS at times. If the female wants the breast to be reconstructed, then you have to go for a BRS, that is a breast reconstruction surgery. And when we go for a breast reconstruction surgery, beta, we can use various flaps from the patient's own body, beta. Autologous flaps can be used. अब मुझे बताओ that this flap which is taken over here, it is taken from the abdomen of the patient, as you can see, beta. And this flap which is there, beta, it does not contain the muscle, and therefore this is considered as the best flap, bache, for breast reconstruction surgery. So if they ask you what is the best flap for breast reconstruction surgery, answer has to be the DIP flap, beta. Okay, so this is a picture of DIP flap, bache, that is a deep inferior epigastric artery perforator flap. This is a deep inferior epigastric artery perforator flap, beta. This is the best flap basically used for a breast reconstruction. But अगर वो बोलते हैं बेटा which is the most common flap used, which is the most common flap used for breast reconstruction surgery, anybody? Very good. The most common flap used for a breast reconstruction surgery, beta, has to be the tram flap, that is known as the transverse rectus abdominis myocutaneous flap, beta. That has to be the transverse rectus abdominis myocutaneous flap. Can anybody tell me why tram flap is not the best flap then? Though it is more commonly used because easy है लेने के लिए, but why it is not the most common flap? Why it is not the best flap, beta? The tram flap. Because the patient will have a very good high risk of abdominal wall hernia, beta. क्योंकि tram flap में you are basically going to take the muscle also, due to which the abdominal wall will become weaker and the patient will have a very high risk of abdominal wall hernia. Shabash. Next important, beta, is this tumor. Here you are able to see a giant breast tumor, beta, and such kind of a massive or a giant breast tumor will always be a phylloid tumor, बच्चे याद रखना ये बात. Phylloid tumor is also known as cystosarcoma of phylloids, or it is also known as a serocystic disease of Brody. तो भले phylloids बोलो, cystosarcoma of phylloids बोलो, या serocystic disease of Brody, it is one and the same thing, beta. It is a giant breast tumor. It is rapidly growing and it can compress the blood vessels of the skin, beta. Therefore, you are able to see these color changes on skin due to pressure necrosis. We know that though it is a massive breast tumor, beta, but it is always superficial. It never invades the pectoral fascia. Therefore, it will be mobile, beta. Yes, not freely mobile like a fibroadenoma, but at least it is mobile somewhat, though it is giant. Okay. If they ask you, we know that here the investigation of choice has to be a true cut biopsy itself, beta. And when we do a true cut biopsy, on that we are able to see very classical feature, beta, called as the leaf-like structures will be seen. Okay, that was a recent question of your NEET PG examination. Leaf-like structures will be seen on the biopsy. And if they ask you what is the treatment, तो हमें पता है बेटा that as it is only a localized tumor, beta, and it does not cause any invasion of the lymph nodes, it does not spread via the hematogenous route, so therefore, beta, we don't have to remove the lymph nodes, bache. That's the reason we only go for a wide local excision itself. We only go for a wide local excision. In some conditions, beta, there are few conditions जहाँ पे in phylloid tumor we have to go for some other management. And क्या होगा वो? First, if it is a recurrence of phylloid tumor, or if it is a malignancy of phylloid tumor. Normally we know 90% phylloids are benign in nature, but 10% malignant होते हैं बेटा. So if they say beta it is a recurrent phylloids, or it is a benign fibroid, or it is an extremely large fibroid, as you are sorry, as it is a extremely large fibroids beta, as you are able to see in the image. So in conditions may we have to go for removal of the breast tissue beta. Again, no lymph node removal is required because it doesn't spread via lymphatic route. So therefore only a simple mastectomy will be done in these three conditions. Clear hai baat? Very good. Next, what is this investigation out here? This investigation is a mammography beta, and on that mammography you are able to see a calcification. We are able to see large calcification known as macro calcification, and this macro calcification is classically referred to as what? This macro calcification is classically referred to as popcorn calcification beta, and we know mammography showing a popcorn calcification has to be a classical case of what? The most common benign breast tumor beta. And हमें पता है the most common benign breast tumor is nothing else but fibroadenoma beta. We know it is nothing else but fibroadenoma. We know that fibroadenoma is actually commonly seen beta in younger females around 15 to 25 years of age. It is very commonly seen in young females between 15 to 25 years of age. And yaad rakhna, fibroadenoma is going to present to you as a painless lump beta inside the breast, and it is going to firm also. Firm क्यों? क्योंकि fibrous tissue होगा बहुत सारा. So patient will come to you with a painless firm lump inside the breast, बच्चे. That has to be remembered. Now important is we have discussed that it is extremely mobile beta. It is freely mobile and therefore called as the breast mouse. If they ask you what is the investigation of choice, so yaad rakhna, investigation of choice is an ultrasound because patient is young beta, less than 40 years of age, first thing, plus minus FNSE or a biopsy beta. Why I'm writing plus minus FNSE or biopsy? Reason bache, if the radiologist gives me a score of BIRATS 2, will I go for FNSE or biopsy? No. क्यों जरूरत है फिर? राइट? तो इन्वेस्टिगेशन ऑफ चॉइसेस अल्ट्रासाउंड प्लस माइनस एफएनएससी और बायोप्सी. ठीक है. ट्रीटमेंट अगर वो बोलेंगे बेटा, नॉर्मली इन केस ऑफ फाइब्रॉइड्स ट्रीटमेंट इज नथिंग एल्स बट ऑब्जर्वेशन. बच्चे, ऑब्जर्वेशन एंड फॉलो अप हैज टू बी डन इन दिस पेशेंट. रीजन इज इट इज जस्ट अ बेनाइन ट्यूमर बेटा. But if there are indications of removal beta, then we may have to go for a surgical excision or surgical removal of fibroids. Can anybody tell me which is the most common indication for surgical removal of fibroids? Anybody? Most common indication for surgical removal of fibroids, anybody? Very good. Somebody said that agar histopathology karoge, definitely you are able to see the classical appearance known as the antler sign beta. Antler sign क्या होती है? When there is a lot of fibrous trauma compressing the glandular tissue, so the glandular tissue looks like the horns of an antler beta. ठीक है, ऐसा कुछ दिखता है appearance. Very good. The most common indication for surgery, if they ask you beta, that has been a previous year question of FMG examination. Answer is cosmetic. Doctor साहब अच्छा नहीं लग रहा है, so please remember that. Apart from that beta, the other indications will be a giant fibroadenoma more than 5 centimeters in size, or definitely a rapidly growing breast mass or a painful breast mass, because that is suggestive of conversion into a malignancy beta or a family history of breast cancer. Next, this condition which is there beta is therefore here you are able to see beta dryness or destruction of the nipple areola complex. It looks like eczema, but eczema is a bilateral condition. This is a unilateral eczema like condition of nipple beta, classically called as Paget's disease of nipple. And this Paget's disease of nipple में there is complete destruction of the nipple areola complex, we know. And हमें पता है बेटा that Paget's disease of nipple is basically a marker of malignancy बच्चे. It is marker of which malignancy? It is a marker of ductal malignancy beta, because lactiferous ducts open at the level of nipple. So if the patient is having DCIS, that is ductal carcinoma in situ, or IDC, that is invasive ductal carcinoma, in those patients Paget's disease of nipple will be seen. Biopsy will show specifically the Paget cells in the epidermis beta, and the treatment has to be treat the underlying malignancy of the patient. And last part from breast beta that we have to discuss is basically about the discharges. So if they ask you beta, if the patient is having a blood stained nipple discharge, तो याद रखना, if there is a blood stained nipple discharge from a single duct, what is the most common cause? Blood stained nipple discharge from a single duct is usually due to a duct. Please answer that in the chat box. Whereas if they ask you beta, which is the most common cause of blood stained nipple discharge from multiple ducts beta, so we know the blood stained nipple discharge from multiple ducts is basically due to a breast cancer. Blood stained nipple discharge from multiple ducts is basically due to a breast cancer. Very good. Most common cause of a blood stained nipple discharge from single duct has to be a duct papilloma. Most common cause of a blood stained nipple discharge from a single duct has to be a duct papilloma. Okay? So that is important. Yes. Next important, if they ask you beta, what is the most common cause of a serous nipple discharge? Serous matlab that pale yellow or yellowish fluid is seen. So if they ask you most common cause of a serous nipple discharge from the breast, beta, do remember that it is usually due to a condition known as fibroadenosis or a fibrocystic disease of breast. It is due to fibroadenosis or a fibrocystic disease of breast, beta. Whereas if they ask you greenish, blackish or bluish nipple discharge, sarkari question bolo. Greenish, blackish or a bluish nipple discharge. Greenish, blackish or a bluish nipple discharge. Has to be duct ectasia, beta. Yes, greenish, blackish, bluish or a pultaceous nipple discharge has to be a case of duct ectasia itself, beta. If they ask you what is the management of duct ectasia, anybody? We know duct ectasia involves multiple ducts causing dilatation of those ducts and stasis of milk, beta. What is the management of duct ectasia? So the operation का नाम बता दो. It is conical excision of the lactiferous ducts we do in this operation called as. Very good. It is the Hadfield's operation, beta. Previous question of your exam. It is classically known as the Hadfield's operation. Has to be remembered. Whereas अगर डक्ट पैपिलोमा के लिए पूछे बच्चे तो डक्ट पैपिलोमा का मैनेजमेंट क्या होगा? डक्ट पैपिलोमा में वी हैव टू पास अ वायर इनसाइड द डक्ट बेटा विच इज हैविंग दैट पैपिलोमा एंड वी हैव टू रिमूव दैट single duct itself, beta, and that is classically called as a microdocectomy, बच्चे. That is called as a microdocectomy. Clear है बात? चलो. Very good. Next important beta, if I talk about is this condition over here. Basically here you are able to see what? Here if I am able to palpate the breast beta, I am able to feel a cord like structure or a string like structure, beta. क्या होता है ये cord like structure? This cord like structure is nothing else but an inflamed chest vein, beta. Yes, this condition mein the patient is having a superficial thrombophlebitis of chest veins or inflammation of the chest veins, due to which there is thickening over here, and this patient complains of a non-cyclical mastalgia, that is breast pain irrespective of the menses. All the time the patient is having pain. This condition is classically a case of Maunders disease. Shabash. This is also a PYQ. This is a classical case of Maunders disease, बेटा. और हमें पता है Maunders disease is a self-limiting inflammation. अपने आप ठीक होगा बेटा ये. अगर if it is a self-limiting inflammation, बेटा, the only management that we have to do in this patient, बेटा, is nothing else but analgesics or painkillers to be given for some time. Okay, analgesics or painkillers to be given for some time. Next important beta, if this is the only question, no image over here, only this is the question, what is going to be answer? A lady has delivered a child 2 months ago, bache, and now the patient complains of pain and fullness inside the breast, and the child refuses feeding. What is the likely diagnosis of the patient? Bolo. Why mastitis? Why breast abscess? Very good, Surya. Yes, yes, Uday. Yes, very good. It is a case of breast engorgement. Bhai, if there is, see, if the baby is refusing feed from one of the breast, beta, there is retention of milk in that particular breast. And अगर उस breast में milk जमा हो जाता है, if there is retention of milk in that breast, beta, that breast will become heavy. Due to that heaviness, beta, due to that engorgement, the patient will experience this fullness and somewhat pain. Okay. But are there any signs of inflammation? Local signs of inflammation are absent. Fever is absent. So neither I am going to call it as mastitis, nor I am going to call it as breast abscess. Clear hai? It is only a diagnosis of breast engorgement, but I have told you this a lot of times. So please remember that breast engorgement has to be your diagnosis. And if they ask you what is the treatment of breast engorgement, I have told you, bache, here you have to just express out the milk, beta. Expression of milk has to be done with warm, moist compresses around the breast, right? Expression of milk has to be done, beta, with warm and moist compresses around the breast. ठीक है, चलो. So that is important to be remembered. If they ask you, beta, अगर mastitis की बात होती, so as well as I told you, mastitis is infection or inflammation of the breast, beta. So obviously in mastitis, the patient would have local signs of inflammation at the site. Now there will be redness, there will be pain, there will be warmth basically at the site which will be present. Along with that, the patient would have fever. क्योंकि inflammation है तो the patient may have fever as well, beta, most of the times. ठीक है, तो याद रखना. If they ask you what is the most common cause of mastitis or breast abscess, बच्चे, what is the most common cause of mastitis or breast abscess? Anybody? Very good. It is the Staphylococcus aureus or Staph aureus, beta, and the most common source is the baby's mouth. Shabash. So yaad rakhna, Staph aureus from the baby's mouth, beta, is going to be the cause for mastitis. If they ask you the treatment, beta, we have to give antibiotics because it is a bacterial infection, beta, and antibiotics agar denge to obviously please remember Amoxiclav is commonly used beta, but in your examination, amoxiclav they don't give an option most of the time, so it is either a cloxacillin or a dicloxacillin beta, which is a penicillin can be used. Okay, so please remember beta, it is cloxacillin or dicloxacillin which could be used for the management of the patient. ठीक है, amoxiclav भी it is more commonly used beta in the clinical practice. ठीक है, amoxiclav is commonly used in clinical practice, but examination में जो previous ये question आए थे that was cloxa and dicloxa. ठीक है, नेक्स्ट इंपॉर्टेंट, दिस इज अ क्लासिकल पिक्चर ऑफ ब्रेस्ट एब्सेस नाउ. यस, तो जब ब्रेस्ट एब्सेस होता है दैट मीन्स देयर इज पस कलेक्शन इनसाइड द ब्रेस्ट बेटा, एंड व्हेन देयर इज ब्रेस्ट एब्सेस और पस कलेक्शन इन द ब्रेस्ट, obviously what will be the important points to be remembered. यहाँ पे again it is a sequel or a complication of staph aureus infection or mastitis itself beta. Here the patient will have signs of inflammation at the site first of all. Second important beta, patient may have a late sign known as fluctuant swelling beta. Patient may have a late sign known as fluctuant swelling. Patient may have a high grade fever over here, beta. Patient may have a high grade fever. Or this kind of picture could be given beta, which is classically suggestive of an abscess. ठीक है, या फिर they will mention that ultrasound was done in this patient's breast beta, and that ultrasound reveals there is some kind of fluid collection in the breast. These are the hints of a breast abscess beta. Clear है बात? So inflammation at the site with high grade fever, fluctuant swelling or ultrasound showing fluid collection in the case of breast abscess. Treatment में अगर वो जाएंगे बेटा, तो याद रखना treatment में the first line treatment I've always told you बच्चे is the ultrasound guided aspiration only. First line treatment is an ultrasound guided aspiration. How many attempts? It is 2 attempts of a ultrasound guided aspiration. But if they ask you in your exam best treatment, most appropriate management, ऐसा कोई question हो, best treatment, most appropriate management, see if only first line is mentioned, then answer it as ultrasound guided aspiration. Okay, but best management, most appropriate management has to be IND beta, that is incision and drainage. And हमें पता है बेटा that multiple needle aspiration cannot be an alternative to ultrasound guided aspiration. A lot of people are having that doubt. People are sending me that question from previous year कि सर इसमें तो multiple needle aspiration है, तो multiple needle aspiration is not specific answer ना बेटा. 2 attempts of needle aspiration, if they would have said, then we would have said okay, it's fine. Multiple मतलब how much? So then the answer in that question becomes IND then. Clear है बात? Because no other option was there. So incision and drainage with number 11. Very good. Blade has to be done beta. That is important. Along with antibiotics obviously. Whether you do aspiration or incision and drainage, antibiotics is a must always. Clear about that was all about your breast beta. Let's take your lunch break, and after the lunch break we'll continue with the class. Okay, after break we'll talk about thyroid, vascular, GIT further. Done? Around 5. कितना टाइम बचा है अभी? कम टाइम बचा है?
1 घंटे बाद देना फिर आप ब्रेक। 1 घंटे बाद देना, 2 मिनट का मैं लिंक बना के रेडी रख दूंगा।
ठीक है, चलेगा।
मैं आपको बता दूंगा जब ब्रेक होना, 2 मिनट का देना, मैं लिंक बना के तुरंत स्टार्ट कर देंगे। तो मेरे लिए
चलो बच्चों, let's start now. Now the next topic that we are to talk about is thyroid. So here you are able to see beta that what is seen here, there is enlargement of the thyroid beta. Okay, so the whole thyroid gland has enlarged uniformly. So this is nothing else but a case of goiter. Now we know beta that goiter which is there, it is mainly due to, what is the most common cause of goiter? The most common cause of goiter is nothing else but iodine deficiency beta, right? So iodine deficiency की वजह से there is a uniform goiter or a diffuse goiter that is seen, and as it is seen in a lot of people in that area, it is also known as an endemic goiter. We know that goiter can occur due to both, that is hypothyroidism as well as hyperthyroidism, right? It can occur in patients of hypothyroidism, like in patients of iodine deficiency, or even in patients of hyperthyroidism due to Graves' disease beta, right? Important is definitely, if I talk about this condition, please remember the patient may come to you with a midline neck swelling along with pressure symptoms at times. जब patient goiter के साथ आता है बेटा, okay, now goiters can be of various type. Either there is diffuse enlargement of the thyroid gland beta, that is a diffuse goiter, or there are multiple nodules inside the thyroid gland, that is called as a multinodular goiter, or the patient may have a single nodule inside the thyroid gland, that is called as a solitary thyroid nodule, or the patient may have enlargement of the thyroid gland behind the sternum beta into the mediastinum, called as the retrosternal goiter beta. Any type of goiter could be there in the patient. Okay? Now whenever a patient comes to you with a goiter beta, what should be the first line investigation to be done? In a patient of thyroid nodule or in a patient of goiter beta, what is the first investigation to be done? Anybody? Let me know in the chat box. Recent NEET PG question. First investigation to be done, anybody? Low. The first investigation to be done beta is going to be the TFT basically. What is TFT? Thyroid function test. Okay, the first thing that you have to always do is the TFT, that is the thyroid function test. And in thyroid function test, if they ask you whether it is T3, T4 or TSH, the answer has to be serum TSH beta. That is the most important one to be remembered. Okay, it is the serum TSH. Uske baad definitely if they ask you what is the first radiological investigation, then it has to be ultrasound neck beta. Okay, if they ask you what is the first radiological investigation, then it is an ultrasound neck that we can do. Later on definitely beta, we may go for a FNSC to rule out any cancer in the patient. Okay? Later on we may go for a FNSC to rule out a cancer in a patient. Usually if we do a radioactive iodine scan, and on that if we are able to see a cold nodule beta, that means there is 20% risk of a cancer, so we go for definitely a FNSC. But if on the radioactive iodine scan beta, if you are able to see a hot nodule, there is only 4% risk of cancer, so we can just continue observation beta, we don't need a FNSC as such. ठीक है? Retrosternal goiter जब होता है बेटा, obviously, तो please remember here we will ask the patient basically to do this test. On what we ask the patient to do, we ask the patient to raise both the hands above the head beta, and when the patient elevates both his arms, basically bilateral arm elevation will actually cause compression of the neck vessels beta. क्यों? क्योंकि ये जो goiter था, retrosternal goiter, it gets pulled up and it spreads in the neck, compressing the neck vessels beta. Therefore the blood is not able to come back from the face, and there is pooling of blood in the face beta, leading to facial plethora or this facial congestion, classically called as which test? So this is the classical test positive in patients of retrosternal goiter beta, classically known as the Pemberton's test. Okay, classically known as the Pemberton's test, that has to be remembered. Clear about? Chalo. So these are the important things beta to be remembered. ठीक है. So this is the Pemberton's test. If they ask you what is the management in patients of goiter, then once you have done with this, ठीक है, याद रखना बाकी सब goiters में even a ultrasound neck is enough to make a diagnosis, but for a retrosternal goiter beta you need a CCT neck along with a CCT thorax beta to confirm the diagnosis. In retrosternal neck or in retrosternal goiter beta, the investigation of choice, if they ask you, it has to be a CCT neck plus thorax. Treatment, if they ask you बच्चे, तो in majority cases of goiter initially medical management could be tried, but if it is a big kind of big goiter beta, then only a surgical excision has to be done. ठीक है, only a surgical excision is going to be done. Please remember that. ठीक है, so that is important. Next important is this child beta who comes to us with a midline neck swelling, as you are able to see. And what is the feature of this swelling, बच्चे? The feature of this midline neck swelling is it moves with deglutition, that is swallowing beta, and it also moves with protrusion of tongue beta. ठीक है, this swelling with this, which is there beta, it moves with deglutition or swallowing, and it also moves with protrusion of tongue. This is a classical diagnosis of anybody. This is a classical diagnosis of, what is the diagnosis in this case over here? Anybody? What is the diagnosis? Very good. It is a classical picture of a thyroglossal cyst beta. We know that thyroid gland usually develops on the tongue beta at the foramen cecum. Once the development of thyroid gland is complete on the tongue, it descends down into the neck via a thyroglossal tract. But that thyroglossal tract, if it does not disappear after birth, and if it remains open and patent, in that there is collection of fluid, that leads to formation of a thyroglossal cyst in the patient beta. That has to be remembered. Now in this patient bache, please remember, if they ask you what is the investigation of choice, so we have discussed beta, investigation of choice in a patient of thyroglossal cyst is nothing else but ultrasound neck plus a FNSE. I will be like, so FNSE why? Reason beta, you just have to rule out a cancer. ठीक है, it could also, the swelling could also be a cancer ना, just therefore to rule out the cancer beta, it's better to go for a FNSE in the patient as well. ठीक है, and if they ask you the treatment, so the treatment is very classical, whether it is a case of a thyroglossal cyst or it is a case of a thyroglossal fistula beta. So please remember the treatment which is there, it is nothing else but removal of the thyroglossal cyst along with removal of the thyroglossal tract and a part of hyoid bone. What is that operation called as? What is that operation called as? Anybody? We know, as I've told you, the previous year question was that what is the most common site of a thyroglossal cyst, and I've told you the most common site of thyroglossal cyst is subhyoid or infrahyoid beta. याद रखना, it is subhyoid or infrahyoid basically. Very good, all of you. This treatment which is there beta, where we remove the cyst, the tract and the part of hyoid bone, is classically called as the cyst trunk surgery or the cyst trunk operation beta. So this is classically a case of cyst trunk operation. ठीक है, शाबाश. Next important बच्चे, if I talk about is the thyroid tumors now. तो याद रखना, thyroid tumors could be of two types beta. Either it is a benign thyroid tumor or it is a malignant thyroid tumor. The most common benign thyroid tumor, if they ask you, answer has to be a follicular adenoma. ठीक है, so if they ask you which is the most common benign thyroid tumor, answer is a follicular adenoma. If they ask you malignancy of the thyroid, we know the thyroid malignancy could be of two types. Either it is a primary thyroid malignancy, that means the cancer which starts from the thyroid gland, or it is a secondary thyroid malignancy beta, that means when the cancer spreads or metastasizes from some other cancer of the body beta to the thyroid gland. Now when I talk about a primary thyroid cancer, it can arise from the three cells of the thyroid gland beta. Which are the main three cells of thyroid gland? First beta, we have the follicular cells. So the cancer can arise from the follicular cells of the thyroid gland, or from the parafollicular C cells of the thyroid gland, or from the lymphoid cells of the thyroid gland beta. If they say the cancer arises from follicular cells of the thyroid gland, it could be of two types. Either it is a differentiated cancer, that I say that it is a biryani, or it is an undifferentiated cancer, that is a khichdi beta. Right? So if they say the cancer arising from follicular cells of thyroid gland which is differentiated in nature, either it is a follicular thyroid carcinoma or it is a papillary thyroid carcinoma. Whereas the undifferentiated cancer arising from the follicular cells of thyroid gland is an anaplastic thyroid cancer, because undifferentiation or lack of differentiation is what is called as anaplasia. If they ask you beta parafollicular C cells, पैराफॉलिकुलर सी सेल से अराइज होने वाला कैंसर इज नोन एज अ मेडुलरी थायराइड कार्सिनोमा बेटा, whereas the lymphoid cells cancer is known as a lymphoma. That has to be remembered. Clear about? Now important is if they ask you out of all of them beta which is going to be considered as the most common thyroid cancer, anybody? Please tell me out of all of these cancers beta which is considered as the most common thyroid cancer. Anybody? Most common thyroid cancer is going to be? Very good. It is the PTC beta, that is nothing else but the papillary thyroid carcinoma. So please remember the papillary thyroid cancer which is there, which it is going to be considered as the most common thyroid cancer. Okay? It arises from the follicular cells and it is a differentiated cancer. But we know beta, there is also another cancer which also arises from the follicular cells and which is also differentiated. That is a follicular thyroid cancer. तो हमें पता है that if they ask you which is the second most common thyroid cancer, so we know that the second most common thyroid cancer overall has to be the follicular thyroid carcinoma beta. Now if I have to differentiate between a papillary thyroid cancer and a follicular thyroid cancer beta, I need to remember two important or two major differences bache. And what are these two major differences? I've always told you. First is going to be the age, second is the risk factor beta. Now if I talk about the age beta, please remember that papillary thyroid cancer is going to be more commonly seen beta in 20 to 40 years of age, that is around young patients beta. Whereas the risk factors, if they ask you, that are associated with this condition will be either a patient who is having a long standing thyroglossal cyst beta, or a patient who is basically having exposure to radiation in the past, that means a previous radiation exposure beta, or the patient who is a known case of Hashimoto's thyroiditis बच्चे. ठीक है, these are the three main risk factors which are associated with papillary thyroid carcinoma beta. But on the other hand, if they ask you about follicular thyroid cancer beta, now follicular thyroid cancer first of all is going to be more common in older patients beta, more than 50 years of age, first difference. And second, if they ask you about the risk factor बच्चे, तो याद रखना, the risk factor in patients of follicular thyroid carcinoma is going to be a multinodular goiter. Are you able to see here? This is the patient of a multinodular goiter beta. So this will be the risk factor for a follicular thyroid cancer. Ab, if they ask you bachche about the papillary thyroid cancer, we know that what is the gene mutation in papillary thyroid cancer. Recent question of your exam. Anybody? Yes, very good. Another difference could be papillary spreads mainly by the lymphatic route, follicular mainly spreads by the hematogenous route. Papillary mainly spreads to the level 6 lymph nodes in the neck, whereas follicular mainly spreads to the bones beta. Very good. This was the recent question of your exam beta, that the most common gene mutation associated with papillary thyroid cancer has to be the BRAF gene mutation beta. It has to be the BRAF gene mutation. Do remember that. Whereas if they ask you bache, in patients of papillary thyroid cancer, investigation of choice, if they ask you, so please remember the investigation of choice is nothing else but ultrasound plus FNSC beta. Ultrasound guided FNSC has to be done in the patient basically. So FNSC will be the single best answer if you have to mark. So ultrasound plus FNSC will be the investigation of choice. And if they ask you treatment in this patient beta, obviously in all the cases of thyroid cancer beta, the best treatment is complete removal of the thyroid gland. That is removal of both the lobes along with the isthmus beta. That is called as a total thyroidectomy. Now there is a case beta where we can do a hemithyroidectomy in patients of papillary thyroid cancer, and that case is what beta? That condition is when basically the patient is very young, the cancer is less than equal to 2 centimeters in size, there is no lymphovascular invasion or no distant metastasis, only that condition. Otherwise it is better to answer as total thyroidectomy. In this patient beta, we know that papillary thyroid cancer is the one which is going to have the best prognosis. Yes, it is the thyroid cancer beta which has the best outcome or the best prognosis. And worst prognosis, if they ask you bache, so we know that worst prognosis is usually associated with the anaplastic thyroid cancer, and by good fortune it is the least common also. Okay, worst prognosis is associated with the anaplastic thyroid cancer. Now important is beta, if they ask you in patients of papillary thyroid cancer, when you resect the mass beta and when you do a histopathological examination, sarkari question, what is this appearance called as? The nucleus of all these papillary thyroid cancer cells beta, they appear empty, and the papillary thyroid cancer cells का जो nucleus वो empty दिखता है बेटा, it looks like the eyes of a cartoon called as. Very good. I've told you beta, sarkari question this is, you have to remember at any cost. It is a classical picture of orphan ani nuclei appearance beta. So papillary thyroid cancer gives us the classical orphan eye nuclei appearance to be remembered. Along with that, beta, in all the papillary cancers of body, I've also told you that you will be able to see calcified lamellated bodies, beta. And those calcified lamellated bodies in papillary thyroid cancer which will be seen are called as, those are known as anybody? Those will be called as the Samoma bodies, beta. Please remember that Samoma bodies, calcified lamellated bodies in patients of papillary cancer will be seen. That has to be remembered. If they ask you, beta, that follicular thyroid cancer, mein, what is the investigation of choice? Do we go for a FNSC in patients of follicular thyroid carcinoma? Anybody? In patients of follicular thyroid carcinoma, what is the investigation of choice? Anybody? It has to be a very good true cut biopsy, beta, or a frozen section, but not a FNSC. याद रखना ये बात. Rather, we have to remember, beta, that FNSC which is there, it is not a diagnostic of follicular thyroid cancer. Reason we have discussed, beta, because it cannot differentiate between a follicular adenoma and a follicular carcinoma. That is a benign and a malignant cancer, benign and a malignant tumor. इसीलिए ट्रू कट और फ्रोजन सेक्शन विल बी द इन्वेस्टिगेशन ऑफ चॉइस, नॉट द एफएनएससी, बेटा. ये याद रखना है. ट्रीटमेंट हियर ऑल्सो बच्चे हैज टू बी नथिंग एल्स बट अ टोटल थायरॉइडेक्टमी इटसेल्फ. ठीक है, चलो. सो दैट इज इंपॉर्टेंट टू बी रिमेंबर्ड. Next important, if the patient undergoes the total thyroidectomy, beta, over here, and after that the patient presents to you with perioral paresthesias or carpopedal spasm, beta, then what is going to be the most likely cause? So please remember, after the surgery, patient is experiencing decreased sensations around the mouth or there is a carpopedal spasm. That means whenever you inflate the BP cuff, patient has this carpopedal spasm in hands and feet, beta. This is classically called as which sign? We know this is classically known as the Trousseau sign, beta, which is also known as the obstetrician's hands, right? Whereas when you tap along the facial nerve of the patient, beta, patient will do a odd facial expression or grimacing, beta. This is classically called as which sign? This is classically called as a Chvostek sign. Now, whether they say a Trousseau sign, beta, or they say a Chvostek sign, bache, we know that one important thing, both of these signs are suggestive of which electrolyte disturbance? Anybody? Both of them are suggestive of which electrolyte abnormality in the patient's body? Both of them are due to titania. Titania occurs due to electrolyte disturbance. बताओ, electrolyte disturbance. So please remember, both of these are signs of hypocalcemia, not hyper. Both of these are signs of hypocalcemia. Titania occurs in hypo, not hypercalcemia. याद रखना है बात. ठीक है, तो please remember, both of these are signs of hypocalcemia, beta. An important test definitely. What is the cause for hypocalcemia after a thyroidectomy surgery? So we know, beta, the cause is nothing else but a parathyroid insufficiency, right? What happens during a thyroidectomy surgery, beta? By mistake, we may remove the parathyroid gland also, beta, right? Accidental removal of the parathyroid gland would be done, or at times, beta, what happens? We may ligate the inferior thyroid artery away from the gland, and if you ligate the inferior thyroid artery away from the gland, beta, obviously you are not only going to cut off the blood supply of the thyroid, but even the parathyroid gland, causing devascularization and necrosis of the parathyroid gland, beta. So due to these reasons, beta, definitely the patient is going to develop a parathyroid hormone insufficiency when there is decreased amount of parathyroid hormone in the body. And when there will be decreased parathyroid hormone in the body, obviously the patient will have decreased serum calcium levels, causing a hypocalcemia in the patient, beta. That is the reason the patient is having these kind of symptoms. Treatment क्या होगा? If the patient has a hypocalcemia, mild होगा तो oral calcium and vitamin D supplement, severe होगा तो IV calcium gluconate. But for permanent, beta, permanent thing के लिए what is the treatment? We should go for a parathyroid gland reimplantation, beta. Please tell me, parathyroid gland implantation, it's commonly done in which muscle, beta? Previous year question of your exam. Parathyroid gland reimplantation is commonly done in which muscle? More commonly. Parathyroid gland reimplantation is more commonly done in which muscle? Very good. This is the previous year question, beta. Has to be remembered. It is in the forearm muscle, beta, called as the brachioradialis muscle, beta. Yes, it is the brachioradialis muscle, beta, जहाँ पे we do a parathyroid gland reimplantation. शाबाश. That was all about your thyroid beta, the important points that you need to remember for your examination. Next important is a case of gradual arterial obstruction. Now, vascular surgery. If I talk about gradual, gradual means what? Slow or fast? So slow beta. याद रखना, gradual arterial obstruction if I talk about, that means slowly over a period of almost weeks, months or years beta, there is a blockage which develops in the arteries beta, and that is the gradual arterial obstruction. If they ask you what is the most common cause of gradual arterial obstruction, so we know the condition that is known as atherosclerosis bache is going to be the most common cause of gradual arterial obstruction, followed by the second most common cause is basically a medium vessel vasculitis beta known as Berger's disease, also known as thromboangiitis obliterans beta, also known as thromboangiitis obliterans. अब याद रखना बेटा that what are the major differences between these two conditions, because both of them cause a gradual arterial obstruction. तो याद रखो, most important difference is the age group. Atherosclerosis will be more than atherosclerosis will be more common in patients of more than 50 years of age beta, whereas Berger's disease is more common in younger patients who are usually less than 40 or 45, or to remember easily you can remember less than 50 years. ठीक है, so atherosclerosis more than 50, Berger's disease less than 50 beta. That has to be remembered. First thing. Second important point to be remembered beta, that atherosclerosis is always going to involve the larger vessels of the body beta. Like it involves the abdominal aorta most commonly bache, followed by the coronary artery. But apart from that, it can involve, which is the most common peripheral vessel involved in in atherosclerosis? Please tell me that. Most common vessel overall I've told you abdominal aorta followed by coronary artery. But अगर वो पूछते हैं which is the most common peripheral vessel involved in patients of atherosclerosis, answer is most common peripheral vessel involved in patients of atherosclerosis, answer is previous year question it is, because aorta and the coronary arteries both are central vessels of the body. Most common peripheral vessel involved is going to be very good. It is the popliteal artery beta. So popliteal artery is going to be the most common peripheral vessel involved beta in patients of atherosclerosis. Whereas if I talk about बच्चे the Berger's disease, तो याद रखना Berger's disease में usually it is the medium to the small sized vessels which are going to be commonly involved. Apart from that, we have discussed atherosclerosis में the obstruction will be proximal to distal beta, whereas in Berger's disease the obstruction will be distal to proximal बच्चे. Clear है? So these are the main differences. If they ask you symptoms, तो याद रखना symptoms in both the conditions are going to be common beta. And what are the symptoms usually in both the conditions beta as the obstruction is going to start? Now please remember, most common site in both the conditions बच्चे, we know it is the lower limbs beta. Whether you call it as the atherosclerosis or you call it as a case of Berger's disease, दोनों conditions में the most common site will be the lower limbs of the body itself. That has to be remembered. So obviously when the lower limb vessels will get blocked, now the lower limb muscles are not going to receive enough blood supply beta. तो उसकी वजह से क्या होता है, at rest the patient does not have pain initially, but as the patient starts walking beta, after walking a certain distance the patient has cramping pain in the legs beta, and again that pain disappears at rest. ठीक है, this cramping pain in the legs which disappears at rest beta is classically called as intermittent claudication बच्चे. This is the first step of gradual arterial obstruction called as intermittent claudication. Anybody in the chat box, please let me know that what is the name of grading used for intermittent claudication called as. Name of grading used for intermittent claudication is known as. After this beta, the blockage increases further, and now the patient will start having a continuous pain even at rest beta. That is classically called as rest pain, which is also known as cry of dying nerves, because here the nerves will get less blood supply and they will start dying. After this, the patient will have coldness, numbness or paresthesias beta, and along with that the patient will have color changes on the skin like cyanosis along with ulceration. That will progress into the stage of pre-gangrene now, and ultimately beta when there is complete necrosis which you are able to see, that is the stage of gangrene then. Okay, so these are the signs and symptoms which will be present in patients of both athero as well as Berger's disease beta. Here you are able to see gangrene, but yes, this is the upper limb, but commonly beta, please remember, it will be seen in lower limbs itself. Ye, if this is the picture and the patient is also young, okay, and the patient is a see, if this is the picture and the patient is usually less than 50 years of age, then my diagnosis has to be Berger's disease beta. But if they give this same picture beta, but if they say the patient's age is more than 50 years of age, then my diagnosis will change to atherosclerosis. You will be like, sir, small vessel doesn't matter. But please remember, if the patient's age is more than 50, has to be a case of athero then. Okay? This has been a previous year question where a lot of people have done mistake earlier. Okay? Very good. Yes, all of you. Intermittent claudication with the name of grading has to be Boyd's grading beta. Clear hai? So that is important. Now if they ask you bache that investigation of choice, I hope all of you are quite aware beta that whenever they say beta any kind of peripheral vessels bache, हमें पता है for all the peripheral vessels the investigation of choice has to be what? For all the peripheral vessels beta the investigation of choice has to be what? Anybody? The investigation of choice has to be a duplex scan, but I have told you it is a non-invasive investigation. Okay, duplex scan is done. That is a color Doppler along with the color Doppler along with ultrasound B scan. बेटा मैंने बोला था कि color Doppler और duplex में से duplex will be a better answer क्योंकि उसमें दोनों चीजें करी जाती है, right? तो please remember that. Okay, duplex scan is going to be the best answer definitely. अगर duplex scan option में नहीं है, then the second best answer would be color Doppler. But duplex scan is the best answer beta for investigation of choice. If they ask you definitely that duplex scan के बाद अगर if the patient is not able to give us a diagnosis, then we have to go for a gold standard investigation. And gold standard investigation beta for the central as well as the peripheral vessels of the body has to be what? Gold standard investigation for central as well as peripheral vessels of the body has to be what? Angiography only beta. Angiography जब मैं बोलता हूँ that means I am talking about the invasive or the catheter angiography where we have to inject a contrast or a dye inside the vessels so that the vessels are highlighted and you are able to see any kind of blockages over there beta. Okay, CT angio or MR angio is different from this beta. Those are either minimally invasive or non-invasive investigation. But when I say this angiography only, here we are going to use a X-ray for imaging, and this is an invasive angiography we are talking about. Now, if they ask you beta management, so please remember whether they say beta it is a case of atherosclerosis or they say it is a case of Burger's disease beta. Any case of gradual arterial obstruction, there is factors like smoking, alcohol, obesity are there. Therefore, the first step in the management beta, the first line management has to be lifestyle modifications over here. And when we will go for a lifestyle modifications of these patients bache, so do remember that, okay, in the lifestyle modifications you have to do weight loss, regular exercise, quit alcohol and smoking, avoid fried fatty food beta. Okay, so that is done. If the lifestyle modification fails, then we have to turn on to medical management beta. And when we do medical management of these patients, we have to give vasodilators to the patient beta, drugs like cilostazol or pentoxifylline along with statins and antiplatelet drugs like aspirin beta. Okay, if medical management is going to fail bache, then we can go for the next step and that is known as a PTA. I have told you beta, PTA is nothing else but a percutaneous transluminal angioplasty. You have to go inside the vessel beta and then with the help of this catheter you have to do the repair. Okay, this catheter which has a balloon at the end beta, a very long catheter called as which vascular catheter? Anybody? What is the name of this vascular catheter? Let me know in the chat box. So please remember angioplasty can be of two types beta. Ek to you can break down that blockage or the plaque beta with the help of a balloon. That will be called as a balloon angioplasty. Or at the level of the blockage bache, you may be able to place a stent over there, right? You may be able to place a stent so that the blood passes via the stent. Metallic stents or drug eluted stents could be used. Nowadays the drug eluted stents are coated with a drug I have told you beta known as sirolimus. Okay, so that is important to remember. Drug coating the stent is known as sirolimus. याद रखना है बात. Very good beta. This catheter that is used for the purpose of angioplasty is classically known as the Fogarty's vascular catheter beta. It is classically called as the Fogarty's vascular catheter. Okay, so that is important. After percutaneous luminal angioplasty beta, the last option that we have basically is known as a bypass grafting bache. Okay, the last option that we have is usually a bypass grafting beta. Bypass grafting mein definitely we have to place a graft. Either it could be an autologous graft taken from your own body or it can be a synthetic graft beta, okay, which is prepared outside. So autologous graft की अगर मैं बात करूँ basically, please tell me which is the best autologous graft to be used in patients of atherosclerosis. The best autologous graft in a person's body is going to be anybody? The best autologous graft beta. Bypass grafting के लिए the best autologous graft will be which vessels? Anybody? Very good beta, shabash. The best autologous graft if they ask you beta, the answer has to be the Lima or Rima beta. Lima or Rima is what? the left or the right internal mammary artery. Reason, they have least chances of atherosclerosis. इससे भी कम chances of atherosclerosis are seen in the circle of Willis beta, but we cannot take circle of Willis for grafting, right? So it has to be lima or rima beta, left or the right internal mammary artery. ठीक है, followed by that we can use the GSV or the great saphenous vein. See, great saphenous vein is a more commonly used graft because it is easier to take beta, but it is not the best graft. Best graft अगर पूछेंगे तो लीमा और रीमा is the one. ठीक है, if they ask you beta what is the best synthetic graft basically, so please remember beta, best synthetic graft, it depends on the caliber or the size of vessel. If that vessel is going to be larger in size बच्चे, so it has to be the Dacron graft which will be used beta, like for aorta or the femoral artery. But if it is a small vessel बच्चे, like the popliteal वगैरह, then we have to use the PTFE, that is a polytetrafluoroethylene graft. Clear है बात? चलो, so that is important. अगर वो पूछेंगे बच्चे that Buerger's disease की अगर मैं बात करूँ, if they ask you about Buerger's disease, please tell me, is bypass grafting or angioplasty possible for Buerger's? No. हमें पता है बेटा definitely that whether it is PTA or a bypass grafting beta, it is not at all possible for Buerger's disease. Here the only option after medical management fails is known as a lumbar sympathectomy beta, where you have to remove the sympathetic lumbar ganglia beta. Okay, here you have to remove the lumbar you have to do a lumbar sympathectomy beta, and in this surgery basically we have to remove the sympathetic lumbar ganglia, which will decrease the blood supply to the muscles and increase the blood supply to the skin and the nerves beta. Okay, so therefore lumbar sympathectomy should be done in which stage? We know lumbar sympathectomy beta should be done in the stage of rest pain, but it is absolutely contraindicated beta in the patient of intermittent claudication, क्योंकि intermittent claudication में the muscles have not damaged yet, so you cannot steal the blood supply from the muscles beta. Clear है बात? So it is indicated in patients of rest pain, but absolutely contraindicated in patients of intermittent claudication. So that was all about the gradual arterial obstruction, both the conditions that you need to remember about. Okay? Sudden arterial obstruction, which is there beta, it is known as embolism, when the thrombus or a clot develops inside the patient's heart. Due to which arrhythmia? Anybody? Please tell me, which is that arrhythmia which can increase the risk of thrombus formation inside the heart? So that clot or thrombus one fine day goes into the peripheral vessels and causes a sudden blockage over there. That phenomena is known as embolism beta. याद रखना, उसमें there are 6 P's classically. There is pallor, there is pain, there is paresthesia, there is poikilothermia, there is paralysis, and there is pulselessness beta. ठीक है? So this will be the 6 P's. Last sign if they ask you, answer has to be pulselessness. Investigation of choice will be a duplex scan. Initial management will be a low molecular weight heparin because we don't want the thrombus to increase in size further. But definitive management will depend on the time of presentation. If the patient presents to me early, when the necrosis has not started, I should go for an embolectomy beta, removal of the embolus with the help of Fogarty's catheter again. Or if I'm not able to remove the embolus because it is a small vessel, then I should break down the thrombus by the process of thrombolysis beta with drugs like altiplase or retiplase. बच्चे clear है बात? That is important. Very good. Embolism is very commonly seen as a complication of atrial fibrillation, which can lead to thrombus formation inside the heart. Clear? Agar patient presents to me with gangrene in any condition, whether it is a gradual arterial obstruction or a sudden arterial obstruction, in any condition, whenever a patient presents to me beta with basically a gangrene, then the only option that is left is nothing else but an amputation to be done beta in these conditions. The only option that is left is amputation. Clear है? चलो. Next important beta, if I talk about this condition over here, क्या दिख रहा है यहाँ पे? DVT we will discuss tomorrow in the questions itself beta, and aortic dissection too. ठीक है, यहाँ पे you are able to see definitely there is nothing else but beta dilated veins basically. ठीक है, and when a patient comes to you with a dilated and tortuous superficial veins in the leg beta, okay, dilated and tortuous veins are always called as varicose veins beta. ठीक है, तो याद रखना. This is a classical case of varicosities or varicose veins in the leg बच्चे. ठीक है, तो important is, if I talk about varicose veins, we know that in this condition, what is the problem beta? In this condition, the connection which is there between the deep veins and the superficial veins of the leg beta, over there some problem is present. Okay, either at the level of junctions or at the level of perforators beta. And what is the problem? Either the patient is going to have either a valvular incompetence or the patient is going to have a perforator incompetence. What do I mean by this? That the valves which are there beta at the level of the junctions, those valves are either absent completely or those valves are defective beta. जिसकी वजह से what happens now, whenever the pressure in the deep veins of the leg will increase, the excess blood will go into the superficial veins of the leg, and as superficial veins are narrow and a lot of blood comes inside it, it undergoes dilatation and tortuosity, leading to varicosities beta. This is a classical case of varicose veins बच्चे. Clear है बात? That is important. What is the most important risk factor for varicose veins? We know beta that the most common cause of varicose veins is nothing else but prolonged standing. Any patients who are going to have a prolonged standing beta will increase the risk of varicose veins. Anybody? Prolonged immobilization in a patient will increase the risk of what? Anybody in the chat box? Prolonged immobilization in the patient will increase the risk of which condition? Let me know in the chat box beta once. अब वैरिकोज वेन्स जब होती है बेटा, तो वी नो डेफिनेटली द क्लासिफिकेशन दैट वी आर गोइंग टू यूज बेटा इज नोन एज द सीएप क्लासिफिकेशन. सीप बोलो, सीएप बोलो, वॉट एवर यू वांट टू कॉल इट एज. तो इट इज नोन एज द सीएप क्लासिफिकेशन बच्चे. सी स्टैंड्स फॉर क्लिनिकल मैनिफेस्टेशन, E stands for etiology, A stands for anatomy, P stands for pathophysiology beta. C for clinical manifestations, E for etiology, A for anatomy and P for pathophysiology बच्चे. Please remember that. According to this classification, at least you have to remember this clinical manifestation based classification beta, जिसमें C1 which is there बच्चे is going to be telangiectasia or reticular veins beta. C2 which is there beta, it is going to be varicose veins when the veins are more than 3 mm dilated. Next, C3 will be edema beta. C4A will be pigmentation and eczema. As you are able to see, there is pigmentation over here. So this stage will be called as C4A bache, when there is going to be a pigmentation and eczema of the skin beta. Whereas C4B is a very classical stage beta. C4B definitely which is there, it is this one. क्या दिख रहा है यहाँ पे? C4B, it is this one. क्या दिख रहा है बेटा? यहाँ पे definitely you are able to see there is fat loss, there is muscle contracture, woody hard texture of the leg along with pigmentation and eczema. Called as which condition? Very good. It is classically called as LDS, that is known as lipodermatosclerosis beta. ठीक है? So this condition will be called as C4B, lipodermatosclerosis. And which appearance this condition gives to the leg beta? Due to this condition, what is the classical appearance of the leg that is going to be seen? The classical appearance of the leg which is seen over here beta, it is classically called as the inverted champagne bottle appearance beta. The classical appearance of the leg which is seen over here is classically known as the inverted champagne bottle appearance. Clear है बात? That has to be remembered. ठीक है, तो lipodermatosclerosis stage C4B inverted champagne bottle appearance is going to be seen. Shabash, that is important. ठीक है. Next important is C5 beta. C5 we know it is a healed ulcer, and C6 remember it is a active venous ulcer beta. ठीक है, C5 is a C6 is a active venous ulcer. Anybody in the chat box wants venous ulcer will have which kind of edges beta? Venous ulcer will have which kind of edges? Let me know in the chat box once. Very good, all of you. I've told you prolonged standing will lead to varicose veins, and prolonged immobilization increases the risk of DVT due to stasis of blood. शाबाश. अब मुझे बस इतना बता देना definitely. ठीक है, investigation of choice we have discussed beta. So please remember that investigation of choice in this patient. Peripheral vessels again has to be a duplex scan. And on the duplex scan beta, if the saphenofemoral junction is incompetent, on the duplex scan beta, if the saphenofemoral junction is incompetent, we are able to see the classical Mickey Mouse appearance, which right? We are able to see the classical Mickey Mouse appearance. Now, if they ask you about the treatment beta, yaad rakhna. Previously, we used to do the flush ligation of the junctions beta and stripping of the veins, okay, sometimes. But nowadays beta, we do not do a flush ligation of the veins. Rather than nowadays, if they ask you what is the surgery of choice beta for varicose veins, so we know surgery of choice for varicose veins nowadays is either a EVLT, that is an endovenous, or an endovascular laser therapy, where we directly ablate the junctions or close the junctions with the help of laser beta. Or we have a RFA bache, that is radio frequency ablation. That is radio frequency ablation is nothing else but closing or ablating the junctions with the help of radio waves beta. ठीक है, perforators के लिए if they ask you beta, if there is a problem at the level of perforators, तो perforators के लिए और perforator incompetence के लिए the surgery that is commonly preferred beta is known as SEPS, that is a subfacial endoscopic perforator surgery, where just with a single incision beta you are able to ligate multiple perforators together. ठीक है, so that is important. शाबाश. ठीक है, so these are the important things to be remembered about varicose beta. But ये surgery जो करते हो, it is only done in the late stages beta. Any patient who comes in the early stages बच्चे, तो early stages में तो only we should recommend what? lifestyle modifications in the patient. And lifestyle modifications mein beta, please remember, the main advice that you will give is obviously avoid prolonged standing, second elevation of limb, and third most important beta being elastic compression stockings to be worn. Patient has to wear elastic compression stockings, which will have a wonderful effect beta in patients of varicose veins. It will not let the varicose veins progress further. तो याद रखना, venous ulcers which are there, venous ulcers will have sloping edges बेटा, याद रख लो, venous ulcers are superficial with sloping edges. ठीक है. Next condition, let's talk about GIT बच्चे. If I talk about GIT now, definitely please remember the first condition that we have is when a neonate, when the female who was there beta, when she was pregnant, she was having polyhydramnios beta, that is more amount of amniotic fluid. And when the neonate was born, when the child was born beta, in the neonatal period or at birth, the child was having continuous drooling of saliva from the mouth. What condition you are suspecting? At birth beta, the baby was having continuous drooling of saliva from the mouth. What condition are we suspecting बच्चे in this patient? Very good. The condition that you have to suspect beta in this patient is nothing else but a case of esophageal atresia beta. Please remember that. Esophageal atresia क्या होता है? When the esophagus is not completely formed beta, there is some absence in some part of the esophagus basically. That condition is classically called as esophageal atresia beta. Please remember that some part of the esophagus is missing over here. And we know esophageal atresia is very commonly associated with tracheoesophageal fistula also beta. Esophageal atresia is very commonly associated with tracheoesophageal fistula. ठीक है. As the esophagus is not completely formed, the patient will have a continuous drooling of saliva because the baby is not able to swallow. And as there is tracheoesophageal fistula, the baby may have aspiration of saliva causing respiratory distress at times beta. There are five types of esophageal atresia beta based on the patterns. First of all, टाइप ए जो होता है बेटा, इन टाइप ए यू आर एबल टू सी ओनली esophageal atresia but no fistula बेटा. टाइप बी में देर इज esophageal atresia बेटा along with a proximal fistula बच्चे, along with a proximal fistula. टाइप सी में बच्चे there is definitely an esophageal atresia with a distal fistula बेटा, that has to be remembered. टाइप ई, टाइप डी में डी फॉर दोनों you can remember, मतलब there is esophageal atresia along with proximal as well as a distal fistula beta. And type E mein beta, you are able to see the complete esophagus. That means there is no esophageal atresia over here. There is only a tracheoesophageal fistula that is going to be present in this condition. Clear hai baat? So easy. Type A is atresia, type B is atresia plus proximal fistula, type C is atresia plus distal fistula, type D is both fistulas along with atresia, and type E is only a tracheoesophageal fistula beta. If they ask you which is the most common subtype among this was a previous year question of your FMG exam. Bolo. Most common subtype among this has to be, and we know beta, yes, as somebody rightly pointed out, that esophageal atresia and tracheoesophageal fistula is a part of a group of anomalies called as vectoral anomalies beta. Very good. The most common type which is there beta, the most common type is going to be type C basically, when there is esophageal atresia along with the tracheoesophageal fistula beta. This distal tracheoesophageal fistula beta. This is the most common subtype that has to be remembered. Now, whenever a patient of esophageal atresia comes to us, we will try to pass a nasogastric or a orogastric tube beta, but we are going to get resistance after 10 centimeter. तो इसलिए भी हम क्या करेंगे, we will push the tube inside beta, but after that when we do a x-ray, what we are able to see, we are able to see very classically beta, there is a coiling of tube which has happened. So if the x-ray shows coiling of the nasogastric or the orogastric tube beta, it is a strong suspicion of esophageal atresia. But to confirm our diagnosis, if they ask you what is the investigation of choice, the investigation of choice has to be a CT with oral contrast which to be done, or a CECT to be done. ठीक है. Lastly, if they ask you about the treatment in this patient बच्चे, तो we know that the treatment in this patient has to be what? ठीक है. So CT with oral contrast is a diagnostic test which will confirm our diagnosis. Treatment. Now, if it is a case of a esophageal atresia only, that is type A, there are two possibilities. If both the ends are together with, if both the ends are close to each other beta, what we have to do? We have to immediately go for esophageal anastomosis beta. that is also called as a esophagostomy. But if both the ends are far away from each other, then we will have to wait for a span of few days beta. Until that time, we should do a feeding gastrostomy. And once both the ends have grown towards each other beta, then we have to go for a esophageal anastomosis or a esophagostomy. But final surgery is a anastomosis itself. But बाकी जो भी types है बेटा, but rest of the types which are there, type B, C, D and E, उनमें the common feature which is there, it is nothing else but a tracheoesophageal fistula beta, and therefore in all of them we have to do a surgery where we are going to first treat the fistula. Okay, we are going to cut the fistula, repair the trachea, and then do an esophageal anastomosis for atresia, and this is classically called as which surgery? Anybody? For all the other types, the surgery is classically called as anybody? Very good. It is classically known as the Cameroon head surgery beta. It is classically known as the Cameroon head surgery, that has to be remembered. Clear about? Chalo. It is a Cameroon head surgery that you have to remember बच्चे. ठीक है, चलो यहाँ पे this is the same one that I have told you. Next important bit, if I ask you about this one over here, क्या दिख रहा है यहाँ पे? The baby is actually having increased anteroposterior diameter of the chest beta, and increased anteroposterior diameter of chest is classically called as a barrel chest बच्चे. ठीक है. Apart from that, the baby is having this kind of abdomen beta which appears to be empty, or it appears to be scooped out. That classical type of abdomen is known as a scaphoid abdomen. So this baby will have classical features beta. First, the patient will have respiratory distress. Second, the heart of the baby will be shifted to the right side, that is known as dextrocardia. And third, the baby will have this scooped out abdomen, classically called as a scaphoid abdomen. What does this diagnosis suggest you of below? We know this is the classical triad remembered by the mnemonic RDS beta. This classical triad is a feature of, very good, CDH beta. This classical triad is usually a feature of a condition known as CDH beta. What is CDH? It is nothing else but a case of congenital diaphragmatic hernia. So this is a classical case of congenital diaphragmatic hernia beta. Okay, in that condition, what happens? There is a defect in the diaphragm beta, due to which the intestine or the bowel loops go into the thoracic cavity, and it will compress the lung beta. Therefore, lung is not able to develop properly, and the patient is going to develop a respiratory distress bache. As the defect is more commonly seen on the left side, the intestines herniate on the left side beta and push the heart towards the right side, called as dextrocardia. And as all the intestines go into the thoracic cavity, the abdomen appears empty, called as scaphoid abdomen. अब मुझे बताओ, congenital diaphragmatic hernia is of two types beta. One is called as the Bosch-Dallek and second is the Morgagni's variety. Which one is going to be the more common variety beta? One is the Bosch-Dallek, second is the Morgagni variety बच्चे. Okay, one is the Bosch-Dallek, second is the Morgagni. I have told you that Bosch-Dallek is commonly seen on the left side, whereas Morgagni's is more commonly seen on the right side beta. Whereas Bosch-Dallek, which is there, it is basically a posterolateral defect in the diaphragmatic wall beta, whereas Morgagni is basically an anteromedial defect in the diaphragmatic wall. तो Bosch-Dallek यहाँ पे होगा left side posterolateral part, Morgagni यहाँ पे होगा right side anteromedial part बच्चे. More common has to be the Bosch-Dallek hernia beta. Remember, yes, this has been a question. Bosch-Dallek is going to be the more common type. Now, important is, bache, if they ask you that in the patient as the child is having respiratory distress, what is the first line investigation? So we know first line investigation has to be a chest X-ray, और वहाँ पे we are able to see this classical picture बेटा. क्या दिख रहा है यहाँ पे? Here you are able to see that instead of a completely black lung filled beta, I am rather able to see air filled or gas filled bowel loops beta, right? So here on a chest X-ray, I am able to see bowel loops. Now bowel loops should be inside the abdomen. Here I am able to see bowel loops inside the thorax. That means the intestines or the bowel has herniated into the thoracic cavity due to a defect in the diaphragm. So this is a classical picture in patients of congenital diaphragmatic hernia. Investigation of choice अगर पूछेंगे तो again answer has to be beta the CT with oral contrast or a CECT. ठीक है, तो CT with oral contrast or CECT has to be the investigation of choice over here. If they ask you beta, in this child as there is a respiratory distress, ठीक है, what is done for the purpose of ventilation? Anybody? What is the airway of choice beta in this patient? बोलो. Whether it is a bag and mask ventilation or endotracheal intubation, what is the airway of choice in the patient? कैसे मैनेज करोगे पेशेंट का रेस्पिरेटरी डिस्ट्रेस? The airway of choice beta or emergency management in the patient will be done by Very good. It is the classical one, beta. Very good. It is the endotracheal intubation, beta. So endotracheal intubation is the airway of choice. Shabash. Okay. Whereas bag and mask ventilation will be absolutely contraindicated, beta. Reason is if I do a bag and mask ventilation, air will go into the patient's esophagus and from there to the intestine ultimately, due to which, beta, there will be more distension of the bowel loops and there will be more compression of the lungs, beta, which will actually worsen the child's condition, not improve. Okay, so airway of choice has to be endotracheal intubation. Okay, contraindicated is bag and mask ventilation. Treatment is the same, beta, for any hernia. You have to reduce back the herniated organ. So here you have to push back the intestines into the abdominal cavity, and after that you have to close the defect. If that defect is small, beta, I can close the defect of diaphragm with the help of sutures. But if that defect is larger, beta, then we have to cover the defect either with the help of a mesh or a patch. In congenital diaphragmatic hernia, it is better to use a prosthetic patch, beta, than a mesh, because mesh is going to shrink and the child is going to grow, beta. So it's better to use a patch. Okay? This is a classical picture of foreign body, bache. Now, when I talk about foreign body ingestion, beta, we know that foreign body ingestion can lead to impaction of the foreign body, beta, inside the airway of the patient, that is either the larynx, trachea or the bronchi, and or it can cause definitely, beta, foreign body impaction in the esophagus of the patient. If they ask you which is the most common age group for foreign body ingestion, obvious hai कि children are going to more commonly ingest the foreign body, and the most common foreign body ingested by children are going to be the coins, beta. Apart from coins, the other foreign bodies could be a disc or a button battery, the small circular batteries in watches or toys. It can be smaller toys as well, beta, or it can definitely be peanuts. Okay, so all of these are foreign bodies. Adult ke liye, if they ask you what is the most common foreign body, anybody, let me know in the chat box. More common foreign body in adults is going to be. Please tell me most common foreign body in adults. We know that whenever a patient of foreign body ingestion comes to us, majority of the patients are usually asymptomatic. If the patient develops any symptoms, the patient will be coming to you like this. This is the patient is not able to speak or breathe, beta, and that is classically called as a choking sensation. Or my patient would have other problems, beta, like if the foreign body is in the airway, my patient will have difficulty in breathing, that is dyspnea, or there will be noisy breathing called as stridor. Or my patient will also have difficulty in swallowing, beta, that is called as dysphagia if the foreign body is in the esophagus. Okay? Very good. Yes, the most common foreign body in adult patient is the fishbone, beta, whereas in elderly patient it has to be the loose teeth or the dentures, bache. Very good. That has to be remembered. If they ask you whenever a patient of foreign body ingestion comes to you, we know, beta, that the first line investigation has to be nothing else but a X-ray, beta. And whenever we do a X-ray, we have to take it in two views. One is the antero-posterior view or the AP view. Second is going to be the lateral view, beta. And once you have taken these X-rays in both the views, I hope all of you are quite aware about that. Now we have discussed as the AP diameter of trachea is more, the foreign body goes like this inside the trachea. So on AP view, it is going to appear slit-like, and on the lateral view, it will appear circular, beta. Whereas the transverse diameter of esophagus is more, beta. इसीलिए the foreign body goes like this inside the esophagus. That is, on the AP view it will appear circular, बच्चे, whereas on the lateral view it will appear slit like, beta. That has to be remembered. ठीक है, तो यहाँ देख सकते हो on AP view the foreign body is appearing slit like. On lateral view the foreign body is appearing circular. That means the location of foreign body is the trachea, beta. Whereas in the picture below, here on AP view it is appearing circular, whereas on the lateral view the foreign body is appearing slit like, beta. That means the location of the foreign body over here is the esophagus. Okay, apart from that you can also see this black air column. If the black air column is in front of the foreign body, beta, that means the trachea is in front of the foreign body. That means the foreign body is in the esophagus. Next important, beta, what is the treatment now? If I talk about the management of the treatment in patients of foreign body, see, if the foreign body is anywhere inside the airway, beta, airway matlab larynx, trachea, bronchi, anywhere inside the foreign body, we cannot leave the foreign body over there, and therefore we have to always go for an endoscopic removal, bache. We always have to go for an endoscopic removal in this condition. But if they say, beta, the foreign body is in the esophagus, then we have to first of all see the location of the foreign body. That means whether the foreign body is above the C6 or below the C6, beta. See, if they say if the foreign body is above the C6, bache, Okay, if the foreign body is above the C6, that means above the cricopharyngeal sphincter, then the foreign body is large and therefore we have to go for an endoscopic removal itself. But if the foreign body is below the C6, at the C6 we have the cricopharyngeal sphincter beta, and that cricopharyngeal sphincter is very it is the narrowest portion of the GIT. So, if the foreign body has crossed the cricopharyngeal sphincter, if the foreign body is below the CPS or below the C6 beta, that means it is a very small foreign body. And if it has already crossed the narrowest portion of GIT, it will be able to easily cross the all other parts of GIT. So, therefore, we should only continue observation and serial X-rays in the patient. Yes, after every 24 to 48 hours, take X-rays beta to see the movement of foreign body. On the serial X-rays beta, if the foreign body is moving distally and my patient is also asymptomatic, I should continue observation. But if on the serial X-rays beta my foreign body is not moving at all, or my patient turns symptomatic, like he starts having abdominal pain, I should go for an endoscopic removal of the patient beta. Clear about? So that is important to be remembered. याद रखना, how to differentiate that whether the foreign body is above the C6 or below the C6 beta on an X-ray. In clinical practice, we count the number of cervical vertebra, but here in your examination, it becomes very difficult to count the vertebral number. So what is the landmark that I've told you to keep in mind beta to assess the location? Anybody? Very good, shabash beta. It is the clavicle. याद रखना, if I say beta any part of the foreign body, if it is touching the clavicle, that means the foreign body has already crossed the C6, already crossed the cricopharyngeal sphincter. यहाँ पे it is touching the clavicle, that means it is below the C6 beta. Clear है बात? That has to be remembered. शाबाश. If they say beta that the child has ingested a disk battery or a button battery beta. As I've told you, if the child has ingested a disk battery or button battery, it is considered extremely dangerous beta. Why? Because disk batteries or button batteries are known to release alkalis beta. And as they release alkali, they can cause liquefactive necrosis and perforation beta. So therefore, disk battery ingestion is always an indication of an immediate endoscopic removal or an urgent endoscopic removal beta. Okay? Please tell me in the chat box how to differentiate a disk battery and a coin on an X-ray first. How I would differentiate that whether it is a disk battery or a coin on an X-ray. How to differentiate a disk battery or a button battery on the X-ray. So please remember beta, if it is going to be a disk battery bache, it is going to have double margins basically, but if it is going to be a coin beta, it is going to have a single margin. That has to be remembered. This is basically called as beveling beta. So double margin agar dikhti hai, beveling dikhti hai, so that means it is a disk battery. If single margin is seen, that means it is a coin. That is important to be remembered. Clear about? Chalo. Next important beta, let's talk about the favorite or sarkari question of your examiner, and that is nothing else but achalasia cardia. Now when I talk about a case of achalasia cardia beta, we know that achalasia cardia is a condition beta where the lower esophageal sphincter of the patient which is there beta does not relax. Okay, the lower esophageal sphincter which is there beta, it fails to relax in patient of achalasia cardia. Okay, now why it fails to relax? So the cause behind the primary achalasia cardia will be two of them beta. First, okay, as these muscles which are there beta, they are not getting stimulated. Now why these LES muscles are not getting stimulated? Because the ganglionic cells are absent at this side beta. Okay, so here basically there is loss of ganglionic cells bache. In which plexus? Anybody? That is a question. Please tell me now. In patients of achalasia cardia, there is loss of ganglionic cells in which plexus of GIT? Whether it is the Meissner's plexus of GIT or the myenteric plexus of GIT. Anybody? Very good. There is loss of ganglionic cells beta in the myenteric plexus of GIT. Myenteric matlab muscles. Okay? Or we can even call it as the Orbach's plexus of GIT beta. Okay? So there is loss of ganglionic cells basically in the myenteric or the Orbach's plexus of GIT. That is the reason why the patient is having achalasia cardia beta. or second is definitely due to deficiency of the inhibitory neurotransmitters in GIT, and those neurotransmitters are, one is nitric oxide and second is VIP. Due to deficiency of nitric oxide or VIP also the patient may develop achalasia cardia beta. अगर वो बोलेंगे व्हाट इज द सिम्टम, तो प्लीज रिमेंबर बेटा there is a classical triad in patients of achalasia cardia and Zenker's diverticulum. Yes, both the conditions, Zenker's as well as achalasia, will have the same classical triad beta. And what is the classical triad? Let's talk about it. First of all beta, here as the patient's lower esophageal sphincter is contracted, the patient is not able to swallow properly beta. That is going to cause dysphagia. So here the patient is going to have bache a continuous dysphagia. But in Zenker's diverticulum, there is an intermittent dysphagia which will be seen. That is the important difference. Okay? Next important thing, beta, continuous dysphagia is also seen in cancers. So how do you differentiate? So please remember, in patients of esophageal carcinoma beta or esophageal cancer, there is more dysphagia to solids beta. But in patients of achalasia cardia, there is more dysphagia to liquids. I hope all of you are quite aware about that, right? Here in the patients of achalasia cardia, there is more dysphagia to liquids. First feature. Second, as the food which is there beta, it keeps collecting in the upper part of the esophagus over here. As the food over here beta keeps on collecting in the upper part of the esophagus, it gets infected and leads to a foul smell in the patient beta, or bad breath known as halitosis. And third important beta, all that food may come back into the patient's mouth called as regurgitation. So the classical triad of achalasia and Zenker's is going to be dysphagia, halitosis and regurgitation. But in achalasia there is continuous dysphagia, and Zenker's there is intermittent dysphagia. In achalasia there is more dysphagia to liquids. In esophageal cancer there is more dysphagia to solids. That is how you differentiate these conditions. Okay? If they ask you beta what is going to be the investigation of choice, yaad rakhna, what is the investigation of choice for achalasia cardia? Answer me in the chat box jaldi se, because this is the commonest mistake that people do. Bolo. Investigation of choice for achalasia cardia, anybody? Very good, very good, very good, very good. Thankfully you did not answer it as barium swallow. Okay, yes, shabash. All of you are right. That is nothing else but an esophageal manometry beta. Mano matlab pressure, metry matlab measurement. Okay? So please remember, esophageal manometry is going to be the investigation of choice for achalasia cardia or any motility disorder of esophagus like diffuse esophageal spasm also. In this condition, as the ileus is contracted, the pressure at the ileus is very, very high beta. The pressure in patients of achalasia cardia will range from 26 to 100 millimeters of mercury. That has to be remembered, bache. Clear about? That is important. If they ask you beta, if you do a barium swallow, then what will be the feature that is seen? So on the barium swallow in a patient of achalasia cardia beta, we are able to see a very classical feature. There is sudden narrowing of the lower esophageal sphincter. Therefore, you are able to see this classical appearance called as the bird beak appearance beta. Okay? So bird beak appearance is going to be seen, which is also known as the, this classical bird beak appearance can also be called as the pencil tip sign. Shabash. Please remember, this classical bird beak appearance can also be called as the bird beak sign, pencil tip sign, but not the rat tail sign. Okay? You should not call it as a rat tail sign. Very good. Shouldering effect dikha. Very good. So bird beak appearance or the pencil tip sign, you can call this condition. Now important is beta, if they say barium swallow pe if there is bird beak appearance, it is a case of achalasia cardia. Barium enema pe bird beak appearance is a feature of anybody? Barium enema pe bird beak appearance will be a feature of anybody? Not interception beta, not Hirschsprungs. Barium enema पे bird beak appearance, bird of prey sign, ace of spade sign. No. Or coffee bean sign on X-ray abdo. What is that condition? Bird beak appearance on barium enema is a feature of sigmoid volvulus. It is a classical picture of sigmoid volvulus. Do not forget it. याद रखना है बात. ठीक है? Yes. Treatment of choice beta, if they ask you, not colon cancer. Colon cancer में ample core appearance होता है. ठीक है? तो please remember beta, it has to be नथिंग एल्स बट सिग्मोइड वॉल्वुलस, जिस पे बर्ड बिक अपीयरेंस दिखता है ऑन बेरियम एनिमा, ठीक है। नेक्स्ट इंपॉर्टेंट, इफ दे आस्क यू बेटा व्हाट इज द ट्रीटमेंट ऑफ चॉइस इन दिस पेशेंट, तो याद रखना वी कैन ट्राई मल्टीपल थिंग्स बेटा ओवर हियर, but treatment of choice which is there ultimately beta is a surgery that is called as a Heller's cardiomyotomy surgery beta. In Heller's myotomy or in Heller's cardiomyotomy surgery, we make incision over the lower esophageal sphincter muscles beta, which will help them to relax properly, ठीक है। So Heller's myotomy surgery will be the treatment of choice or surgery of choice beta in this condition. Please remember that. No, CCBs and everything can be tried, but it is not the treatment of choice. Treatment of choice पूछे तो आंसर is Heller's myotomy surgery. Clear है बात? If they ask you what can be complication of achalasia cardia, so please remember in patients of achalasia cardia, due to collection of food and there will be damage of esophageal mucosa causing esophagitis initially beta, but later on the patient will develop a squamous cell carcinoma of lung, squamous cell carcinoma of esophagus beta, and this squamous cell carcinoma of esophagus is usually seen in the middle 1/3 or the upper 2/3 of the esophagus बच्चे। Clear है बात? That is important. Next important, if I talk about this condition over here, what is this? Here you are able to see again a barium swallow picture, and on that barium swallow beta, we are able to see that the whole esophagus appears to be contracted beta, right? There is spasm in the whole esophagus. So if there is spasm in the whole esophagus beta, this condition is known as DES, that is a diffuse esophageal spasm. And diffuse esophageal spasm which is there beta, it is going to give a very classical appearance on barium swallow, and this classical appearance of barium swallow is known as the corkscrew appearance beta. It is classically known as the corkscrew appearance, also known as the rosary bead appearance बच्चे। तो diffuse esophageal spasm on the barium swallow gives us the corkscrew appearance or the rosary bead appearance beta. इसमें भी the investigation of choice is going to be manometry, and when we see the pressure in patients of diffuse esophageal spasm beta, the pressure is going to exceed more than 120 millimeters of mercury. When the pressure is more than equal to 120 millimeters of mercury, that is a diagnosis of diffuse esophageal spasm. Clear है बात? That is important. Treatment here also is a myotomy surgery itself. Next is a question beta where they say we have a 30-year-old male Kamlesh chronic alcoholic patient beta presents to the emergency room with chest pain and retching episodes. He gives history of binge drinking बच्चे. On palpation, crepitus is going to be felt. What is the likely diagnosis बच्चे? What is the likely diagnosis? Anybody? बोलो what is the likely diagnosis of this condition? Very good beta, shabash. It is a classical picture of a Boerhaave syndrome. Okay, it is a classical case of a Boerhaave syndrome beta. Please remember that. If I talk about Boerhaave syndrome बच्चे, please remember Boerhaave syndrome is a tear inside the esophagus. Is it a partial tear of the esophagus or a perforation of the esophagus? Anybody? It is not malarious tear. It is not malarious tear. Malarious में there is only bleeding which happens. Chest pain and crepitus and all of these features are not a feature of malarious. ठीक है? Very good. It is a perforation beta. Malarious tear is a partial tear inside the esophageal wall, whereas Boerhaave syndrome which is there. So please remember this is malarious tear जहाँ पे there is only a partial tear inside the esophageal wall involving the mucosa and submucosa. But Boerhaave syndrome which is there, it is a complete perforation or a rupture of the esophageal wall beta, due to which definitely beta there is leakage of a lot of substances, like there is leakage of gas inside the mediastinum beta causing a pneumomediastinum in the patient, one thing, and second there is leakage of substances into the mediastinal cavity causing inflammation known as mediastinitis, जिसकी वजह से the patient has a very severe chest pain like almost MI beta. ठीक है? So please remember beta, this is a case of Boerhaave syndrome which is nothing else but an esophageal perforation or esophageal rupture बच्चे. In this patients beta there is a classical triad that is seen. And what is the classical triad? Please remember that Boerhaave syndrome and in case of malarious tear, in both the conditions definitely there is going to be a history of chronic alcoholic patient with binge drinking or binge eating episode and a lot of retching and vomiting. But in malarious, there is only hematemesis or upper GI bleeding which is present. But in Boerhaave, there will be multiple other features like chest pain, subcutaneous emphysema, and pneumomediastinum like features. Okay? Very good, all of you. Yes, the classical triad that is seen in patients of Boerhaave syndrome beta is classically known as the macular triad. If they ask you what is the mnemonic to remember the macular triad, we know the mnemonic to remember the macular triad is CVS beta. Now, when I talk about CVS, what does the CVS mean? C stands for chest pain, which occurs due to mediastinitis, which is very severe. V stands for vomiting, or at least they can write retching episode beta. And S stands for subcutaneous emphysema. Here they have mentioned about that crepitus, na? That crepitus is basically due to the emphysema itself in the patient beta. Clear? Hai? So that is important. Next important, if they ask you बच्चे that in patients of Borhav syndrome, first line investigation will be, we know as the patient has a very severe chest pain, first line investigations have to be ECG and a chest X-ray. When we do a chest X-ray, due to pneumomediastinum beta, you are able to see a black air shadow below the heart beta, classically called as the continuous diaphragm sign. Okay, so here we are able to see a very classical continuous diaphragm sign in the patient बच्चे. That has to be remembered. Apart from this, you have to remember one more thing beta, that in this patient, if they ask you what is the investigation of choice, तो याद रखना investigation of choice has to be again a CT with oral contrast or a CECT, whatever you call it. So CT with oral contrast or a CECT beta has to be the investigation of choice, which can tell you about the perforated part. And if they ask you treatment beta, तो याद रख लो अभी treatment. If they ask you, so first line treatment will always be a basic resuscitation beta. Reason, please remember that my patient of Borhav syndrome can be hemodynamically unstable at times. इसीलिए the first line management should be a basic resuscitation, but the definitive management, if they say beta, then you have to answer it as definitive management would be, we have to open the patient's chest over here beta. That is nothing else but an exploratory thoracotomy to be done. Along with that, if the mediastinum is infected beta, then we have to clean the mediastinum bit, that is known as mediastinal lavage. Along with that, we may or may not go for an immediate repair. That is either an immediate repair or a delayed repair will be done beta, depending on the time. If the patient has presented to us early, within 12 hours itself beta after perforation, then we can go for an immediate repair. But if the patient has presented to us late beta after 12 hours of perforation, then infection will be more. Therefore, you should not go for an immediate repair. You should go for a delayed repair after few days. Clear? Chalo, that is important. Next important beta, if I talk about, is the upper GI hemorrhage. If I talk about upper GI hemorrhage beta, so please remember that most common cause of upper GI hemorrhage which is there and lower GI hemorrhage which is there, it is differentiated based on which ligament. Anybody? What is that ligament which can actually differentiate between upper and lower GI hemorrhage? Anybody? It is classically called as what? Ligament of threads beta. Please remember it is known as the ligament of threads. That was a previous question. Any bleeding above ligament of threads is upper GI hemorrhage. Any bleeding below ligament of threads is lower GI hemorrhage. If they ask you most common cause of upper GI hemorrhage in adults, याद रखना most common cause of upper GI hemorrhage beta in patients is going to be PUD or peptic ulcer disease followed by gastritis बच्चे. Okay, that has to be remembered. And we know the most common vessel to bleed in patients of peptic ulcer disease has to be the gastroduodenal artery beta. Most common vessel to bleed in patients of peptic ulcer disease is the gastroduodenal artery. And हमें पता है upper GI hemorrhage will manifest as either hematemesis, that is blood in the vomitus, or black tarry stools known as melena beta. Whereas lower GI hemorrhage, if I talk about beta, it will manifest as fresh blood in stools known as hematochezia. याद रखना, melena is not a feature of lower GI hemorrhage. Melena is always a feature of upper GI hemorrhage. Lower GI hemorrhage की अगर मैं बात करूं, where there is hematochezia in the patients beta, the most common cause for lower GI hemorrhage in adults has to be hemorrhoids बच्चे, piles. Most common cause of lower GI hemorrhage in children has to be rectal polyps beta. Whereas the most common cause of rectal lower GI hemorrhage in elderly patients will be diverticulitis. Clear है? Now important is if they ask you बच्चे that what is this condition that you are able to see over here. Here also we are able to see a condition beta where my patient is nothing, my patient is a chronic alcoholic beta, and my alcoholic patient recently had a binge drinking episode. Okay, my alcoholic patient recently had a binge drinking episode बच्चे, ठीक है, and my patient comes to me with a lot of vomiting or retching beta. My patient comes to me with a lot of vomiting or retching now, ठीक है, and now patient is now having basically hematemesis. My patient is coming to me with hematemesis beta, that there is blood in the vomitus. What is the likely diagnosis? Now if they ask you what is the diagnosis beta, then the diagnosis has to be Mallory vs tear beta. ठीक है, here see Can you see? I've just said there is hematemesis beta. Did I say only any chest pain? Did I say that the patient is having any kind of subcutaneous emphysema or crepitus? Did I say is there any continuous diaphragm sign on the x-ray? नहीं ना, बस इतना ही हिस्ट्री होगा. दैट इज मैलरी वेस्टियर. ठीक है, सो डू रिमेंबर दैट दिस इज अ केस ऑफ मैलरी वेस्टियर बेटा. वी नो इट इज अ longitudinal or a partial tear in the esophageal wall which starts from the gastroesophageal junction beta, as you are able to see over here. Okay, investigation of choice is upper GI endoscopy, as you are able to see in the picture. And which is the most common vessel to bleed in a malarial vein? Please let me know that in the chat box. The most common vessel to bleed in patients of malarial vein. Anybody? Very good, beta. Yes, the most common vessel to bleed in patients of malarial vein has to be the left gastric artery, beta. याद रखना, लेफ्ट गैस्ट्रिक आर्टरी इज द मोस्ट कॉमन वेसल टू ब्लीड इन 3 कंडीशंस बेटा. ठीक है, इट इज बेसिकली द malarial vein, gastric ulcer, and it is going to be gastritis. याद रखना, the management is nothing else but it is a self-limiting condition, so you should go for just like most of the cases will show a spontaneous resolution, so nothing is required in patients of malarial vein beta. But in case if the bleeding doesn't stop, then we can go for angioembolization, which ठीक है, then we have to go for an angioembolization. Okay, 2 minutes का break, then we will start with a new link बेटा. ठीक है.